first event that doesn't quite fully validate the criteria for MS. People who have CIS may develop MS later on, particularly if they have some findings elsewhere in their central nervous system that is suggestive of MS. So let's say Vanessa has this inflammation of her optic nerve, but she also has a lesion in her brain. While she doesn't validate criteria for multiple sclerosis, we'll know she is at higher risk. Usually people who have lesions in their brain that accompanies their CIS have a risk of developing MS later on about 60 to 80%. People who don't have any lesions have a lower risk, maybe around 20%. So this is really what we're trying to define when we see people with a first attack, is trying to identify, do they have MS or not? And if they don't, what is their risk of developing MS later on?
So, if someone diagnosed with CIS begins a disease modifying therapy, is it possible for them to prevent their CIS from developing into MS?
Absolutely. It's generally accepted now that people who have a CIS with other signs suggestive of MS, usually a brain lesion, it's recommended that we start disease modifying therapy. It's because research trials have shown that we can not only prevent the occurrence of a second event, what we will call clinically definite MS, but we can also minimize the risk of later disability progression.
Numbness in the face, or arms, or legs is also one of the most common symptoms experienced by people who are diagnosed with MS. Carmen says she's experiencing numbness, tingling, and hypersensitivity in her feet. Her doctor has told her that it could be MS, but advised her to wait and see if other symptoms develop. How common is numbness and tingling in MS? And is there any treatment to relieve those symptoms while someone has yet to be diagnosed?
Yeah, this is really a very common symptoms that people can have. The sensory, this numbness, this tingling, burning sensations, sometimes electric sensations in the body. People, a lot of my patients may experience this and come with these symptoms at time of their first visit. And the good news is that these symptoms can be addressed with medication in particular. They usually don't respond well to regular common painkiller like ibuprofen or Tylenol, but we can decrease the intensity of those symptoms and sometimes really reduce them to the point that patients don't even notice these symptoms anymore with the help of other types of medications, usually anti-seizure medications or antidepressants. So common medications are gabapentin, duloxetine, pregabalin. Those are all kind of tools that we have in our toolbox to help folks with these symptoms. It's super important that people talk about those symptoms and how painful they are, because those are not visible symptoms. So the neurologist might not know that you experience those symptoms unless you let them know. And so it's really important to bring this up to an initial visit, because as we're working towards a diagnosis, we can prescribe the right medication for people to have relief.
So, as people are going through this diagnostic process, it's not unusual for them to experience feelings of uncertainty, fear. And I'm wondering whether you can recommend some strategies or resources that might help manage those feelings, as someone is waiting to be diagnosed.
I would say that the first step is to establish a trusting relationship with your care team, making sure that you know how to ask questions and how to reach out to your care team should you have any need. It's important to understand the timeline of tests and what to expect and what do the results mean, because this can really help alleviate a lot of the anxiety. I often find that learning about MS during this period of questioning and pre-diagnosis can help a lot of people, not all, but a lot of people. So I often recommend resources like the National MS Society website, your podcast, so that people can hear about, what it is like to be diagnosed with MS. Some people don't know anyone who has MS. They don't know what to expect. So this can give them really an understanding of our current understanding of multiple sclerosis and find hope in the resources that exist. I also recommend that people build a strong support system around them. It's important to have people who care, who can be there to listen to our fears and concerns and be there for us. And that can be family members, that can be friends, coworkers. Sometimes, people need to have a counselor,
Thanks,
somebody,
Gilbert.
a
Appreciate you
professional
working,
that
buddy.
supports.
Holy fuck, is this wrong?
Thank you, guys. Love
Capacity.
you.
It's an important question to ask their care team. Where can they find mental health support during that time?
You're breathtaking. You're all breathtaking.
Stage.
Yeah. I often find that the first thing that's impacted by the anxiety and stress of this pre-diagnosis phase is sleep. And it's really important to make this time about rest and recovery, having a strong, strong sleep hygiene, good routine, a sleep schedule. Really optimizing sleep is going to be important. You need to have sleep to really be able to understand the information that's given to you and feel hopeful, feel good again. Being able to be surrounded by loved one, making sure that you don't cut yourself off from those who love you, but that you reach out for help. That doesn't mean, just being engaged in way too many social activities where you feel you have to perform. This is a time for you. This is a time that's critical for you. So really surrounding by people who are listening and who care about you. I often find that for those who can exercise, in spite of the symptoms they may be experiencing, that exercise can also help release some of the tension. So if that's helpful, having some kind of light, restorative exercise routine during that time can be helpful. For others, it'll be meditation, prayer, connecting, with their faith. Can be an important way to kind of cope and find that inner peace.
Fatigue is another common symptom of MS. It's reported that as many as 75 to 95% of all people with MS experience fatigue. Now, fatigue is more than just feeling a little tired. How would you define fatigue, and why is it so common in multiple sclerosis?
So fatigue is an overwhelming form of tiredness that people who don't know MS, who don't live with MS, I don't think we can fully understand. Even as a doctor who cares for people with MS on a day-to-day basis, I can have all the empathy of the world, but I don't know in my bones what it means to experience this overwhelming, crushing sense of fatigue that can be present from the morning, even after a long night's sleep, that can impact day-to-day activities, that can worsen with even just minimal activity, worsen with heat, other kind of factors as well. So it's really an invisible symptom that has a very significant impact on the quality of life and on the day-to-day activities of people with MS. Now, your second question was, why is it so common? And I wish I had an answer for you. I think that's $1 million question. My hypothesis is that, there's definitely a role of inflammation in this fatigue. We see fatigue even before the diagnosis of MS in that what we call prodromal phase, and that's related to this kind of dysregulated inflammation. And we see also fatigue in other inflammatory conditions. So I suspect inflammation has a role to play, and sometimes when we control the inflammation better, people can feel a little bit less tired. Researchers are also studying how fatigue can reflect how the brain is impacted by MS, how people who have fatigue require more brain areas to be involved to complete tasks than people who don't have fatigue. Even some researchers are looking are there areas of the brain that can be affected by MS that are directly linked to fatigue? But I don't think that we have truly answered that question at this time.
When it comes to managing fatigue, are there medications available? Are there alternative strategies or lifestyle modifications that can be used to help manage fatigue? What's there?
Yeah, this is also it's one of the most complicated aspect of MS management in my experience. Usually when I approach somebody who is living with MS fatigue, the first step for me is to try to explore and understand what other factors can exist that makes this fatigue worse, whether it is sleep apnea, mental health challenges and depression, sometimes physical deconditioning, and try to really address those first. Are there other superimposed condition, a dysfunctioning thyroid, for instance, too? So I will run a battery of tests, may order a referral for a sleep clinic, and really try to understand, are they aggravating factors? Then, once we have rolled this out or treated these worsening factors, then we can really address the MS primary fatigue. We don't currently have medications that are FDA approved to treat MS fatigue, but we regularly use in our practice some medications that were developed for other conditions. So for instance, amantadine is a medication that was initially developed for Parkinson's disease that's routinely used. Modafinil, medication used to treat narcolepsy, is frequently used for people with MS. So again, this is kind of something that people can discuss with their neurologist, whether there's a specific medication that can be useful. I'm a big fan of non-pharmacological management of fatigue. I think this is super important. I know you interviewed my colleague and friend, Dr. Lisa Doggett, to talk about lifestyle modification. That would be a good episode to listen to. And she does an amazing job in our clinic in really addressing the symptom. And that's, there's several things that can help. First, optimizing sleep, making sure that, if sleep is interrupted by pain or other symptoms, can we treat that so that sleep is optimized? Can people have a good sleep routine, again, that they can rely on? But that's often not sufficient to help with fatigue. Exercise is also a big component of our managing of our approach to manage fatigue, and we frequently recommend regular exercise, low impact exercise, water exercises, particularly tailored to the abilities of our patients. Then there also need to be strategies to conserve energy. They're deciding what are activities worth doing. If shopping at the grocery store is not worth spending your energy on, order online. Delegate to team members or family members some kind of energy draining activities is an important component. Finding new ways to do things that don't use up your energy so that you can save it for the things that truly matter. So this is kind of a multi-step approach and often requires a lot of coaching and a lot of reflection. I recommend people keep a fatigue diary to really know what are the triggers and how they can really respond differently so that they have energy for their loved one, for themselves, and for the things they love to do.
Difficulty walking is one of the most common mobility limitations in MS. What's the first thing someone should do if they notice their gait or balance is off?
Talk to your doctor. People with MS can experience gait changes or imbalance for many different reasons. It may be related to MS, MS can cause weakness, stiffness, imbalance based on where those lesions occur in the central nervous system, and is definitely a reason why people will have gait abnormalities. But there are also other reasons why people may experience some changes with their gait. Osteoarthritis is very common as people get older. Maybe that needs to be looked at. Sometimes people have neuropathy or vitamin deficiency causing some kind of nerve changes that also needs to be addressed. So the neurologist can really evaluate the type of gait changes that people experience and really think, is this MS, is this not MS? And then they can have a plan of care developed with their patients to be able to, it will be a multimodal approach. Also something that I'm very, I think is really important for people to hear is that if you have difficulties with your gait and imbalance and you're falling, you need to have a system to alert in case of a fall, whether it is a life alert system that's around the neck or in the home, whether it is a smartwatch that detects falls. I think this is really critical because falls can have a lot of complications that set people back.
Spasticity is another MS symptom that can be physically limiting and even painful. What is spasticity and how common is it in people living with MS?
So spasticity is a feeling of stiffness or spasm can occur in any part of the body, usually limbs, that is related to demyelination or nerve damage along the motor tracts within the central nervous system, either in the brain or the spinal cord. And this spasticity is it's fairly common in MS. It can range from very mild, occasional spasms to very severe, impacting one person's ability to walk or causing pain, as you said. But I would say that maybe around 40 to 80% of people with MS can experience during their lifetime some form of spasticity.
Joan is asking if there are specific triggers that might make spasticity worse.
Yeah, absolutely. First is, spasticity is a process of stiffness that will worsen with sudden movement and position change. So making sure that when, people relax their limbs slowly rather than abruptly is important. Also, people report that their spasticity worsen in the context of extreme temperature, humidity, or when they have a fever due to an infection, for example. I also find that constipation can be a trigger for spasticity that's often not talked about. And that's especially important because I've seen multiple people in my practice treated with opioid medication because of pain due to spasticity. And those medications can worsen constipation. And we go into this cycle of worsened spasticity and constipation, where in truth, we need to get people off these medications and on the proper treatment for their spasticity.
Well,
They
can you
just did a
talk
live
about some of the
thing this morning
complications of
about
spasticity if it's
caffeine,
left
alcohol, and stuff
untreated?
in veterans with MS.
Yeah, there's multiple
So I'm just
multiple
waiting
ones.
to see
I
when they
would
go
say
live
that
because I want to add
one
that onto
that's
the thing too.
really important is pain. Spasticity can cause pain due to acute spasms, or it can cause pain due to a constant feeling of tightness. And
Don't
this
you
can
love when you go
disrupt
live and you
people's
forget to set up your
sleep,
stream deck?
prevent them from, doing their day-to-day activities, and it can be very, very debilitating. Also, spasticity can impair one's gait. When people have difficulty with their movement, where their limbs are not as flexible, they have difficulty with walking, that can lead to falls. Also, in extreme cases of spasticity, we can see that people cannot move their joints as smoothly, and that can lead to more permanent deformation, often at the feet or at the hands. So those are all things to look for.
Well, you shared some really useful information that should make identifying some of the signs and symptoms of MS easier. And you've shared some excellent steps for being proactive during the diagnostic process. Let me ask you, what would you say are the top 3 takeaways that you'd like our viewers to remember?
Well, first is that MS symptoms vary from person to person, and that many symptoms of MS are invisible. So open up about what you feel and what you're experiencing. The second point I'd like to make is that your neurologist, your doctor, and your care team are there to help you with your symptoms, not just prescribe disease-modifying therapies. Part of your plan of care should be addressing these symptoms with either medication or non-pharmacological approaches.
Nope.
And then the third point I'd like to make is relates to what we talk about with regard to falls. And falls can really set people with MS back and have multiple complications. And people need to know that they can use alert system to be able to alert others in the context of a fall.
I want to thank everyone who submitted some great questions, and thank you, Dr. Freeman, for being with us today.
It's my pleasure to be with you, John. Thank you for the invitation.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection
I have that on
programs
my
like
calendar.
self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Freeman for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of
Apparently I need
you.
to confirm.
Getting
this
your
fucking
feedback
appointment
on today's
because I asked for it to
webcast
be
is
telehealth.
important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference.
Clinic is a joke.
The
and
information
parents
you
just fucking get
provide
out of it.
helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Leora Freeman and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society. I also chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. Before we get started, I want to acknowledge and thank today's contributing national sponsor, ANI Pharmaceuticals. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Spasticity is a common symptom of MS that can interfere with walking, movement, speech, and many other activities of daily living. Dr. Michelle Cameron is with us today to help us understand what spasticity is and to share some strategies for managing spasticity. Dr. Cameron is a neurologist and physical therapist, a professor in the Department of Neurology at Oregon Health and Science University, interim chief of neurology at the VA Portland Healthcare System, and co-director of the VA MS Center of Excellence West. Welcome, Dr. Cameron. Thanks for joining us today.
Thank you, John. It's a pleasure to be here.
Well, I guess the best place to start is right at the beginning. What exactly is spasticity, And how common is it among people living with MS?
Good question. Exactly. We better define our terms. So spasticity is really a tightness or a stiffness of the muscles, and often comes with painful contractions or muscle spasms, involuntary movements of the muscles, and these can either bend the limbs or straighten them out. But these movements happen without control of the individual. So the muscles just move when they don't want them to, or when they do want to move, the muscles are stiff and tight and hard to move. And about 80% of people with MS do experience some form of spasticity.
Do we know what causes spasticity? And I think you've already started to answer the second part of my question. How does spasticity affect someone?
So what causes spasticity is the damage to the nerves of the brain and spinal cord that we know MS does. I mean, MS is primarily a disease of the brain and spinal cord. When that's damaged, instead of the brain and spinal cord finally controlling muscle contractions and often actually dampening them, those muscle contractions are without control or inadequately controlled. So the muscle starts to move or the muscle gets stretched, and then it just moves excessively. The impact it can have, so it usually affects the legs more than the arms. And when it does that, this can cause obviously difficulty with controlling your own movements, but it can cause pain or discomfort. And if you don't control your movements well, this can affect your ability to walk safely, your balance, your mobility. This happens during the night. It can actually wake people up from sleep. And sadly, it not only wakes the person with MS, as you said, your wife had MS for many, many years, it can actually affect the bed partner. If their legs start kicking, they kick the person who might be with them. And then if it does affect the arms and the hands, it can affect the ability to do things like writing, feeding oneself, dressing. And not surprisingly, that impact then gets more broad and can affect people's mood, their quality of life.
And what happens if spasticity is left untreated?
So I think this is sort of a nuanced answer, actually. If spasticity is mild, it's often just fine to leave it untreated on the basis that we mostly treat it with medications. We'll get to that a little later. Those more medications has the risk of more side effects. So mild spasticity is often left alone. But when it starts to impact somebody's quality of life, their ability to do things safely, we can start to see, as I say, problems with quality of life. If we don't treat it, we can see falls, we can see trouble with self-care. We can actually, if left alone for long enough, it's thought that this contributes to contractures, which is basically the muscles are tight, and if they stay that way for long enough, then they get stuck in that shortened position, and the joints get stuck in those shortened positions where they can't be moved.
Well, as unpleasant, uncomfortable, and even painful as spasticity might be, are there any potential benefits to spasticity?
Mayo Clinic is a
There
joke.
actually are, and it's a good point. I think sometimes we think, oh, if it's a symptom of MS, it must be all bad. But we know that, as I said, spasticity is mostly in the legs. It can happen when the legs are weak. And if your legs are weak, they can be hard to stand on. You can't get enough contraction. Actually, the spasticity itself may provide some support to help hold you up for mobility. So it's a fine line of, you don't want to treat spasticity so much that then your muscles get flimsy and weaker. So some amount of tone or contraction in the muscle is actually helpful. It supports you.
Well, we heard from Carrie, who said she can't bend her leg like she used to. And Carrie wants to know if her doctor can do an assessment to determine if this is spasticity or is it something else?
Absolutely. So I think in this COVID or post-COVID era, it's important to realize that the doctor can do an assessment, but we really can't do that assessment virtually. We actually have to touch you and move your legs around if this is your leg. So it'll require an in-clinic exam. Once you're in the clinic, we'll do a variety of things. First of all, we'll probably know that the reflex hammer will tap out your reflexes. And usually the reflexes are extra jumpy together with spasticity. So that's a sign that this is probably spasticity. And then we'll actually move your leg, and we'll move it at different speeds, slowly and then quickly, to see if it resists. Spasticity resists most when you try to move fast, actually. So if we try to move your leg very slowly, probably be able to bend it. But if we try to move it quickly, it'll become a lot more difficult. And that will help. We'll also want to be sure that we're not dealing with weakness, and that's why you can't bend your leg, because the muscles that bend it are weak. Or that you're having trouble bending because of something we call ataxia, which is you can move, but you can't move where you want to. That control of the movement in the right direction can be impaired. So we will take a close look, tap out the reflexes, move you passively, test your strength, and look at your voluntary attempts at movement to try and understand if this is spasticity or something else.
Juanita wrote in and she's wondering what she can do to lessen the likelihood of experiencing spasticity. Are there triggers that might actually make spasticity worse?
So there's really sort of two levels of answer to this. I think the first level is, what can you do to lessen the likelihood of experiencing any MS symptom, both now and more importantly in the future? And that's really work with your provider around disease modifying therapy. And that's really to protect you from what might come later. As we know, we have a wealth of disease modifying therapies to help slow down MS. And so that's sort of the first piece of the solution. And then there's, okay, you have spasticity. It fluctuates. Sometimes it's better, sometimes it's worse. So are there things you can do to keep it calm in the now? And there are a variety of things you can do for that. Often looking for yourself for triggers. For many people, this can be extremes of temperature, usually cold actually. We'll tend to cold weather, but also extremes of heat. Sudden movements. So as I said, moving the muscles quickly will bring out spasticity. Moving them more slowly will not. So trying to avoid sudden movements. Certain positions may bring it out. Fatigue, stress, pain, a full bladder or bowel, infections, and quite commonly infections that don't seem like they're related. It's like, why are they checking me for a urinary tract infection when I say my legs won't bend? Urinary tract infections can make all MS symptoms worse. And sometimes even tight clothing can make spasticity worse. So quite a range of things, if you have spasticity, can actually aggravate it, irritate it. And then, as I said, remember your disease modifying therapy to try and not let the disease itself keep coming or flare up.
Strategies to treat or manage spasticity can include exercise, medication, devices, changes in daily activities, or your healthcare provider may refer you to a physical therapist or occupational therapist. Now, before we talk about some of these strategies, can you tell us what the goal of treatment is when it comes to treating spasticity?
Sure, John. Excellent point. And I think this brings up often an important point in treating any symptom of MS. Really, the purpose of treating the symptoms of treating spasticity is to make your life better. So if spasticity is interfering with your daily activities, if it's interfering with your sleep, your ability to walk, the goal of the treatment is to make that better, to have less interference with your daily life from this symptom. And obviously also not to replace that problem with a second problem with a side effect. So we're trying to reduce the negative effects of spasticity on you and minimize your sort of paying for that with something else. So we'll have some therapies that are really just trying to reduce the spasticity. There will be treatments that focus on working around it. So is there a different way to do an activity? And then lastly, to avoid serious complications, like we talked about, contractures, those muscles tightening and being stuck that way. And so we're certainly, by controlling spasticity, trying to prevent long-term complications of having it.
Marissa tells us that she's read conflicting information about stretching. She's read that it's good for spasticity, but she's also heard that it can trigger spasticity. What would you tell Marissa about the importance of stretching as one way to help manage spasticity?
So I think let's deal with this conflict of is stretching good or is stretching bad or a trigger. So as I've mentioned a few times here, fast movements can trigger spasticity. So as we look at stretching, it's important to do it slowly. So if you quickly move the arm and it has spasticity, it'll just bounce back and pull. You need to move
Actually,
it
when I was in Alaska, I used to go to a place
stretching
called Stretch
may
Zone.
be helpful. Fast stretching is likely to
I used
be
to
a
get-
trigger.
I used to go
When we
there,
look
and
at
basically
slow
it's assisted
stretching,
stretching essentially.
This has certainly been considered
Like you'd
the
lay on a
first
table, they'd
line
strap you
of
down for parts that you
management
didn't
of
move, and they would
spasticity
actually
for many,
move
many
your body
years.
for
This
you.
is because if you think that the muscle
And that
tends
felt
to
like it did a
shorten,
lot, but that
it
was
seems
a while
logical
ago.
that
And
if
then
we
I couldn't
try
get
to lengthen it, that would
I couldn't
help.
get the insurance to agree.
It's a little tricky for me to promise you that will work. That's the only tricky piece,
I couldn't get
which is
the I couldn't get the
we don't
insurance
really
to
have
agree
good
to
data
pay
or
it
evidence
as or
to
do like a
show us
reimbursement
that
as a
stretching
an
is helpful,
external.
but I would say that
service.
most patients find that it is or say that it is,
Which sucks.
and that doing
'Cause
so
it felt like it was- it
consistently on
felt
a
like it was
daily
helpful.
basis is the most helpful. So I think it's certainly something people should try. Stretch slowly, try it for a while and see if it's helpful for you. But don't feel, if you tried it for a while and didn't seem to help at all, don't feel guilty that you aren't doing it. We've all got lots of shoulds. I don't want to dump more shoulds on you when I don't have
And there's
clear,
one like
definitive proof
right
that it works.
on the way into town.
Well, let me ask you, are there other exercises or physical activities that can be helpful in managing spasticity?
I wish I can get that.
So
approved.
most people find that movement helps. As the phrase I was always taught is motion is the lotion. So keep moving. And you may
Yeah, but-
find something that you like to do.
No.
And some people like stationary
No, I'm very-
bicycling. That can be very
You can
relaxing.
eat- you're
Doing
hungry, there's a
yoga
couple
is
pieces of
often
pizza left.
slow movements, intense
Pepperoni and meat, or
stretching.
there's chicken wings, potato tots left.
Aquatherapy, so being in the pool, again, can be a very comfortable environment for some people.
Or you have
but
mini pizzas.
others will say,
or
getting
I
there,
think
getting
all
in,
the
getting
mini
out,
corn dogs
getting
are
change,
gone.
not worth it for me.
So we have real size corn
So
dogs.
it's not like it's got to be one exercise.
Or we
But
have
activity,
sandwiches.
moving your limbs is helpful, and things that move your limbs through their full range may be
Yeah,
the
mac and
most
cheese.
helpful in keeping the muscles stretched out.
Well, we heard from Jacob, and Jacob told us that his doctor recommended a medication to help with his
Not mini pizza,
spasticity.
but we have real pizza.
He wants to know if this particular type of medication is safe and effective. So, can you tell us which medications are typically used in managing spasticity?
Great, thank you.
No, we don't
Yeah.
have any more of the ones with pineapple.
There are
And then we
really a
tried the ones with the meat
variety
on
of
it, the pepperoni
medicines
and
that are
sausage.
used. Most commonly, we start with baclofen, and this is a medication people take once or twice a day. And
vitamin
at
D.
first, they'll start with a low dose and then gradually add a little more, a little more. is until it works.
You don't need to eat 3
And as
cheeses.
long as it works and doesn't make people too sleepy.
Okay, but you,
Often this
when,
medicine
so we
makes
need to start
people sort of
working on
drowsy
better
and
lunches
sleepy.
then,
It's
like
also often why
protein
we
and
say,
not
well,
mini
try
pizzas.
just taking it at night.
Because if you're going to
and
keep
see if
eating 3
that's
pizzas at a time,
sufficient.
we're going to go through a box a week.
So that's usually the first line of treatment. The next sort of medication is tizanidine, and often people take both baclofen and tizanidine. Again, this medication can make people sleepy, but sometimes you can find a sweet spot by mixing the two. It keeps you alert enough and helps to control the spasticity. And then the most common sort of last oral medication that we use are what we call the group of benzodiazepines. So this is Valium or clonazepam. So it's a group of medicines. These have substantial risk associated with them. They can make you very drowsy. They can slow your breathing. Definitely to be used with caution. But certainly work directly with
Say
your doctor
baclofen.
to find the right mix. As I said, these all tend to work, whether they work well enough at a
I say
dose you
baclofen,
can
but
tolerate
it doesn't really seem like it does much.
varies. Most people get sedated, so sleepy at the higher doses. And then another option, a couple of other options that can be used. One of them is actually injections of botulinum toxin directly into the muscles. So this can work quite well if it's specific muscles. It's not going to work for your whole body. You do have to repeat
right
it
there.
about every 3 months because it wears off. This is a good and a bad thing. If it helps you, we can keep doing it. It's a pity it
I'll be
doesn't
right
last forever. But if it didn't go well, it will wear off and go away. And so that's an option for people. And then baclofen pumps are occasionally used. That's a pump that actually bathes your spinal cord in baclofen. So you need a lot less baclofen and it doesn't get all over your body to get it to the nerves that are affected, that are giving you spasticity. So at first glance, it sounds like a great option. Just put it where it needs to be. The problem with baclofen pumps, you need surgery to put it in. You need to get it filled. You've literally got little hoses running through you now that are pumping the baclofen from the source, the pump, to the area around your spinal cord. And those can get kinked, they can get infected. So we do use them occasionally, but they're tricky to manage and are definitely one of the later options with some substantial pros and cons. So I think what you see here is really a wide range. We said spasticity varies a lot, from very mild to more severe. Our treatments also have a very wide range, from just stretching to these medications, and the medications can sort of add on over time if needed.
You mentioned botulinum toxin injections, and we heard from Rose, who wants to know whether this is the same stuff that people use on their faces to reduce wrinkles. Rose wants to know how that could possibly help with spasticity.
Great question, Rose. And yes, it is exactly the same stuff people use on their faces to reduce wrinkles. So when they use it on their face to reduce wrinkles, basically what they're doing, the toxin stops muscles contracting. So wrinkles to some extent are formed because we move our faces and thus keep crunching different parts, and that makes wrinkles. So if you inject botulinum toxin into areas of your face, they can't crinkle up, they can't wrinkle. Now we take that same thing that stops muscle contractions and we inject it into your leg that keeps contracting when you don't want it, and you're, who knows, kicking your husband in bed at night when you weren't planning to. If you can stop that muscle contracting without control, that will help with spasticity. So it's really working the same way. It's preventing a weakening a muscle contraction.
Earlier, you mentioned that heat and cold can be triggers for spasticity, but temperature therapy can also be beneficial in treating it.
Can you explain how temperature therapy works?
Somewhat. Again, it's one of those things we don't fully understand. If you just get the muscle cold very briefly, that will tend to actually make spasticity worse. The muscle will contract. But as the cold is there for longer and longer, the nerves actually can't conduct very well when they get really cold for a long time, and so gets less sensitive. The spasticity will go away, although only briefly, so an hour or so. This can be helpful if the therapist wants to stretch your muscles. They could cool them for a long time and then stretch them. So that can be helpful. And heat can just be relaxing for people as long as there isn't too much. It's not too hot and can then ease some spasms.
We've talked about some things that people can do to manage spasticity, but another approach involves assistive devices, splints, and braces. Can you talk about how these tools might help someone?
So these are sometimes used after we've used botulinum toxin, so we weaken the muscle, but now we need to help it. So we might use a brace. You may also find that you've got spasticity of one muscle, and so that's getting in the way of the muscle on the other side contracting. So I'll give you an example. Some people, when they try to walk, their toes keep catching. And their toes are catching in part because the muscles that lift their toes are weak from their MS. They're also catching a little bit because the muscles that bring their toes down are having some spasticity, the ones that pop you up on your tiptoes. And so if you put a brace behind the leg and under the foot, that actually helps to lift the foot up and stop the foot from catching. That's called an ankle foot orthosis or an AFO. So that can be helpful. There can even be devices that use electricity to essentially do the same thing. So those can be helpful. And then there's also assistive devices like canes and walkers, crutches. So if you're finding that your spasticity is making you off balance, they said we can do things to treat the spasticity directly or sort of work around it. And working around it is to give you better support. So if your spasticity sometimes tries to knock you off balance, one of these walking aids can help keep you up or just get you back in the right direction. So a variety of different approaches depending on what brace, splint, or device you're using. But a lot of different things can be helpful. Splints can also be particularly helpful for the hands. If you're having trouble having good control, they can also position the hands to give you a little bit more function.
How can a physical therapist or occupational therapist help someone with MS who's experiencing spasticity?
So all sorts of different ways. They may, together with your physician provider, assess your spasticity. So really try to hone down back to where we started. Hey, I'm having stiffness in my leg, or I'm having trouble moving my leg. Really do a very thorough assessment to figure out what's spasticity, what's weakness, what's ataxia, why are you having the trouble either moving your leg or walking safely? What are the contributors? It may be all spasticity, it may be spasticity and some other pieces to figure out what's contributing. After that assessment, they'll start with treatment. And that treatment may be teaching you stretches. So how do I do? It's easy for me to say here on a video, stretch your muscles, stretch them slowly. But what muscles? How exactly do I do that? How do I do it safely? How many times should I do it? How hard should I push or pull? Is it working? What effects should I see? So really going through the logistics of doing stretches and doing them the right way and assessing if they're helpful. And then the therapist can also work on your safety, your mobility, the devices we just spoke about, so splints and braces, other forms of exercise we spoke about, So really taking you through from that initial assessment, what do I think is going to be most helpful for you as a physical or occupational therapist, how to actually execute that, stretches and other exercises, using various devices, and then reassessment. Is this working out for you? Is it helping? And is it practical for you to do? So that constant back and forth between you and the therapist to come up with the best solution. But as we said, like all our treatments is working to improve your quality of life.
Well, you've shared some great strategies for managing spasticity. What would you say are the top 3 takeaways that you'd like our viewers to remember?
So I think the first one is just, if you think you have spasticity, talk to your doctor about it. Hey, I'm having trouble bending my leg. Do I have spasticity? Is it something else? Number 2, consider seeing a physical therapist if you think you have spasticity. As I said, they will not only go through that assessment, but come up with a wide range of non-medication treatments that might be helpful. And then I think number 3 is the somewhat, as one says often, be patient. Be aware it can take a little time to get the management of your spasticity optimized. And this will likely be a combination of exercise, medications, activity modification. And it's unlikely you'll be so lucky as to go to your doctor and get just the right medicine that works at that dose perfectly for you. And that physical therapist one time and the OT one time, and they come up with a perfect exercise. This is really a back and forth between you and your providers to get the best solution for you. So number 1, speak with your doctor. Number 2, speak with a physical therapist. And number 3, be patient to work with those people to get the right combination for you of those exercises, medications, and activity modifications to keep your spasticity not messing with your life.
Well, I want to thank everyone who submitted questions, and thank you for being with us today, Dr. Cameron.
You're welcome. Thank you. Thanks for the opportunity.
Before we close, I want to remind you that the National MS
ridiculous. This
Society's
is so much
MS
easier to do when
Navigator
there's nobody
team
here.
is your best partner when it comes to connecting you
Where the fuck was
to the
I?
very
It's
best
working.
information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll find out about ways that you can become involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcast. I'd like to thank Dr. Cameron for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Michelle Cameron and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.
Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news of people affected by MS.
Actually, I do need to
know.
check out his podcast. When I
My
went to his
wife
site
Jane
the
lived
other
with
day,
progressive
apparently he had
MS for 23 years. So I've had a
conversation
front row
about,
seat experiencing all the ways that MS
a
can impact the
GLP-1s
family.
and Ozempic and shit like that.
Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering your questions and connecting you to resources. You'd be hard-pressed to name even a single area of our lives that hasn't been changed by digital technology. The pace of scientific discovery has never been as rapid as it is today, and those advances have given healthcare providers new tools to inform treatment decisions and monitor MS disease activity. At the same time, people living with MS have new ways to track how they're doing, to communicate with their providers, and to access support. Joining us today to discuss the rapidly evolving world of digital health is Dr. Riley Beauvais. Dr. Beauvais is a neurologist and an associate professor of neurology at the University of California, San Francisco. Dr. Beauvais holds relationships with commercial interests with Biogen, Eli Lilly, Roche, Genentech, TG Therapeutics, Alexion, Horizon, and Merck EMD Serono. Well, welcome, Dr. Beauvais, and thanks for being with us today.
So nice to be here with you today, John.
Well, let's start right at the beginning with the definition. How would you define digital health, and what are some different types of digital health technologies?
Yeah, I think it's a term that's really been expanding over the years. And when I try to simplify it to what it really means for someone living with MS or caring for someone living with MS, I think it's the use of tools and technology to improve research and care in a few key areas. So one key area is improving communication between patient and their care team. So that can mean tools like telehealth, televideo visits, where a physical therapist or a neurologist can see the patient in their home environment. It can also mean kind of linking the home and the health clinic through apps for home blood pressure monitoring or other monitoring of function in the patient's home that the care team can be alerted to and respond to. And another sort of communication piece can be enabling more simple, more convenient ways for the patient to communicate with their care team and get timely responses. I think a second key area is really when it comes to being able to monitor patients' function better, understand how people are doing in different ways, making invisible symptoms visible. So an example would be being able to track a patient's fatigue, for instance, so that the care team can understand it better, and being able to monitor sort of real world function like gait in the real world. A third area is around promoting self-management. So how does a person self-monitor their own function, their own well-being, and receive treatment for that through their own initiative? So that could include something like an online app to help with sleep or mood, or a gait tracker where people can monitor how they're walking and set their own goals. And then finally, sort of the really evolving area, and I should say all of this, I know you mentioned to me in private, John, but this is something that I really think about a lot, is all of this is sort of, as of today, but of course the next frontier is this AI frontier, and we have yet to see all of the ways in which artificial intelligence, machine learning is going to augment everything we do in the MS sphere. So that may have to do with, better analytics around MRI, so we can better understand, where the lesions are, where the brain volume changes are, or better, models to interpret speech, or who knows? That's the next frontier, and I think it's a very exciting one with a lot of unknowns.
Agreed.
So just to summarize, those would be our 4 kind of key domains I think about when I think about digital health.
Well, we heard from Elijah, who tells us his neurologist believes his MS has transitioned from a relapsing remitting form to a more progressive form. And Elijah's wondering whether there are digital health tools that can help track MS progression.
Yeah, great question. I think that's where a lot of this digital health research has sort of initially centered. So just to kind of make sure we're clear on our terms, what we mean when we say someone has more secondary progressive is they are less likely to have relapses, and the sort of worsening that they experience over time without the relapses becomes more obvious. So, we all kind of lose function a little bit with aging. That's sort of expected. But when we talk about that progressive, it's something, more rapid and sort of more out of the expected rate for age. And so there's a lot of ways that those changes in function can be tracked using digital tools. A very simple way is if we're going to focus on gait being one of those really visible aspects of MS, seeing a step count, the average daily step count, we do see that average daily step count decrease even before a doctor calls a patient progressive. Okay, so even before the doctor sees in the clinic that changes have happened, we might see on a step count monitor that changes have happened. So that's an example where someone could use a Fitbit or use another sort of commercial grade wearable device to see how walking changes over time.
Melissa says she usually sees her neurologist twice a year, and she finds it challenging to remember every detail and really give her neurologist a full picture of her MS over a period of 6 months. And she's wondering if there are digital health tools that might be able to help her with this. So where should Melissa start?
Yeah, so by the time Melissa's made it into the clinic, she's had to navigate directions, parking, getting into the building, getting registered, getting her insurance card updated, all these things. And so, your ability to remember what happened 5.5 months ago is, going to be affected. I do think there's a couple options for Melissa. A really simple homebrewed one is for Melissa to just set a monthly reminder or every 2-week reminder on her phone or on her diary to just record the symptoms that she wants to monitor. And she might decide that for the next 6 months, I want to really keep track of my falls and my sleep. Or she might have a more comprehensive set. And that's that's a free one that she can integrate with her life. There are specific apps to do that. There's a number of apps that can be downloaded on the, in the app stores around MS self-management. We created a free open access, sort of no strings attached one online called Open MS Bioscreen, where people can go in and log their symptoms as frequently as they'd like in a comprehensive way, so that when you go see the doctor at 6 months, you have everything kind of, set up. So there's a number of ways to do this, but I do think, when we see the doctor or the dentist, we kind of want to put our best foot forward, and we might kind of, perform well in the clinic and then think, that doesn't really reflect the difficulties I've had over the last 6 months. So being able to show that the function over that time period, I think, is really critical to understanding how someone is truly doing.
Well, since we're talking about apps, I'm wondering if you have any other smartphone apps in mind that could help people with MS, and how does someone know which apps are right for them?
Yeah, that's a great question. I think there are smartphone apps for specific things. So, for instance, there's specific like sleep apps where you can have access to cognitive behavioral therapy for insomnia, CBTI, where there's sort of, mindfulness exercises and things like that to help self-manage sleep or mood. So there's various apps for self-management of specific things. And then there's comprehensive apps that are really mostly designed to kind of be sort of a surrogate for a full evaluation that we do in the clinic. I think for a lot of people with MS, you kind of, it can be burdensome if you were to have, the best app for sleep and the best app for mood and the best app for your bladder and the best app for your walk-in. Like all of a sudden there's a lot of stuff. And so that's something that I think about a lot. How do we make things as simple as we can for people who really want to self-manage a number of functions? And so I would say either aiming for a comprehensive app, like the OpenMS Bioscreener, like the other apps that have been developed that you can download directly as an app, where you can kind of just fill out the things you want to do. Or I would say, pick one or two things that you want to improve in the next 6 months, give it a real go, like let's say it's sleep or depression, download something that looks good to you, that you will want to stick to. It's sort of like exercise, everybody, the exercise that works, the best exercise is the one that you will do, right? So pick one that works for you and then really work on it to see how much you can improve. So I think, picking a few symptoms or picking a very general app is two approaches that depend on the person and their preferences.
Well, we know that apps don't only live on a smartphone. We heard from Eric, who wears a who wears a smart watch, and his smartwatch counts his steps, tracks his activity levels, and even tracks his sleep. Can the information that Eric's watch is tracking tell us anything about his MS?
Yeah, I think this really reflects what, we talk about active monitoring and passive monitoring. And a smartwatch is something that, yes, you have to keep the batteries charged and you have to keep it on. But otherwise, it kind of just collects information about you without having to do anything. So in that sense, it's passive. And what we've seen is that, people with MS are busy. They've got a lot of stuff going on. And so passive definitely helps in general, just people like use the tool and continue to use the tool, so adhere to it. So I think, first of all, just the fact that a smartwatch is passive is going to be more valuable. It's going to be easier for people to stick to it. And then in terms of the information, we have absolutely learned that we can learn about someone's walk, their real world function, how they respond to a pandemic. We've learned about all of that from just a simple commercial wearable Fitbit. And there are a number of other ones as well. And which one someone picks, it depends on whether it integrates with their smartphone and like all the other things they want. But we absolutely can learn about step count, and Eric can set a goal. Eric can look at their step count with their neurologist and say, hey, people within your kind of walking category, they walk between 3,000 and 7,000 steps a day. You're at the 3,000 range. How can we bump you up to the 5,000 range? What do you need? So that's absolutely a way that Eric can monitor his step count. Sleeping as well. These commercial apps give us a lot of it. These commercial wearables give us a lot of information about sleep. Hey, what time did you get into bed? How long did it take you to fall asleep? How many times were you interrupted? That can give us really good information about, hey, maybe you're going to bed too early and then just like waiting around for sleep to happen, or your sleep is interrupted a lot. Could you have sleep apnea? Do you have to get up to go to the bathroom? What's going on with these interruptions? Is your pain or your spasms, do they need better control? So the wearable can give us great information about sleep as well. And you mentioned a third one, John.
Overall activity level.
Yeah, just real world participation. So what we've seen, what we've learned from people is their real world daily life participation, how far they range, how many minutes they're active. That isn't just about their walking ability. It's about their mood. It's about where they're going. It's about whether they're trapped because of COVID or because of snow, and so if people are able to walk quite far and quite well, but are not, that should give us some insight into how they're, all these things, their mood, where do they have a place to go? Is the bladder keeping them home? So again, I think the information is super rich, both for the patient wearing it and their own self-management, and then also their care team to really think about, hey, where is, what your functional ability is and what you're actually doing. What is the discrepancy, and how do we, get you to where you want to be? So I think there's a ton that can be learned by just putting on a smart watch.
So is there an easy way for Eric to share this information with his care team?
Oh, John, this is where we have really not done a good job. So the simple answer is technologically there is, and then infrastructurally there is not. So you could imagine as a neurologist, my first patient of the day has selected an Apple Watch, and my next patient of the day has selected a Fitbit, and my third patient of the day has selected something, a new thing that I've never even heard of, right? So how am I supposed to get access to all this information and act on it, and then remember all the passwords, and my patient, has to have it up? That does create a difficulty. So I think patients can come in with their stuff ready. Hey doc, hey PT, hey OT, here's what my 6 months step count looks like. What do you think? They can come in with that, either printed out, it can be saved as PDF, they can screenshot it, or the doc can just look at it with them in the office visit. I think that can be a little burdensome, and it's kind of putting a lot of pressure on the patient to come in ready, because if they're not ready, time will just, the visit will just move along. But we need to have better integration, and there are integrations, but I think patients and physicians and all this, societies need to kind of push for better integration. And so that's through what's called APIs, right? Basically websites that connect. And so there is a way to connect an Apple Watch or a Fitbit to the EHR. But the health system has to agree to do that. And so there's a few steps and hurdles that have to be cleared. For instance, we can see a patient's Fitbit in our medical record. We can see those data and we can act on those data, but that's institution and clinic specific. And that's where the field has to move to really make this information actionable, so that we can see it in a timely way, visualized in a way that actually makes sense, and act on it. And the field has a little way to go, but it's totally solvable technologically.
We heard from Lupe, who's wondering about the potential risks to using digital health tools. She wants to know how she can make sure that her health information is kept private.
Yeah, I mean, Lupe, that is a huge concern, right? So there have been some data privacy leaks that have been, really concerning. So genetics, for instance, have been, majorly concerning recently. I think there was a 23andMe leak, for instance. There's also, we have to think about who's getting the data. So does, Google bought Fitbit, for instance, and now Google would know all of your Fitbit data, right? And could probably link that to the rest of your information. So one is regularly revisiting the privacy policies on whatever apps are downloaded, to look carefully. Sometimes things, sort of like snuck in. A second suggestion is to create different email accounts for different apps. So for instance, you could create what we call a dummy email account. So it's not your primary, general email account that you use for your social and sort of like business work, You could create an app just for, an email for just one app. So, Lupe smartwatch app, something like that, to just kind of try to keep the emails a little bit separated. But that is a concern, and certainly if it's a app that's sponsored by a pharma company or that could be purchased by a pharma company, that would raise some red flags, and you want to look at the wording there.
Aside from privacy issues, are there any other risks or challenges to using digital health tools?
Yeah, great question. I think we talk a lot about the digital divide, right? So some people have access to all the digital tech and some people don't. And what do? We do know that in the United States, a large proportion of the population does own a smartphone. Okay, and does have access to the internet, whether that's through a public library or their own smartphone or their own home computer or tablet. So we do know that a lot of the population does have access. But even if they don't have, even if they have access, that doesn't mean that it's easy to navigate the screens, navigate the language, right? So the language barriers, and of course, navigating digital tools does take vision in a lot of cases and hand dexterity. And those are particular concerns, for our population living with MS, where, you really want to make sure that things are accessible in the sense that the font can be enlarged, the colors are quite distinct. So people who've lost, ability to really distinguish certain colors can still use the tool. So these accessibility concerns. And so I think we want to make sure that we're not building things that reinforce divides, socioeconomic, geographic, rural divides, urban-rural divides, but actually that are able to reach as many people as we can. Now, there will always be some disparities in a sense, but really being mindful of not requiring specific operating systems, making things as web-based as possible so that people can access them from as many, avenues as possible. I think those are all things that are that we can think about as we build and validate new devices. So I think people who have specific accessibility concerns, actually a lot of the apps do have features where you can make things larger, easier to see, where you can press a button and have it speak to you instead of have to read it. These are all things that are built into a lot of smartphones and tools already.
Well, we have a question about that very issue. We know that MS can impact a person's fine motor control and make it difficult to manipulate tech devices. So Tanner tells us that his friend Jay lives with progressive MS and has trouble using his hands. Is there a way for Jay to still be able to use digital health tools?
That's a great question. So, the reality is that there are going to be some tools that are going to be harder for Jay to access. That said, Jay, there's a ton of things that, can be done for you to access a number of tools. So certainly using the voice activation to access, apps that help with sleep or mood is a workaround. Again, using the voice activation to access apps, either Facebook or Zoom or FaceTime chats to sort of connect with other individuals, again, works just fine if dexterity is impaired. Now, apps that require specific, pinching something on the screen or navigating around the screen with the hands, those are going to be harder. So I think sometimes you can actually broaden the screen so that people can really, press buttons in a simpler way if their dexterity is impaired. But I would say the voice activation features are the best option here.
more than half of all the people with MS develop changes in their cognitive function. This might include information processing, memory, attention, concentration, and there are others. Now, if someone experiences change in their cognitive function, are there digital health tools that can help them function more effectively?
Yeah, great question. So I think, cognitive concerns are huge, of course, for people with MS and then also just for aging populations in general. So I would say we can think about the tools that are really helpful in terms of just like organizing your day, like, managing in your day. And then also the tools that can be helpful for neurorehabilitation, right? Cognitive rehabilitation. So in the first sort of organizing the day situation, I do think that, setting reminders for medications, setting a scheduling time for physical activity, walks, scheduling time for social connectedness, having, thinking actually with an occupational therapist, with a neurologist, with a neuropsychologist about what are the specific strategies that are going to work for you, right? So do you like a list on your phone? Do you need it, or do you need sort of analog planner? Like thinking about how to use the list, sort of just the commercially available list options that come on all the smartphones these days, to your advantage. I think there's a lot of just not even MS specific technology between calendar reminders and list taking that can help people kind of stay focused and build in the times to do the self-care. From the cognitive rehabilitation standpoint, we need to be able to monitor cognition and treat cognition. And in terms of monitoring cognition, there's a lot of apps that have been validated as being able to be, sort of just as good as the paper and pencil stuff. So, for example, the SDMT, Simple Digit Modalities test, that's a paper and pencil test. There's a number of digital versions of this. So most of the MS sort of self-monitoring apps that it can be downloaded have a digital SDMT. The Floodlight suite that kind of is just being decommissioned, that they did a lot of work showing that was very informative. So there's definitely a move to be able to better capture how people are doing, and now research into voice, speech parameters, how people, type keystrokes parameters. That's all kind of becoming more passive ways of monitoring cognition. And then treating cognition, there are downloadable apps that have been proven, at least in smaller studies, to improve specific aspects of cognition, like processing speed, as you mentioned. And here, there's a commercially available app that's really being marketed for younger kids who have ADHD by a company called Akili. In disclosure, we did research with them, but their app, Endeavor, was shown to improve processing speed in adults with MS. And so we're starting to see sort of direct-to-patient, over-the-counter apps that can help with neurorehabilitation, cognitive improvement, and that's really exciting because people could decide, when they feel like they're having some difficulties, and they could sort of self-pace their exercise program for their brain.
Just shoot me an email. I don't
Well,
have any
this has
active
been an
PO.
exciting conversation. I think you've certainly made the case that digital health technology has the potential to really transform MS care, both for the healthcare provider as well as the person who's living with MS. But I'm wondering if you could give us a little preview of some things that you might be working on.
Yeah, so, thanks for asking. I think in terms of telehealth, we haven't talked too much about telehealth so far. We do have an exciting NIH-funded trial with Marissa McGinley at Cleveland Clinic, where we're actually looking at we're randomizing people to in-person versus telehealth care over 2 years. We know during the pandemic that people were kind of like forced to use telehealth, but now that the sort of people have sort of gone back to their preference of in-clinic telehealth, we really want to see, is telehealth able to reach more people more conveniently? Are we able to reduce the costs of care? Do we have the same quality of relationship between the patients and their care team? These are all things that we really want to understand kind of in a very, randomized controlled clinical trial situation. I think in terms of machine learning, a lot of people are looking at how do we analyze the notes and kind of get a picture of how patients are doing in sort of these novel AI augmented ways. Can we use these models of language and notes and MRI reports to sort of look at a whole health system's records and look more quickly at how people do either on certain medications or with certain complications over time? That's another area that we're dipping into, and I think the ways that we'll be able to deploy this machine learning in the future are going to be so many. And then, we've done a lot of digital health, sort of digital tool validation for the more commercially available simple things like Fitbit for walking or ActiWatch for walking. But what about people who have bladder problems, right? Bladder is huge. Bladder, waking up to go to the bathroom is, it disrupts sleep, disrupts cognition, mood, energy, right? It also is a fall risk because then people are rushing and they risk falls. And it's also a deconditioning risk because people who have urinary frequency urgency don't want to go out into the world because they're afraid of losing control. And so being able to validate tools that can actually monitor bladder function and tell someone when they have to go to the bathroom and encourage them to go to the bathroom if they're retaining, they're not fully emptying their bladder, that's also something that Dr. Val Block and our team is looking at, and I think is really exciting for people living with MS because, not just the simpler things like walking, but the more private but very burdensome things like bladder, can really be illuminated by digital tools.
Well, you've shared some really exciting insights about how digital technology is impacting MS care today and how it's going to impact MS care tomorrow. I'm wondering, what would you say are the top 3 takeaways that you'd like our viewers to remember?
Yeah, great. So I would say as a preamble to the top 3, I reserve the right, this is very today, right now, right? So things will change rapidly in the future, hopefully. But I would say one top takeaway is that there is a lot available for self-management. Being able to just track your own symptoms at your own pace to be able to provide a more comprehensive picture to your care team. And so whether that is tracking them in a simple online diary or accessing a specific app, I think that can be really rich for you and the care team to just note how things change in response to the real world, medication changes, etc. So I think self-monitoring is really there, and I really encourage people to do that. I think through so second point would be through passive, fairly low cost wearables like ActiWatch, Fitbit, Apple Watch, things like that. There's a lot of really useful information about someone's walking, about their sleeping, about their real world participation that can be used by patients living with MS, their loved ones, as well as their care teams. And again, setting goals, seeing what gets in the way of goal achievements, rewarding people, like just being proud of having reached goals. I think that's something that is really important because people with MS check off a lot of checklist, things every day. And being able to see, hey, I really reached my goal that day. That was awesome. I think can be really invigorating. And then I think a third take home is that, as you mentioned, John, the accessibility issues, the privacy issues are really important, and sort of just, checking what those privacy clauses are, maybe thinking about having different emails for different apps, and also really leveraging all the sort of voice activation features and sort of the accessibility, visual accessibility features that exist can really make things a lot easier for a lot more people.
Well, I want to thank everyone who submitted some great questions, and thank you, Dr. Beauvais, for being with us today.
Thank you, John.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcast. I'd like to thank Dr. Beauvais for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. Now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey into the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Riley Beauvais and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions, connecting you to resources. Between 25 and 30% of the people living with MS rely on Medicare, the national health insurance program that provides coverage for people over the age of 65 and people with permanent disabilities. Laquel Thomas is joining us today to review some of the important things that people with MS should know about Medicare. Today's program should be helpful to you if you already have Medicare coverage or if you're thinking about applying for Medicare in the future. Welcome, Laquel. Thanks for being with us today.
Hello, John. Thank you for having me.
There are several parts to Medicare, and people have some choices to make when they apply for coverage. Could you begin by telling us about Original Medicare and Medicare Advantage?
Original Medicare is the government's original traditional coverage, medical coverage. It consists of two parts. Part A is considered to be hospital insurance, and Part B is considered to be medical insurance. Medicare Advantage is a combination of all parts of Medicare, also known as Part C, because it combines the Medicare Part A, B, and D, which is for drugs.
We heard from Angie, who says she'll be eligible for Medicare next year. And Angie wants to know if Medicare covers the kinds of things that people with MS might need, like MRI exams, physical and occupational therapy, and durable medical equipment.
Okay, yes. So they can be reassured that Medicare covers all the necessary treatment, tests, services that they currently have. Medicare covers MRIs, they cover CT scans, primary care visits, specialty visits, physical therapy, occupational therapy. They cover all of those services as long as it meets the medical necessary requirements. It is covered, and she has many choices to choose from.
Does Medicare cover the MS disease modifying therapies?
Yes, Medicare does cover those therapies. As long as they meet the medical coverage guidelines under Medicare, then they are covered.
A lot of folks try weighing the pros and cons of original Medicare and Medicare Advantage to determine which coverage is going to be best for them. We've heard from some of them, so I hope you'll share some of the points you might raise when you're helping someone choose their coverage. We heard from Stephanie, who tells us that she sees several healthcare providers, including her primary care physician, her neurologist, and a physical therapist. And it's important to Stephanie that she continues to see the same providers. What should she be thinking about when making her Medicare choices?
Well, the first important thing to think about, I hate to say this, but it comes down to the cost. The cost of Medicare depends on your circumstances. Medicare, traditional Medicare may work for certain people, depending on their medical needs, because there's a lot of out-of-pocket expenses that come with regular Medicare parts A and B. Depending on your circumstance, you may end up having a lot of out-of-pocket costs. Medicare Advantage is a more fixed, economical option to choose from. Especially, I'm not sure how old Stephanie is, but if she's someone that's under the age of 65 and she was found disabled, her options are kind of limited under Medicare, especially with the rising, cost of the premium.
This is why
For
we're screwed
Medicare
as a society.
supplement
Like, it
plans.
shouldn't
So
be this fucking difficult.
I would tell her to kind of see
to obtain
which,
fucking care.
can she afford to stay on traditional Medicare?
Like, yeah, I get it's a
If she
government fucking
can't,
program, but why
Medicare
is it so
Advantage is
difficult?
also a good option
Shouldn't matter.
because it does give you a
Either cover it or
predictable
don't.
cost for different tests. There's different options that she can choose from where she's not paying a high copay, high out-of-pocket cost. There's several programs that she may qualify for that may also be able to help her with those costs. So what I generally do with my clients, I do an assessment and try to see which option is best. We go through, all the doctors, medications, and depending on what the cost, their total out of pocket may be, it may be better for them to maybe stay on regular Medicare or perhaps go with an Advantage plan. But it all, in today's economy, it kind of
I
depends
think next
on
week
the
I'm gonna open my
cost
new
and how
share.
much you can afford to pay for your medical costs, especially when you're on disability and having a fixed income.
Almost a year later, we
I'm glad
finally
you
got our
mentioned
care.
those out-of-pocket costs. We heard from Matt, who says he doesn't take many prescription medications, but he does get a monthly Tysabri infusion. And Matt's worried about his out-of-pocket costs adding up and wonders if a Medicare Advantage plan might be his best choice.
In Matt's case, it may be his best choice because unlike original Medicare, the Medicare Advantage plans, they have a maximum out-of-pocket cost for the plan year. So Tysabri is quite expensive medication. So generally he may meet the maximum out of pocket during the year. So in that case, that would help him with any other, medical tests or services he may have, because if he reaches that limit, he would have 100% cost, zero out of pocket cost. So in Matt's case, it may be better to go with an Advantage plan, because if he reaches that limit during the year, then he's pretty much covered at 100% during the plan year for his medical out of pocket expenses.
Well, Michael tells us he's starting Medicare later this year, and he's asking whether Medicare includes coverage for dental, vision, or hearing benefits.
No, that is a misconception. Original Medicare does not cover any type of supplemental benefits such as dental, vision, or hearing, unless it's related to a medical condition that you're having to get medical treatment. But as far as having a routine eye exam, a routine dental, it does not cover that. Only Medicare Advantage plans includes those extra benefits such as the dental, the vision, and the hearing.
Jenna says she's planning for her switch from private insurance to Medicare, and she's worried that she's not going to be able to make the best choice for her future needs. Now, whether she chooses original Medicare or Medicare Advantage, she wants to know if she's going to be stuck with her choice forever.
Okay, so no, that is another misconception. So no, if she makes a decision and she chooses a plan, there are different enrollment periods that goes on throughout the year, that if she qualifies, she will be able to switch. And if she wants to go back to original Medicare, or if she chooses a Medicare Advantage plan and she wants to change her plan, she would have the opportunity to make those changes. So you're not stuck with your choice forever. So it is options available that if you do make a decision and it happens to not be the right plan for you, there's several enrollment periods. There's the annual enrollment period that goes from October 15th through December 7th, where everyone with Medicare has the opportunity to make a plan change. Then there's another enrollment period that goes from January 1st to March 31st, that if you want to go back to original Medicare, or if you also want to switch your Medicare Advantage plan, you can change. So she won't be stuck forever with the same plan.
Nita tells us that she's interested in a Medigap policy to supplement her original Medicare plan, but she's heard that people with MS can't get Medigap coverage. Is that true?
No, it depends on the circumstances. If you are newly eligible for Medicare, you're within the 6 month of being eligible for Medicare, they have a guaranteed issue where they will, get your guarantee to be accepted into the Medigap policies. The only downside to a Medigap policy, if you're someone that's under 65, the price is very expensive. So the premiums are really costly for people that are under 65. So if, again, it depends on your finances. Not everyone can afford to purchase a supplement, especially if they're on disability, they're under the age of 65. So I would weigh the options, as far as.
All right, so we're just gonna stop and bring up this topic. Like I mentioned it a minute ago, but this this bothers the hell out of me. Okay, so a disabled person can go on Medicare, Medicaid, whatever. Sure. But you're screwed if you're not 65 when it comes to premiums. At the same time, you can't qualify for certain things if you're not on Medicare. For example, I cannot qualify for a copay program because I'm not on Medicare, but yet I'm disabled. At the same time, they're talking about Medicare and a Medicare Advantage. I understand these are government programs, but why? Why do we have two separate options? Just choose one. Just fuck our America. We're so screwed. Like, do we need universal health coverage? That'd be fantastic. I know a lot of countries have universal health care. That would honestly just be fantastic, right? But we're capitalists. Please, everybody needs money here. But why is there two separate things? Just make one thing. Like, just don't screw everybody out of pocket. Why is this so hard to understand? I hate the fact that this is a problem because it screws everybody. It screws the elderly, it screws the young, it screws the disabled. This is not okay. And no wonder why people hate the US is because even if people cannot afford to take care of themselves and have to use a program, they're still screwed. Medical coverage is screwed up. We all know this. But for the fact that it becomes such a rampant problem and puts people into debt is ridiculous. Something has to change. And it has to change quick. I spent years of my life never going to a doctor because as soon as I went to a doctor for a checkup, I owed money. And I owed more and more money, or there was something wrong. In America, when we can't afford to do things, we don't go to take care of ourselves. My prognosis of MS could have been found earlier if, as a younger male, I was working full time ever since I was the age of 16, essentially. If I could afford anything that actually happened to me for a medical checkup, I probably would have went more often. But you can never afford those things. God forbid my dental stuff. There's a reason I have no teeth. I had them all removed. Even that was ridiculously priced just to sit there and pull the teeth out. I think we had to put out like $6,000 to have all my teeth put out. You're removing them. It's not like you're replacing them. Health coverage in the United States is bullshit. Companies in the United States are bullshit. Health clinics in the United States are bullshit. There's a specific clinic that I deal with, starts with the letter M. I'm not going to name it because that'll be a whole different story when this is online. M Clinic is bullshit. They waited 1.5 years to try to tell me that I owe them money because they fucked up billing the wrong insurance 1.5 years prior. Now I'm in collections for $8,000, which I don't have. If that was the case, I'd pay off a lot of my other bills that I have. Their fault. They billed the wrong insurance, but it's my fault because I am the patient. Healthcare in the United States is bullshit. Sorry, back to the show.
There's the pros and cons regarding the cost, but no, if you are, MS patients, they are able to get a Medigap policy, but there are certain criteria that you have to meet, and depending on your circumstance and when you're eligible, you may or may not be, qualified to enroll in the plan. But you do have options as far as when it comes to Medigap.
And says he's taken Copaxone for years, and he'll be starting Medicare soon. His neurologist has discussed changing his disease-modifying therapy in the next few months, which would be after Ben starts Medicare. So he's not sure how to make a coverage decision when he doesn't know which treatment he'll be on. Any advice for Ben?
I will try to do as much due diligence as you can to look at the whatever plan or options you're going with to see what their guidelines are regarding the modifying medications, because some of the plans, they do give you the opportunity where you can call and get information prior to being enrolled. So I would, try to do that as well. But keep in mind that there is a transition period. So if he, is not sure what option the doctor wants to, go with, once his plan starts, he will have an opportunity to, get, if there's a medication that may not be covered, there are options available for him. So even if there are changes throughout the year as far as his medication, he can, rest assured that he'll be able to, get whatever medication that the doctor decides to prescribe, because majority of the plans in Medicare covers most of the medications that MS patients require.
Jody has MS, and she's covered by her husband's health insurance through his job. She receives Social Security benefits, and she'll be eligible for Medicare in a few months. Jody wants to know how Medicare works with job-based insurance.
What I recommend first, if you can, talk to your administrator, your benefit administrator, because with health, job-based insurance and Medicare kind of depends on the group size. There's a lot of um, differences between your options. If she is covered under her husband's or spouse's plan, she doesn't necessarily have to go with the Medicare at this time, depending on her age. If she's not, at 65, she can decide to stay on her husband's plan and opt out of Part B, which is the medical insurance. Or if she decides to stay with it, she would have to talk to her the benefit administrator to see how they coordinate the coverage between the job-based insurance and Medicare coverage. And it kind of depends on the group size of the employer. So that's a little bit too in-depth or complex question, but I would kind of tell them first to go with the benefit administrator to see how, what they need to do, because they would direct them on if they should stay with the job-based insurance or go with Medicare coverage.
Rob and his partner Corey are planning for future MS care needs. They're considering what they might do if Rob needs home health care, or if he might require a different care setting like assisted living or skilled nursing facility. And they want to know whether Medicare covers this long-term care.
Medicare, unfortunately, does not cover long-term care benefits such as, home health, skilled nursing, assisted living facility. That's another myth that a lot of people believe Medicare covers those benefits. There are some Medicare Advantage plans that offer some limited home health care needs for activities of daily living, like cooking, things like that. So that's one option. But if he needs more in-depth coverage as far as long-term care, the what I recommend is a long-term care policy, which depends on your age and your health. It gets kind of pricey for those type of plans. So I recommend, if you can, at a younger age or when you're kind of healthy, you can purchase, if you can afford it, a long-term care policy, because those are the policies that give you coverage for long-term care, home health aides, assisted living facilities, adult daycares, or he can try to look into any type of community resources that may be available.
There seems to be so much to think about when it comes to making an informed decision about your Medicare coverages. How can someone get more help?
They can, first off, visit the National MS Society, connect with the navigator. They can visit Medicare.gov. That's a very valuable resource that, provides educated answers as far as the whole Medicare system and how Medicare works and the different coverage. They can also connect with a Medicare advisor, someone as myself that is licensed and trained in all the different Medicare plans and options. And they can also try to, talk with friends or family, but keep in mind that it is an individualized situation. It's not one for all. What may work for your friend may not work for you. So I will always try to, keep in mind, your own individual needs. But there are, again, a lot of resources out there, but you have to make sure that it's a reliable resource, because there is a lot of misinformation and myths about Medicare.
You shared some great information about a topic that a lot of our viewers are dealing with today or soon will be. What would you say is the top takeaway that you'd like our viewers to take with them and use?
Don't be afraid about a Medicare Advantage. I know Medicare has been around for over 50 years. There's a lot of people have been used to traditional Medicare, but Medicare Advantage plans can work for some people, and it definitely provides a lot of value benefits that a lot of patients need, especially MS patients. I would keep an open mind. I would be flexible. I will also just try to do my due diligence and do my research. And, don't be overwhelmed. I know there's a lot of information. There's commercials, there's advertisements, newspapers regarding Medicare. I would just try to, be calm and try to find a trusted advisor, someone that can help you navigate through the Medicare system. And you do have options. I know there's a lot of options out there, and that can kind of overwhelm people. Make sure that you do make an informed decision for yourself, not based on any other outside opinions.
Well, thank you for sharing your expertise with us, Laquel. I think we have time to answer a few more questions from our audience. Cole is asking what you might advise him to do if Medicare denies a service or a treatment that his doctor prescribes for him.
I would first contact the plan, or if he's on original Medicare, contact Medicare. I will file an appeal because you do have appeal rights, grievance and appeals. He has 60 days, depending on the denial, to file an appeal. Talk to your doctor. Make sure the doctor submits all necessary medical documentation. And I definitely will, go through the grievance and appeal rights to see if they can override that denial.
Michelle wants to know if you can have both Medicare and Medicaid.
Yes. So thanks for that question. You can have Medicare and Medicaid. Medicaid is depending on your income and your assets, because Medicaid is handled by the state. Each state has their own set of rules regarding Medicaid eligibility, but if you have both Medicare and Medicaid, you're considered to be dual eligible. So you, depending on your Medicaid level, you will have assistance regarding your co-pays, your out-of-pockets, and also when you have Medicare and Medicaid, you're automatically enrolled in what they call the extra help, the low income subsidy, which is it's from the Social Security, where it helps people with their prescription drug costs. So it definitely, with someone that has MS, with the high cost of drugs, if they qualify for that, that would, drastically reduce their prescription costs and, provide more money for more important things.
Daryl tells us that he's caring for his mother, whose MS is advancing. He's trying to make her home more accessible and is wondering if Medicare includes coverage for modifications such as wheelchair ramps or doorway widening.
I would check the medical coverage guidelines, because again, unfortunately, there are certain things that Medicare doesn't cover if they feel it may be a convenience item. But if it is medically necessary, they have the right documentation to support the need for those services, then Medicare may cover it, but it definitely depends on the criteria, the medical coverage guidelines.
I want to thank everyone who submitted some great questions, and thank you, Laquel, for being with us today.
Thank you for having me today, John.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Laquel for joining us today. Please remember that a recording of this webcast will be made available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Laquel Thomas and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. Integrative medicine brings conventional and complementary treatments together in a coordinated way. This type of approach to health and wellness represents a growing trend across the United States, especially among people living with a chronic disease like MS. Dr. Lynn Shinto is with us today to explain what integrative medicine is all about. We'll talk about its effectiveness and how to safely use complementary treatments in MS care. Dr. Shinto is a professor in the Department of Neurology at Oregon Health and Science University, where her research focus is complementary, alternative, and integrative medicine. Welcome, Dr. Shinto. Thanks for being with us today.
Hi, John. It's a pleasure to be here.
Before we dive in, I'm hoping you can help clarify what the terms complementary, alternative, and integrative mean. I know they're sometimes used interchangeably, but do they all mean the same thing?
That's a great question, John. They don't all mean the same thing. So complementary means non-conventional with conventional medicine. For example, you could take vitamin D with a MS disease modifying therapy, and vitamin D would be complementary to the conventional disease modifier. Alternative means non-conventional or in place of conventional. So using that same example, if you only use the vitamin D for disease progression and you didn't use the disease modifier, vitamin D would be considered an alternative treatment in MS. Most people with MS use complementary medicine for MS or integrative. So that's using the complementary and the conventional therapies for MS.
So how are complementary and alternative medicine different from conventional medicine?
That's a great question too. So I would say that the first thing is that for complementary medicine, there are less scientific studies evaluating its effectiveness and safety than conventional medicine. So there are way less clinical trials, and because of that, there is less sort of known evidence base for complementary alternative medicine. I think the second thing is for conventional medicine, the FDA has regulations around conventional drugs like the disease modifying drugs, or like, let's say, an antidepressant like Zoloft. The FDA has regulations around those drugs. They are FDA indicated or on label. for a lot of the dietary supplements, because of the Dietary Supplement Health and Education Act, or we just call this DSHEA, in 1994, this is a US law that defines and regulates dietary supplements, and the regulation is not the same as an FDA regulation on a conventional medication. It places dietary supplements in a category that's distinct from foods and drugs. It allows supplements to be marketed without pre-approval from the FDA, as long as they don't claim to diagnose, treat, or cure or prevent any disease. So for example, let's take vitamin D. Vitamin D, if there was a claim on the label that it treats MS, the FDA would take that off the market. But it can say anything else, it can be used for wellness or something non-specific, and that can be allowed on the market. So the other thing is that there is, even though the FDA is not regulating many of the dietary supplements, under DSHEA, supplement manufacturers are responsible for ensuring their products are safe before marketing them. And the FDA has the authority to remove unsafe dietary supplements. For example, in the early 2000s, there was an herbal used for energy and weight loss called ephedra. And there were reports of serious side effects, heart attacks, even deaths. And because of that, the FDA removed ephedra from the market, and it is no longer on the market. Having said all that, there are many dietary supplements that are on the market that we need to pay attention to and be careful of, but many of them are safe. And if they're not, the FDA does regulate that.
Which you started to answer my next question by giving us that example earlier of vitamin D along with the DMT. I was hoping you could share some other examples of common integrative health approaches for treating MS.
Sure. So there are many complementary therapies that are commonly used with DMTs or with other, MS symptomatic drugs, and they seem to be very safe. And so this would include yoga, kind of mindfulness or breathing techniques for stress reduction. There are many people with MS who use specific diets, like a low saturated fat diet, the Wahls diet, with, disease modifying drugs or other drugs. And this would be an example of common integrative health approaches for people with MS.
According to the National Center for Complementary and Integrative Health, about 37% of U.S. adults use some form of integrative medicine. Why do you suppose there's so much interest in this approach to healthcare?
I think
our
there's
healthcare system
a
is
big
horrible to begin
interest
with.
in wellness and a holistic approach.
And it's not about fixing
So I
it.
think a lot of people, they're very satisfied with their conventional therapies and their conventional doctors, but there's always room for improvement, right? And everybody likes to feel a little bit more empowered. So I think people really want to feel well, and they want to feel that they're doing everything they can for their health. They want to look at their whole body, approach things in a very whole body, holistic way. And conventional medicine traditionally addresses a disease state or a symptom. So I think this sort of move to a more positive, more empowered, sort of the person, is the driver. When you do a diet, you don't need a prescription for that. You control that. And diets in general, even outside of MS, are healthy. So I think that sort of holistic, empowering feeling is one of the reasons why integrative medicine is becoming very popular.
We heard from Scott, and he's asking what the benefits and risks of integrative medicine are.
Okay, I mentioned some of these when answering the previous question.
Make sure you
I'm
keep
going to
them
start
on
with the
your shoulder.
benefits. So again, I think holistic care are some of the benefits. Taking account of the whole person, not just the disease state, not just a symptom. We're looking at mind, body, and spiritual wellness rather than treating symptoms and disease. I think that's a real benefit of integrative medicine. It's very patient-centered. Treatment plans are tailored to the individual needs, preferences, values of the patient, and the patient is empowered. You know, when they learn about a specific diet for MS that could be helpful, or they want to do a different kind of movement like yoga, this is very empowering, and this puts the patient in the driver's seat rather than just as a recipient of, you know, things that someone tells them that they need to do. I think the other thing is that integrative medicine really focuses on promoting health and also in preventing, you know, your health to get worse. But this promoting health piece, I think, is one of the benefits.
Any risks to consider?
Yeah, for the risks, I sort of would like to reframe the word risk to barrier, because some of the risks aren't true risks, but they are barriers. One of the barriers, which I already talked about, is that compared to conventional medicine, there are very few large studies in integrative medicine therapies, as single therapies or as combined therapies. For example, evaluating diet in MS, there's a handful of small published studies. Most show benefit, but you know, we don't have these big, large studies that we have in some of the MS DMTs. And so I think that is one of the barriers, is that the scientific effectiveness and risks aren't fully known. Many people do multiple therapies. They do multiple complementary alternative therapies, and there are extremely few studies looking at multi-component CAM therapies in MS. So in general, clear scientific evidence-based recommendations are difficult. You know, this is difficult for a patient, and it's difficult for providers when they're making recommendations.
Sure.
The other big barrier is cost. So many complementary therapies like dietary supplements or singing acupuncture, or even I'm a naturopath, seeing a naturopath, are not covered by insurance. And this is an out-of-pocket cost, and sometimes that cost can be, you know, high.
Well, I just heard you mention acupuncture, and we heard from Jenna, who tells us she's considering acupuncture treatment to help her with MS-related numbness, pain, and spasticity, but she has a couple of questions before she's ready to fully commit. First, she wants to know, is acupuncture safe for people with MS? And Jenna also wants to know how you assess the possible risks associated with acupuncture or any.
If you have acupuncture done, you need to see a licensed acupuncturist. And there are some national databases for people who are licensed in acupuncture that, and I can put this in a resource later on, that people can access to see who is a licensed acupuncturist. I think it's really important when you're doing a therapy like acupuncture that, you know, you have someone who is trained, well trained. The other way to find a licensed acupuncturist is your healthcare provider. Many medical schools and hospitals now have acupuncturists within their outpatient and even some inpatient care. So your PCP might know of an acupuncturist that they can recommend. And actually, family and friends are good resources for seeing an acupuncturist. You may have a friend or family member who actually gets acupuncture, maybe for low back pain, and they really have had benefit, and they trust that person. So that's another resource for finding an acupuncturist. Acupuncture there have been actually quite a number of trials in low back pain, not necessarily in MS, but for low back pain. And it is very safe in low back pain. In general, clinical trials in acupuncture, the risks are very mild, and serious adverse events are extremely rare. I would say that the main side effects are you're using these very fine needles. So sometimes there's a little bleeding where the needles are placed. Sometimes there's a small bruise. This would be transient. Sometimes people feel sleepy during their treatment and maybe a little tired or sleepy after treatment. This is also usually transient. That feeling normally goes away. I would say these are the main risks, and they're very, very mild, low risk.
Well, Jenna says she's also interested in learning what other complementary therapies might be good for managing numbness, pain, and spasticity.
In MS, there's some scientific evidence to support cannabinoids off-label for spasticity. The research is mixed. And then there is limited evidence for using low-dose naltrexone in MS and fibromyalgia. And we can talk about that later on.
Happy to circle back to that. We've also heard from Michelle, who wants to know if there are integrative therapies to help keep her brain healthy and prevent future cognitive impairment.
Yes, I get asked that a lot. And for me, the pillars to brain health are a healthy diet, being active, so movement, physical activity, and stress reduction. So for some people, that actually is physical activity, is their stress reducer. Like for me, that's my stress reducer. For others, it could be breathwork techniques. It could be, mindfulness practice. But however ways someone feels comfortable coping with stress, those coping skills are really important for brain health. And I think often people forget that stress, I think especially in MS, is not good for the brain.
Tyler's asking if there's an integrative medicine approach that can help manage his MS-related fatigue.
Sure, I get asked that a lot. And for me, my first go-to is diet. There is evidence that several diets actually improve, scientific evidence that several diets improve fatigue in MS. The different diets that have shown this are the Overcoming MS diet, which is mostly a plant-based diet, plant-based, whole grain. Fish is allowed, but not red meat or chicken. It's a very healthy diet. The Walls is a modified paleo diet, so it's kind of interesting because it's the opposite of the Overcoming MS diet, but it's also a low processed food, low sugar. You can eat red meat, a lot of vegetables. The Walls diet actually has, I think you have to have 9 servings of vegetables a day. And then there's the low saturated fat
9
diet.
servings of veggies?
Very low saturated fat, less than 15 grams per day. That diet also has evidence for decreasing MS fatigue. So I usually, because diet has benefits even if outside of MS, a healthy diet has many benefits for cardiovascular disease, for brain health. I usually recommend some type of healthy, low or no processed food, low or no sugar diet.
We heard from Bella, who agrees with your previous comment that it's important to find specialists who are trained and have the proper qualifications for treating others. Bella wants to know how she should go about finding an integrative medicine provider, not only in the field of acupuncture, but how to find an integrative medicine provider who's an accredited specialist.
Sure. So usually states have licensing boards, and so depending on what the provider is, so for acupuncture, there's state boards that list all the folks that are licensed through their state, and that's one way to find out. In Oregon, we have a licensing board, and you can just type in a name and they'll come up as either being licensed or not for acupuncture. Also for naturopathic medicine, we have the same thing. For chiropractors, there's the same state and national level licensing boards or information on the national level about who is licensed or who is not. So that's one way to find out if someone actually has a license. Again, I mentioned that a lot of medical schools or hospital integrative medicine centers, they need to credential their providers. So they're already vetted, and they have to have a license, and they even have to have sufficient training and expertise in their field. So if you have a hospital that has an integrated medicine center, that's a good place to go or to start, because those providers are well vetted in what they do. And then again, I also mentioned previously that your medical provider may know of a licensed integrative medicine provider. So, I think it's worth asking your PCP, or if there's a nurse practitioner, a PA that you see, they may know of a licensed integrative medicine provider that they can recommend.
You also mentioned naltrexone a moment ago. It's a drug best known for treating opioid addiction. And because low-dose naltrexone is being used as an experimental treatment for MS, it falls into that alternative therapy category. So what can you tell us about low-dose naltrexone?
Yeah, so first I want to just clarify what the conventional naltrexone is, just because in that context it's easier to talk about low-dose naltrexone. So naltrexone is used conventionally and is FDA approved at a dose of 50 to 100 milligrams for opioid and alcohol substance abuse. And how it works is it binds to opioid receptors, to multiple opioid receptors for a long time, 24 hours. So the difference between naltrexone and low-dose naltrexone is used off-label. It's used at a dose that's 10 to 15 times lower than the naltrexone dose. So the dose range in clinical trial for low-dose naltrexone could be less than a milligram to up to 6 milligrams versus the 50 to 100 milligrams in naltrexone. The usual dose in clinical trials is 1.5 to 4.5 milligrams per day. And at that low dose, instead of binding to the opioid receptors for a long time or for like a day, it temporarily binds to opioid receptors, and more specifically, a specific receptor called the opioid growth factor, or OGF. And when it binds for the short time, the body will respond by releasing natural endorphins that function to relieve pain. And these natural endorphins are also immunomodulatory. And this is why low-dose naltrexone has gained traction in MS and other pain conditions like fibromyalgia that, where the immunomodulatory effects might be beneficial. So that is just a description of low-dose naltrexone. It's used off-label. For MS, the studies show no clear indication that it helps with pain or spasticity. But there are studies that show improved quality of life. A lot of these studies are pilot. They have small sample sizes, less than 100 participants. And most of them are short term, so they last from like 2 to 6 months. The dose in clinical trial for MS is 3 to 4.5 milligrams per day. Again, usually short term, 2 months to 6 months. These studies have been done in relapsing remitting and also progressive forms of MS. I want to mention that there is one long-term open label study. So that means that it's not randomized, there's no placebo group. Everybody's getting 3.0 milligrams of low-dose naltrexone, so everybody knows they're on it. But it's a long-term study that's published, and it these folks had been taking this dose for 2 years. It's in primary progressive MS. And what they found was that disability scores were stable over 2 years, which, without the comparison group or the placebo group, it's hard to say, would the comparison group show the same? Not clear. But it does show that, disability didn't get worse on the low dose naltrexone. So it's a little bit of an indicator that, maybe we need to study this in a more well-designed and rigorous clinical trial. I think all the studies, whether they're in MS or in other groups like rheumatoid arthritis, low-dose naltrexone is well tolerated. The side effects are fairly mild, some of them transient. So they can include fatigue, which is often transient, GI upset, so maybe some nausea, diarrhea, stomach pain. That's usually transient. Vivid dreams is a common side effect, and sometimes people don't mind this. They have vivid dreams and, it's not bothersome, but sometimes this can disturb sleep. So usually if it's vivid dreams, then often the low-dose naltrexone is taken during the day and not at bedtime. Headache is a common side effect, and very, very rare reported side effect is body rash. That's not usual.
Well, thank you for sharing your insights about integrative medicine and MS. I'm sure at least some of our viewers are learning about this approach to healthcare for the very first time today. Now I'm hoping you'll share your top takeaway message that you'd like our viewers to remember and put to use.
Yeah, so I have top takeaways. I have 4 of them. So usually complementary medicine with conventional medicine offers a whole person approach to health. And this can be very empowering, especially with diet, physical activity, and mind-body or stress reduction therapies. These are also, these 3, like what I called the pillars earlier, seem to be very safe with conventional drug therapies for MS. Many complementary therapies in MS, I think especially dietary supplements, have not been well studied in clinical trial. So therefore, effectiveness and safety is not well known. The pillars are diet, physical activity or movement, and stress reduction. And these, again, are often safe combined with conventional therapies. And the last takeaway is when seeing a CAM provider, be sure they're licensed and have the expertise in what they are doing.
Well, I want to thank everyone who submitted some excellent questions, and thank you for being with us today, Dr. Shinto.
Thank you, John. It was a pleasure.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Shinto for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find the link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Lynn Shinto and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering questions, connecting you to resources. Stress is a common and sometimes unavoidable part of life. What someone finds stressful and how that stress affects them, well, that varies from person to person. While it's not possible to eliminate all sources of stress, it may be possible to control our response to those stressful moments in life. Dr. Grace Tworek is joining us today to share strategies and habits that can reduce stress and improve the quality of life for people living with MS. Dr. Tworek is a clinical health psychologist at the Mellon Center for Multiple Sclerosis at the Cleveland Clinic. Welcome, Dr. Tworek. Thanks for being with us today.
Thank you so much for having me. I'm very excited to be here.
You know, I think managing stress is important for everyone, but how are stress and multiple sclerosis related? And why is stress management especially important for people who are living with MS?
Well, stress and MS are related in a way that they have kind of a significant yet complex relationship with one another. So what I mean by this really is that stress experienced by someone living with MS can actually play a large role in the way that they experience symptoms of MS, their overall mood. Usually, when I'm referring to mood, symptoms of anxiety and depression, and can even exacerbate the way that they experience physical symptoms and overall quality of life. So since we know that this relationship between MS and stress exists, this means that we can work towards managing stress. And if we're managing stress, this can actually have a really positive impact on overall MS management, quality of life, mood, whereas difficulty managing stress may complicate or further complicate mood and MS symptoms. So really overall, in many ways, when we manage stress, we can also increase management of symptoms and improve mental health. And that mental health piece can really apply to anyone listening.
Well, we heard from Chris, and he's wondering if there's evidence that stress can actually cause an MS relapse or disease progression.
Sure. So within our current literature base, there is evidence that support stress can impact onset, severity, and overall course of multiple sclerosis. However, this does not always mean that stress is guaranteed to lead to increased disease activity or progression, but rather that there's a significant relationship present there. There's also evidence that stress can lead to what we call a pseudo flare or a pseudo relapse, in which someone experiences symptoms that they may attribute to MS, whether those be new symptoms or a worsening of existing symptoms, but it isn't necessarily indicative of new disease activity. So if we recognize that stress can have an impact on MS, we can also recognize that effectively managing that stress can have a positive impact when it comes to managing symptoms.
What are some of the common factors that can cause stress for someone who's living with a chronic illness like MS?
That's a great question. And stressors can be what we would refer to as more universal, or they can be really personal. And what I mean by this is that there's some things that many people living with MS may go through and may be able to see others going through as well. That is very stressful. Think about, initial diagnosis, establishing your treatment team, deciding on a disease-modifying therapy. And there's also going to be stressors that are more personal. So this may be interpersonal relationships within your family, moving, kids growing up and leaving the house, right? So there's going to be things that feel more universal and things that feel more personal. But what really matters here is that when we can identify what stressors are, we know how to work towards managing those. And something I always like to throw in when we're talking about stress is that sometimes stress gets a bad rep. We tend to think about stress as being associated with negative events. But sometimes some of the most exciting events of our life can also be stressful. So I like to think about, weddings, kids going off to college, right? These things are exciting, but can also bring stress too. So really being able to identify the things in your personal life that may cause stress for you are going to be some of those factors that may have an impact on how you experience MS.
Well, Bella says she's wondering how to tell if she's stressed. Are there any physical or emotional signs that she should be paying attention to?
Sure. Well, Bella, there's actually quite a few cues that we can pay attention to determine if we're experiencing stress. So stress is actually a phenomenon that most often occurs when we experience some sort of perceived threat. That threat might be physical or psychological, and our body responds to this perceived threat in a variety of ways. Physically, this might look like increased heart rate, restlessness, feeling on edge, headache, even GI upset. Emotionally, this might look like feelings of overwhelm, feeling as if your fuse is a little bit shorter than you're used to it being, or even feeling less excited about things that normally you enjoy. Mentally, it can also feel like you're in a little bit of a fog, might feel a little bit harder to think clearly, or you might be feeling distracted. So there's many different types of indicators of stress, as stress can manifest in lots of different ways.
We heard from Jacqueline, who tells us that she's heard that some of the physical symptoms of stress could be fatigue and muscle tightness. She says she experiences both of these symptoms, but they're also very common symptoms of MS. And Jacqueline wants to know how she can identify symptoms of stress versus symptoms of MS.
This is a really important question because sometimes they feel really intertwined, right? And there are times when stress can actually impact the way that MS symptoms are experienced. So in this example, fatigue and muscle tightness can be further exacerbated by stress, meaning that in a strange way, while these symptoms for Jacqueline are MS symptoms, they're also affected by her level and her experience of stress. So when we're trying to identify the source of a certain symptom, it can be really helpful for us to monitor over a period of time. Is there a certain time of day that symptom tends to change? Does it tend to change or feel different in different scenarios or different situations or around different people? And when we monitor, this can really give us insight into what may be causing a symptom to be present or to worsen. And once we've identified this, it can give us a few key indicators on how to manage that symptom. And if that symptom tends to be present pretty regularly and doesn't seem to wax or wane with stressors, that may be a good indication that it could be a symptom that would be worth talking to your neurologist about.
You and your colleagues conducted research that focused on developing and implementing a short-term stress management protocol for people with MS to see if it impacted their stress, depression, and anxiety. What did you learn in your study?
Sure. So the aim of our study was really to create a feasible and realistic approach to developing an effective stress management program using skills and seeing that the impact that this had on mood and stress levels of the patients that we work with. So while there's a lot of current stress management protocols that exist, they tend to be quite lengthy and require quite a lot of time from folks that engage in them. Some of these protocols require 16 or more sessions to take place. We recognize that a protocol of this length might be really difficult for the folks that we work with here at the Mellon Center, given that they're already managing multiple doctor's appointments, DMT management, and responsibilities within their day-to-day lives. So we really wanted to develop a protocol that was realistic and assisted in developing skills in a shorter period of time. And our goal was to allow folks to feel confident in managing their experience of stress in as little as 1 to 4 sessions with us. We also incorporated the use of a biofeedback tool to allow our participants to observe the effects, the positive effects that stress management skills were having in real time in our sessions. So our tool was looking at measures like heart rate and breathing regulation. So we could kind of see in real time how the body was responding to our skills. And the overarching goal here was to develop a program where we can teach skills that allow people to see measurable change in mood and in stress in their everyday lives so that they can spend more time doing the things that they enjoy with the people that they love and less time feeling like they needed to be here with us in our office doing these sessions.
Well, I have to ask, what types of stress management skills are used within this stress management protocol? And are these the same stress management skills you might recommend within your own practice?
Yeah, so there were actually a variety of stress management skills that I use on a regular basis within my clinical practice that were incorporated into our stress management protocol. So some of these skills included breathing exercises. Specifically, diaphragmatic breathing is one that we use often, and this is an exercise where we're really focused on strengthening the diaphragm, which is a dome-like shaped muscle that sits under our lungs. This is often also referred to as belly breathing. So in this exercise, we're putting one hand on our chest, one hand on our belly button, and really trying to focus on feeling movement in the hand that's on our belly button. So we want to feel movement in our belly, but not so much movement up here on our chest. We also use meditation exercises. A lot of these focus on visualization. One of my favorite exercises is to have folks visualize a place where they feel they're most calm, they're most at peace, a place that they really enjoy, and try to visualize this in the most detail they can. So identifying colors, smells, sounds, even tastes that make this place so calming. That way we can return back to this place with practice of visualizing ourselves there in moments of stress or overwhelm. We also use some different mindfulness exercises, which is really just the practice of being aware and present in our current moment.
Are there other strategies that can be effective in managing stress?
Absolutely. There's lots of different strategies that can be successful in managing stress. Some of those being engaging in activities that you already enjoy or maybe that you used to enjoy. Stress can do this thing where it makes us feel like doing activities that we enjoy or just that are pleasurable to us kind of have to take the back burner. However, when we prioritize time to engage in activities that we enjoy, we're actually taking care of ourselves. But it's also really important to note that activities we enjoy might look different depending on where someone is in their MS journey as well. So what I really mean by this is, for example, sometimes I hear, I used to really love to ride a bike, but I can't do that the same way anymore. So what we really try to do is break down that activity. So what was it about riding a bike that you enjoyed? Was it the actual act of riding the bike? Or was it that you used to ride your bike with your spouse outside, feeling the sun on your shoulders and the wind in your hair and listening to the birds?
I can't ride bikes.
And if there's other aspects that we can piece apart about that activity, we can actually take those things that you enjoyed and determine if there's other activities that might elicit that same response. So perhaps it is being with your spouse and being outside, feeling the sun and listening to the birds. Well, can we get that same feeling from going on a short walk or sitting on the porch during the summertime? And if so, then we can do that activity to get a similar response as the activity that we previously enjoyed.
Lisa tells us that she tends to worry a lot, and she always expects the worst to happen. She's been trying to shift her mindset and think more positively, but she finds it difficult. Do you have any advice for how Lisa can get better at seeing the world in a more positive frame?
Sure. Well, to start, it's actually quite normal for it to feel difficult when we're trying to make a change. So, Lisa, you're not alone in that. When we're trying to shift the way that we think about something, it can
Shift the
almost
way,
feel like
yeah.
work when we're initially trying to do so. However, the more that we intentionally practice, the better we become over time. And when it comes to expecting the worst, one of the most powerful things that we can do is examine the evidence that we have. So for example, maybe we have an upcoming event that we're going to attend, and we're anticipating we might not enjoy that event. Maybe it's a family event, for example. Think about the past family events that you attended. Did you enjoy those events? Were you happy that you attended? And what about the last event made you happy? Now, this evidence needs to be tangible, real evidence from previous experiences that you engaged in. Because oftentimes our negative thought patterns tend to focus on what ifs or could be's. But by gathering evidence from our past previous experiences, and in this case, perhaps you left all of your past family events feeling really good and happy to have spent time with people you love. This is a good indicator that our evidence shows you will likely enjoy this upcoming event. And then we can think more positively once we've walked through this process. So really, continuing to practice and giving yourself a little bit of grace if you're having a difficult time. But if practice starts to feel difficult, or you notice that in your attempts to rework thoughts, you're noticing a negative impact on your mood, this might be a good indication that reaching out to a therapist or a counselor might be a good idea as well.
Dylan says he's been dealing with stress what feels like his entire life, and he's wondering if learning some of these new skills will make a difference in how he experiences symptoms in both his mood changes and his MS.
Absolutely, Dylan. So when we think about stress, we oftentimes tend to think about those shorter term consequences of that physiological stress response happening within our body. We often refer to this as fight or flight. Might feel like increased heart rate, taking more rapid breaths, feeling sweaty and trembly. However, we also know that long-term exposure to stress can actually have significant impacts on our mind and our body. Increased risk of anxiety, depression, changes in cognitive functioning, increased experience of pain, and even changes in immune functioning as well. So knowing the impacts of long-term exposure to stress supports that learning new skills might actually make managing that stress feel more realistic. And if it feels more realistic, you'll feel confident in those skills, and therefore we begin to counteract those consequences of long-term stress, lifting mood, reducing pain, and even making some symptoms of MS feel more manageable as well.
Maya practices meditation every morning, which helps her reduce stress. And she's wondering if stress management skills become less effective over time the more you use them.
Sure, this is actually a question that I get quite often, and it makes sense that we're concerned about the long-term efficacy of these types of skills, but I have some really good news here. So when we're engaging in stress management techniques, we're essentially teaching our body to relax and reducing the impact of that physiological response that I just talked about, so that fight or flight. There's a whole other side of this system that we often refer to as rest and digest, and that's kind of the opposite of the symptoms that I just talked about. So slowing down the heart rate, taking slower oxygen-rich filled breaths, allowing our body to digest, and all of these great functions. So the more we practice this, the better our body gets at understanding that these skills are cues to engage in that relaxation response. So in Maya's case, this would be meditation. So when she's engaging in meditation, her body's learning, hey, it's okay to relax. There's no threat here. Maya's telling us we're okay and we can relax. And unfortunately though, one of the realities of life is that stress is always going to be present. We can't make it go away totally. So the more that we practice these skills, it actually makes them more effective in the face of stress. In fact, it takes about 4 to 6 weeks of regular practice before these skills start to feel really effective in the face of a stressor. So the more we practice, the more our body is prepared when stressors come up. So, short answer, nope, we cannot practice too much.
Jason says that he's been struggling for a couple of months now. He has two questions for you. He's wondering how he can tell the difference between stress and anxiety, and he wants to know, when is it the right time for him to see a mental health professional?
Well, Jason, this is an important differentiation, and I'm really glad this topic came up. Stress, like I've alluded to previously, is something that we're all bound to experience at some point in our life. But once we find skills that work for us, we should be able to find ways to make that stress feel more manageable. If someone is finding they're feeling on edge, worried about a variety of different things, feeling less motivated to engage in things that they normally enjoy, and finding that those worries they're having feel difficult to control despite efforts to do so, this might be a good indicator that it's time to talk to someone and therapy could be beneficial. Another tangible indication engaging in therapy might be helpful if you start to notice symptoms of anxiety beginning to impact you in multiple different roles of your life. So what I mean by this is if you're having worries in one area, maybe at work, and they start to impact how you're able to engage at home in other roles, maybe being a spouse or being a parent. So if we're feeling that stress from one area is almost spilling over and impacting your ability to be present and engage in other parts of your life, this is a really good indicator that therapy might be able to really help you out there.
What resources would you recommend to
I'll just add more
individuals
to my stress,
who
that's another
need more
pellet.
support in managing stress or other mental health challenges?
There's a lot of great resources available, but two of the resources specifically surrounding mental health that I tend to reference due to their accessibility and quality of care include the tools that are available on the National MS Society. They have a great tool within their website where you can put in your location, as well as finding care providers that work specifically in the field of MS. And the selection on their website, I believe, is called Interest in Support and Mental Health Resources. So that's one that I always give. And additionally, there's a website called psychologytoday.com. This website is great because you can log on to there, you can put in your location, and there's lots of different tools that you can use to filter based on your insurance, specific topics that might be of interest to you. So in this case, maybe anxiety or stress. And you can even filter if there's a specific gender of therapists you would like to work with and a specific location. So maybe you live in a certain area, but you would like to see a therapist in another area near where you live. And then you can filter through, read the bios of all of the different therapists available, all their contact information, and select one that you feel like might be a good fit for you.
That's too much work.
Then when it comes to stress management skills, there's a great application available free of charge on smart devices called Insight Timer. It has an extensive library of tools that can assist in guiding you through different breathing exercises and even some great sleep meditations, which is a favorite of mine. So these are some really great tools.
Well, you've shared some great information and some great stress management skill strategies today. What would you say is your top takeaway that you'd like our viewers to remember?
I'd have to say that my top takeaway message today is that while stress can certainly play a role in how MS symptoms are experienced and overall mood, there's many different skills and resources that we can use to make stress feel more manageable. Engaging in activities you enjoy, spending time with people that you love, taking time to relax and engage in activities that make you feel calm and present, maybe some breathing or meditation, all hold value in supporting your mood and quality of life. Having skills that we feel good about when it comes to managing stress can actually bring a sense of confidence and control in your MS journey.
Thank you for sharing your expertise with us, Dr. Tworek. I think we have time to answer one or two more questions from our audience. We heard from Crystal. Crystal's husband was recently diagnosed with MS, and he's been very stressed over the uncertainty how MS may impact him in the future. His stress is starting to affect Crystal and the kids, and Crystal wants to know how she can best support her husband and help him reduce his stress level.
Crystal, thanks for your question. And I think that The fact that you're even writing in and noticing this trend says a lot about you. When it comes to supporting our loved ones and helping them to reduce stress, one of the greatest things that we can do is ask if there's something that we can do. Ask if there's anything that we can do in the process to get them connected to someone that they may want to talk to. And as a caregiver or spouse, it's also important to make sure that you're taking care of yourself as well. So looking for resources for caregivers can be a really good place to start, because sometimes you'll learn about resources that might be really impactful and helpful for your husband as well. So asking and looking for the resources out there and bringing those to the table.
Kenya tells us that she gives a lot of presentations at work. She says she sweats, gets clammy hands, and has dry mouth right before and during the presentation, which makes it uncomfortable when she's speaking. She's wondering if you have any tips to keep her calm so she can avoid experiencing these very real physical symptoms while she's giving a presentation.
Absolutely. And you're right. Those symptoms are very real and can feel really distracting in the moment. And it sounds like that's your fight or flight system blaring some of those alarms and letting you know that maybe you feel like this is a stressful event. So something that we can do leading up to a presentation is engaging in some of the strategies that I've talked about. One of my favorite being using deep breathing exercises. So practicing some of these exercises regularly outside of presentation time, leading up to presentation, knowing that they can help manage and shut off that stress response. So the more we practice before presentation time, the more effective those skills are going to be right before using them in a presentation. But right before you step out and start that presentation, they'll be great to have in handy as well.
Well, I want to thank everyone who submitted some great questions. And thank you, Dr. Tworek, for being with us today.
Thank you so much for having me.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcast. I'd like to thank Dr. Tworek for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. Now, I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Grace Tworek and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years. So I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. When you're living with MS, choosing to maintain a healthy lifestyle can make a real difference. Joining me to talk about the importance of maintaining a healthy lifestyle and to share some valuable strategies on tips for living your best life is Dr. Lisa Doggett. Dr. Doggett is a family and lifestyle medicine physician at the MS and Neuroimmunology Center at Dell Medical School at the University of Texas at Austin. And she's the senior medical director for Sagility. Dr. Doggett has been living with MS since 2009, and she's the author of the memoir, Up the Down Escalator, Medicine, Motherhood, and Multiple Sclerosis, which follows her transformation from doctor to patient living with MS. Welcome, Dr. Doggett. Thanks for being with us today.
Thank you so much for having me back.
Lifestyle medicine may not be a term that all our viewers are familiar with, so I hope you'll start us off by explaining what lifestyle medicine is and why it's important to maintain a healthy lifestyle.
Sure, thank you so much. Lifestyle medicine hasn't been around a very long time. The American College of Lifestyle Medicine was formed in 2004, so it's a fairly new specialty, but a lot of the components of it go back for centuries, really, and rely on a lot of longstanding research. So lifestyle medicine is based on 6 pillars that include, of course, nutrition, but really specifically a whole food plant-based diet, which I'll talk more about, as well as exercise, maintaining physical activity. Sleep, of course, very important, is one of the other pillars, as well as avoidance of unhealthy substances, stress management, and my favorite, which is connection with others. We know that these lifestyle medicine tenets are especially important for people living with MS because people with MS are at higher risk for other chronic diseases like heart disease, other autoimmune conditions, stroke, obesity, diabetes. So we want to make sure we prevent these other chronic conditions, and lifestyle medicine can help us to do that.
So how can someone go about incorporating healthy habits into their life?
Well, I think it takes a real commitment to self-care, and I really have talked to my patients. I now work with people who have MS, and I talk to them about how MS really can be, it's a huge life-changing experience to get a diagnosis with MS, but it can also be a launch pad for a even healthier lifestyle. So let your MS guide you to a healthier lifestyle. And I think really that means committing yourself to self-care, make sure that you're following those 6 tenets as best you can, learning the best ways to stay healthy. And it's very confusing. There is so much misinformation out there, a lot of confusing information. You want to make sure you're getting that information from reliable sources like the National MS Society, which has an amazing website and all kinds of great programs and webinars and other great sources of information. Also, you want to assess your current situation. So if you are dealing with, a challenging diagnosis like MS, you're wanting to change your lifestyle because you're concerned about progression or about other comorbidities, you have to see where you're at now with all of those different tenets of lifestyle medicine, and then what are you willing to change? It may be that you can tweak some things here and there, or maybe you want to make a massive lifestyle change. But just determine where you are and your sort of thinking around what you want to change. And then you want to set goals. So you want to be specific, but realistic, and what is really attainable, what are you really going to do, and also what's impactful for you, what's going to really make a difference in terms of your overall quality of life.
I always find it's easier to make a change when I understand how I'm going to benefit. So tell me, how can adopting a healthy lifestyle be beneficial for people who are living with MS?
Well, a healthy lifestyle not only helps prevent and reverse even other chronic conditions that we often can see alongside MS, it also can help us live with MS because it can reduce symptoms. So people who struggle with fatigue can benefit from improving their sleep quality, improving their activity during the day, and even their diet. People who struggle with mobility can really improve their functioning through being able to do more, being more active. All of the tenets really go together to improve mood as well, which we know is an issue a lot of times in people with MS. So reducing symptoms is a big one. Also slowing progression. So this is a tricky one because there's not as much research as we'd like, but we do know with pretty good solid evidence that exercise, regular exercise, reduces disease progression in MS. We also know that it's important to continue using your disease modifying therapy. And I do want to emphasize that because I am not recommending anyone stop their DMT, even if they're adopting all of the tenets and recommendations from lifestyle medicine. This is really supposed to go alongside the medications that your neurologist has recommended. And then again, preventing other chronic diseases, so important. My kind of motto is one chronic disease is more than enough. We don't want people to develop other comorbidities.
I like your motto. Actually, we heard from Sabrina, who has 2 questions for us. Sabrina says she's confused about the relationship between diet and MS. She wants to know if there is a specific diet that's beneficial for people living with MS. And she wants to know what are the most effective strategies for adopting and maintaining a healthy, nutritious diet if you're living with MS.
Well, I can understand why Sabrina is confused. There's a lot of research still going on to help us determine what the best diets are for MS, but there is not one MS diet, despite what you may see in bookstores and online. What we do know, though, is that a whole food, plant-based diet has been shown through decades of research to reduce other chronic conditions. And there is some evidence that diets very similar to that are focused on lots of plants, vegetables, fruits, nuts, seeds, legumes, whole grains, diets with those components tend to help us do better in terms of reducing other chronic conditions. Therefore, we know that we're more likely to improve our functioning and quality of life if we don't have those other comorbidities. So a whole food plant-based diet, I think a lot of people are resistant to going kind of the full scope of whole food plant-based diet, eliminating all animal products. And yet there's a lot of things you can do right now, even if without making a drastic change in your diet to improve your overall health. So some specific things, increasing fruits and vegetables. I recommend at least 5 servings a day if you can get there. If you're only at 1 now, go to 2, go to 3, but try to get up to at least 5. Reduce or avoid red meat. Red meat in most of the diets that have been looked at in terms of prevention of other chronic conditions and with MS, avoiding red meat is or at least reducing it is important. You also want to avoid sugar sweetened beverages, which is a real common cause for obesity and doesn't give us a lot of good nutritional benefit. Reduce or avoid ultra processed foods. Those tend to be in packages. Lots of snacks are ultra processed, whereas we want the whole food. So a solid apple, not apple juice or apple sauce. We would rather that you eat the fruit in its original form to be at healthiest.
Exercise is beneficial for everyone's overall health. However, some people living with MS can find exercise challenging because of their particular set of MS symptoms. What strategies or adaptations would you suggest for effectively incorporating exercise into a daily routine?
Yes, exercise is so important, and it can be really difficult if you're struggling with symptoms like fatigue or, again, physical limitations. So, I do think that it's important to be creative, to work with a physical therapist or an occupational therapist if you're struggling and need to come up with some modified activities that can be useful to keep you moving. But I do think that almost anyone can exercise if they make it a priority and if they focus on their abilities rather than their disabilities. Especially if you're struggling with something like fatigue and you haven't exercised in a while, it's important to start off slow, gradually build up. So maybe it's just taking a walk twice a day for 5 minutes, and then you're working your way up to 10, and then even more. Exercise can also take different forms for different people. So you want to be open-minded to new forms of exercise. Like maybe you want to try water-based aerobics or yoga. Stationary bike can actually be a really good source of exercise for people that may have other mobility challenges. And you, of course, don't want to forget strength training, which is recommended to be done twice a week of all major muscle groups, some kind of resistance exercises, in addition to aerobic exercise. So aerobic exercise recommendations include that we do 150 minutes a week. So it's about 30 minutes, 5 days a week of moderate intensity exercise. That's like a brisk walk, a moderately paced bike ride, swimming, dancing. A lot of those would count. And then finally, I think an important tip is to pair your exercise with something fun. So go for a walk with a friend, save a fun TV show that you only watch when you're doing your stationary bike or your resistance training exercises. Find someone to go with you to the gym to do strength training exercises together, for example, or have a podcast or an audiobook that you like and you listen to only when you exercise.
Christian tells us that he's feeling overwhelmed and stressed about his MS. He wants to know if there are any coping strategies or techniques that are best suited to managing that MS-related stress.
Gosh, stress management, I think, is the hardest one of the lifestyle medicine components or tenets for me, and I really get that. MS is a tough condition to deal with, especially if you end up with a lot of symptoms and have other. I mean, just have life itself is stressful, so it's always going to be tough. But especially if you're adding something in like MS with all the uncertainty and other symptoms. So, I think all of the tenets of lifestyle medicine can help with stress, especially managing your sleep and making sure you're getting exercise. So you want to be sure you're doing all of those other things to help support yourself, and that will reduce your stress. Connecting with others too, very important. And, I think getting involved with a support group or reaching out to other people that are dealing with MS can be very helpful and kind of giving you strategies and resources. I've found that journaling is very helpful for stress management. It kind of helps me process what's going on, get it out of my head, and then I can move on. And I tend to write in a journal every night. Meditation, especially mindfulness-based stress reduction meditation, is another tool that I've used to help with stress. There are classes, it's called MBSR, or mindfulness-based stress reduction classes, that you can take. There are some online, they're all over the country, and I found that to be incredibly helpful with stress as well as with my symptoms. And then I think you have to be comfortable saying no. And that's a tough thing for a lot of us. But, my sister taught me the motto, say no to say yes. So that when you say no to something like, I can't go to this particular meeting or watch this webinar that I know might be fun, but I really need to be able to be with my kids tonight. I'm saying yes to being with my kids, even while I'm saying no to that other opportunity. And then finally, I guess, making sure that if you are having a lot of stress, that you feel comfortable reaching out to a counselor to get some extra support. That can be really useful.
Can you talk about why it's important to avoid substances like tobacco and addictive drugs, and to limit other substances like alcohol?
Sure, yes. So, I think most of us know that smoking isn't helpful, but actually is quite harmful, but especially in MS, we know that there's a correlation between smoking and MS progression. So if you smoke, I would say the most important thing you can do for your health is to stop. Get some help, talk to your doctor, call a quit line, but definitely get some help stopping smoking and using tobacco, even if it's in another form like vaping or chewing tobacco, also very harmful. I think other addictive drugs are also, of course, harmful, but especially in MS, you're worried about exacerbating your symptoms as well as potential drug-drug interactions. And then alcohol, alcohol with MS, a moderate amount of alcohol. So a moderate amount is less than or equal to 1 drink a day for women, or no more than 2 drinks a day for men. So it's not a lot. That may be okay in most people with MS, but you have to be careful because it can make your symptoms worse, especially if you have mobility challenges, or for me, I have dizziness, which definitely gets worse with just a few sips of alcohol. And so you want to be careful of your symptoms. I think the other thing to know is that we are learning more about the impact of alcohol, and really even small amounts have been linked with increased risk of cancer and other health problems. So you want to be careful as well for those reasons, and then also because your sleep can be disrupted even with small amounts of alcohol. And we with MS really need to protect our sleep.
Sasha tells us that she's always had trouble sleeping, but it's been especially difficult to feel well rested since she was diagnosed with MS. What can Sasha do to improve her quality of sleep?
Oh, Sasha, I feel for you. I have been there. So, yeah, speaking of sleep, I've struggled a lot with sleep issues and took sleeping medicine for a long time. I also relied on caffeine to get through my day. I know how incredibly frustrating that can be. But I have learned through my own trial and error, as well as working with patients and learning a lot about sleep, some strategies. So a few things. One is a consistent sleep routine is really important. And that means waking up every morning and going to bed every night at about the same time. Even on weekends, you try to keep it consistent 7 days a week as best you can. You want to aim for at least 7 hours of sleep a night, usually 7 to 8 hours, but more sometimes if you've got MS and you have a lot of fatigue. Making sure that you're being careful about substance use. So we've talked a little bit about alcohol. Alcohol, certainly even small amounts right before bed, can interrupt the quality, can reduce the quality of your sleep. You have a harder time falling into a state of deep sleep with alcohol. And caffeine is a major problem for sleep. So it really depends on the person, but a lot of us, like me, are really sensitive to caffeine, and it can stay in your body for up to 8 hours. And so if you're drinking a glass of iced tea in the afternoon, which a lot of us in Texas, where I am, tend to do, it can impact your sleep later if you're going to bed within 8 hours. So you want to be really careful about caffeine use if that's a trigger for you. You also want to make sure your sleep environment is conducive to sleep. So that means having a dark, quiet bed to sleep in, and you're not doing other activities in your bed like watching TV or eating. Use your bed for sleep. Meditation, again, I mentioned that, is very, very helpful for some people. There are some great meditation apps. I love Insight Timer. There's one called Calm, Headspace. There are lots of them out there. And then, of course, if you're really struggling with sleep, cognitive behavioral therapy for insomnia is a very well-known, well-established, evidence-based treatment without having to rely on medications that can help you improve your sleep.
Speaking of not relying on medications, this isn't something you can pick up at the pharmacy, but social connection is an important component of overall wellness. Can you explain the benefits of social connection?
Yes, social connection is really, really important for from a health standpoint, which I think is important to keep in mind, because a lot of us doctors don't talk to our patients about connection, and yet we are now learning that social connection reduces the risk of early death, of depression, other mood disorders, even some forms of cancer or cancer deaths have been linked with the amount of connection that people have. So maintaining that social connection is critically important, and yet it can be tricky if you've got MS. So you want to make sure that you prioritize relationships. Don't become too reclusive. Do reach out to others in the MS community if you're seeking connection, and find ways to build your support circle.
We heard from Tatiana, who tells us she's feeling increasingly isolated and less motivated to socialize since she was diagnosed with MS.
Yeah.
What strategies can help Tatiana build those connections, engage with others, despite this decreased drive to socialize?
Right. Yes. I was just talking about, don't be too reclusive, and it can be really hard. I think a lot of us also got to be kind of more introverted and more reclusive during COVID, and certainly that didn't help. So I don't think we fully recovered. I think it's important though from a well-being standpoint, and just keeping in mind that there are health benefits to being a little bit more social. That doesn't mean you have to go out to a party or in big groups, but it does mean reaching out to important people in your life. So if you're feeling like you've kind of have reduced your connection with others, I think it's important to reach out to an old friend or family member to reconnect. I think a lot of people will welcome that. And just say, hey, I've missed you. Let's connect. Let's get on the phone. Let's get on a Zoom call. Let's get together in person, which is best of all if possible. Taking a class like at a community college or a school or an art classes. We have a lot of those great ones in Austin where I live. Can be a really fun way to meet people. Volunteering is a great way to meet people. So you can go to volunteer to library and animal shelter. I was thinking even the National MS Society is a great place to volunteer. And then make a goal. So I had a patient recently who really was struggling with this particular issue, and we made it a goal for her to reach out to a close friend and plan something every week. Her husband doesn't work nearby, so she is making a point to go visit him on, at least one weekend a month because they're often isolated, even for weeks at a time. So it's unusual for me as a doctor to be talking to patients about connection, but I've learned that it's so critical that I now make it a regular part of my counseling.
Well, since we're talking about the importance of social connections, are there any support groups or resources you recommend for connecting with other people living with MS?
Absolutely. So the National MS Society has some great resources on their website. There are support groups in many areas all over the country. There are also virtual support groups available. And so, I think that's a really good place to start. If you find one that's not kind of your group, that you don't feel like you fit in with them, don't hesitate to look for another one. So they're all going to have a little bit different flavor, but I think it can be really, really useful to connect with others who are experiencing this, the life with MS.
How should someone go about initiating a conversation with their doctor about incorporating lifestyle changes into their MS management plan?
Well, I think most doctors will be really excited to have patients that come to them and are, excited about initiating lifestyle medicine changes. But a lot of us doctors aren't adequately trained, particularly in things like nutrition. And some doctors may not be comfortable with a whole food plant-based diet. So you may actually learn more and have to educate your own doctor. But I do think that most doctors are going to be receptive to that. I think you want to make sure that your doctor is your partner, because you may need referrals like to physical therapy, or if you're struggling with insomnia or depression, cognitive behavioral therapy might require a referral from your doctor. So, make sure your doctor is on board. I think it's important to tell them about some of the changes you're making. For example, if you're changing to a predominantly whole food plant-based diet, you may need B12 supplements. So it's important for your doctor to be aware of that. And to be able to counsel you about making those kinds of changes. If you have a doctor who's really resistant, it may be time to find another doctor. So I do, think that this is a good way to determine if your partnership with your doctor is a good one, if they're receptive to what you're proposing.
What does recent research tell us about the advantages of embracing an overall healthy lifestyle?
Well, there's a lot of research going on, and I think just to point out a few kind of highlights from my recent reading. One is that more research, a positive lifestyle can reduce the incidence of the most common causes of death and disease in this country. The number one killer in the U.S. is coronary heart disease. And if everyone adopted positive lifestyle changes, we could reduce coronary heart disease by over 80%. We also are seeing rising rates of diabetes, which is of course linked to a lot of death as well as a lot of disability. And lifestyle changes can reduce type 2 diabetes by over 90%. So those are some pretty strong statistics from my standpoint. But I think even if we adopt just one positive behavior, we could reduce the risk of coronary heart disease by half. So these are really powerful tools, actually much more powerful than many of the medicines we have. And when they're used in conjunction with medicines, in many cases, they can be particularly helpful. And then I think also keeping in mind, more recent studies show that plant predominant diets it can improve reduce the risk of dementia. And I know that many of us with MS are worried about cognitive functioning. So getting in, making sure you're adopting a healthy diet is really, really helpful in preserving that cognitive function long term.
Well, you've shared some important information about the benefits of making these lifestyle changes that are really going to improve someone's quality of life. Let me ask you, what would you say are the top 3 takeaways that you'd like our viewers to remember?
Top 3. Okay, so I think the first one is to take stock of your life with the 6 pillars. What are you doing well? What can you improve on? And then the second takeaway would be set a goal or multiple goals, and you want to write it down. Be really specific, make sure it's actionable, have a start date for your goal and an end, a date that by which you want to accomplish it. And then tell someone about your goal. So you've got someone to kind of keep you accountable for meeting it. And then I think the third one is don't be afraid to ask for help. I think a lot of us are fearful of being vulnerable and of telling others that we do need some guidance and support, but it's really important to do that. And I think most people, especially good friends, close family, are wanting to help and are going to be receptive to that too. So reach out to family and friends, get your help from your doctor and your medical team, reach out to physical therapy or behavioral health therapists, other support people if you need it.
Well, I want to thank everyone who submitted some great questions today. And thank you, Dr. Doggett, for being with us.
Thank you so much.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcast. I'd like to thank Dr. Doggett for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. Now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Lisa Doggett and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years. So I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, and Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. No one is immune from experiencing stress and anxiety, and living with MS can sometimes increase these feelings. While stress and anxiety have some shared symptoms, they're not quite the same thing. And understanding the difference between the two can help you identify what you're experiencing and then better manage those symptoms. Joining us today to talk about the impact that stress and anxiety have on your physical and mental health, along with strategies you can use to help you manage the stress and anxiety in your life, is Dr. Bree Wanamaker. Dr. Wanamaker lives with MS, and she's a licensed professional counselor and chief therapist and consultant in her practice, Just Us Counseling and Consulting, LLC, South Carolina. Welcome, Dr. Wanamaker. Thanks for being with us today.
Hi, John. Thank you for having me. I'm super excited to be here.
We all experience feelings of stress and anxiety at some point, and that isn't necessarily a bad thing. But unmanaged stress and anxiety can interfere with your daily life and take a toll on your mental and your physical health. To start us off, can you explain the difference between stress and anxiety, and then tell us how someone can tell them apart?
So when you're thinking about stress is defined as any type of changes that can cause physical, emotional, or some type of psychological strain. It's our body's response to pretty much anything that's going to require attention or action or for us to do something, right? But the thing about with stress is we all are going to respond very differently to all of the things that we have to do in life. And so stress has a lot to do with our reactions of what happens around us and our perception of the situation. So for instance, I'm standing in the line at the grocery store, but I know I'm running late for work or I'm running late to pick someone up. That situation is going to be stressful for me because of the perception that this is going to make me late. This person in front of me is now counting pennies. And so it's my perception of what's happening around me, and it's the external types of spaces. When we think about anxiety is more so our internal. It's the things that it's our internal reaction. Sometimes it can start with a small thought, and then it kind of builds from there. I like to describe anxiety as that space between the known and the unknown, right? So it is our mind. Something great happens, we laugh, we celebrate, we smile. Something bad happens, we cry, we have all of the feelings associated with a negative experience that may happen. Anxiety is that space of in between. It's like our brain ping-ponging back and forth, trying to find a resolution so that I know what I need to do next. And so that space of the unknown is where anxiety kind of starts, and it keeps building from there, because what we end up doing is we play all of these random scenarios over and over, and usually they end up being the worst case scenarios, right? It's never like, oh, this is going to work out. Because if that was the case, we'd be level again. But what ends up happening is we keep all the things that can go wrong, and it keeps kind of building from there, and that creates that space of anxiety. So when you're looking at the biggest difference between the two, it's the external things versus our internal type of reaction and how we kind of feed those things. Stress is usually kind of in the moment, kind of levels you out right after the stressor is gone. Oh, I'm going to be on time. Or I picked up this person 5 minutes late. It's over. Anxiety, though, keeps coming back, can keep coming back. And oftentimes it's also hard to pinpoint what the source of anxiety is. With stress, you know what's kind of stressing you. So it's easier to pinpoint, like, this person in front of me at the grocery store is stressing me out, or the traffic is. So I can kind of figure out exactly what that is. Anxiety is very different, and it's hard to kind of put a needle on what's really bothering you.
Well, I think you just started to answer my very next question. I was going to ask you, what are some of the common causes of stress and anxiety? We have that person at the grocery store counting as one common cause.
So definitely the grocery store. But when we think about anxiety again is that uncertainty space, and it can be triggered again by almost anything. It's this vague sense of like dread or that something bad is going to happen. But anxiety can also be triggered by caffeine, certain medications, lack of oxygen, consumption of different substances like alcohol or cocaine. Your body can have those same physical types of responses that you would have with anxiety, and it can mimic anxiety in some of those situations. Medical conditions can also cause anxiety. And so we have to be mindful of those things. But when we talk about the causes of stress, it can be work, having a boss that's not supportive, or just an ineffective people leader at work. It can be a major workload. It can be being insecure about your job, whether or not you're going to have one tomorrow, whether or not you're going to have an MS flare, and you start to stress about not hitting a project deadline. It can also be just the day-to-day life, washing dishes, doing the laundry, making my home look presentable for people. So stress can be triggered by both good and bad things. Buying a house, that's good stress, but it's still stressful, right? Finances, relationships, people. People are big stresses, and we can't control other people, but we can control how they impact us. But even parenting, and then also just managing you and your day-to-day kind of the way your body's reacting to the environment that day can also cause additional stressors for you.
What are some of the common misconceptions about stress and anxiety?
I think one of the biggest misconceptions is that it's the same for everybody. Like anxiety looks the same for this person or that person. So when we watch TV, what we see a lot of times, people who are having anxiety or panic attacks, in the moment, they're sweating, they're trembling, they're shaking, they're crouched in a corner somewhere. And that's not what it always looks like. Sometimes it's your stomach. You can't keep anything down, or you're feeling queasy on your stomach. And so I think that's probably the biggest misconception, is that it looks the same for everybody. Or if you're stressed out, your blood pressure's high, you can't sleep. That's not always the case when it comes to stress either. I think one of the other misconceptions, if I don't have any symptoms, nothing's happening different in my body, then I'm not stressed. That's a lie. You may not feel it just yet, but it doesn't mean that you're not stressed. And it doesn't mean that it has to show up physically for you either. It can show up emotionally or cognitively when it comes to your thinking. And I think the other, like if you're happy all the time, then you're never going to be stressed. Like everything is not rainbows and unicorns. And if you take that approach, like everything is always sunshine, then you're never going to be stressed or have anxiety. That's also not the truth. Stress is just a common part of life. It is it's a day-to-day thing. It's how we manage it and how we perceive it, which is really what's going to make that difference.
Well, I heard you mention stomach issues related to anxiety, maybe difficulty falling asleep. How can stress and anxiety impact someone's physical as well as their mental health?
So when we think about anxiety usually is kind of, it's going to trigger that fight or flight type of thing. If you are in a moment of feeling anxious about something, your stress hormones are going to be triggering that adrenaline and all of those things. And so initially it can help in that immediate kind of situation. But when you're in a constant state of anxiety over a long period of time, those hormones and those types of stressors can start to impact your immune system. It can break that down. It can And if it's a chronic type of thing, your body never kind of levels out again when it's constantly in that fight or flight type of motion. You're looking for the next danger, looking for the next threat. And so when you have that amount of prolonged stress, again, it impacts your immune system. But when we talk about like chronic stress, it can put you at a greater risk for, mental health. And exacerbated mental health conditions, including anxiety. So there it is. Like, but sometimes it's like, which comes first, the chicken or the egg, right? But also digestive issues, headaches, muscle tension, and stress. You know, some of us hold our stress in our neck. You know, we're at work and we look and we're crouched up like this and can't figure out why. We're stressed and it's starting. Our muscles are tightening. Pain, heart disease, and high blood pressure, of course, you know, some of those common ones, but also weight gain, and having problems with your memory and being able to like recall facts, or just, I can't focus, I can't concentrate. So it's so many different things and different ways that stress and anxiety can impact us. And so, I mean, it's kind of like MS, right? We think about what MS impacts. They tell us it can impact everything. It impacts our brain and our spine, which controls every function we have, right? And so we think about stress and anxiety, your mood, your appetite, your sleeping, your physical, your emotional, like it kind of runs hand in hand with a lot of those things.
Let's turn our attention to some common daily stressors and effective coping mechanisms. Can you talk about some of the common emotional, mental, and physical stressors that are experienced by people who are living with MS?
I think one of the biggest common stressors is that of just the uncertainty about the future, right? You know, when it comes to dealing with MS and not knowing, because we can't see what our brain and our spine is doing. We can't see when a new lesion is forming, but, you know, we might feel a new symptom, or I might wake up feeling this way one day and it's like, what is this? Is this MS, or did I just not sleep well enough? And so a lot of times some of the biggest stressors is just that uncertainty about what tomorrow holds, or the doctor's appointments, right? When we're preparing for the MRI scans, we're preparing, you know, for our next treatment, we're switching medications. You know, while for some people it is so simple to go from a brand name to a generic. For me, I was like, I'm sorry, they're telling me I have to go generic. I've always had the brand name. And it was this whole type of conversation and dialogue back and forth between me and my neurologist. That was stressing for me. But they were like, it's the same chemicals, Sabrina. I need you to understand
my issue
that. I need you to
with
breathe.
people
and I'm like, but what if it doesn't work the same?
So,
and so something as simple for people going to a Walmart brand of Tylenol to actual Tylenol, where that's not a stressor.
So I had a manager
individuals dealing with
call
MS,
me.
those small changes can become a major stressor in the moment. Dealing with just day-to-day life as housekeeping, those can be stressors, and wanting your house to look a certain way but not having the physical energy to get it to that space. People, again, we all have somebody in our life that we know when we get off that call, it is emotionally draining. Being able to just say, I'm not answering the call today, right? But some of those just day-to-day common things, work, trying to manage and balance it all, and it's not uncommon to feel overwhelmed, because the one thing we have to understand is our body functions differently than those who may not be living with MS. And fatigue is very real. It is invisible, but it is very, very real. Brain fog is very real. And so when you're having these small little things in the day-to-day life, like washing the dishes, when you're fatigued, it feels like a monumental task. And so being able to figure out and just identify what your stresses look like, because my stresses are not your stresses. Folding laundry is a stressor for me. Ironing clothes is a stressor. We're gonna put it in the dryer, let the dryer do its work. That's how I operate in that space. But it's really figuring out, you know, those common things can be people, can be work, it can be housekeeping, it can be chores, it can be just even waking up feeling a little differently than you felt yesterday. Those are a lot of those common small stressors for people specifically with MS.
Well, I think we heard you earlier when you said that you may not feel it, but you are still stressed on occasion. So Vanessa got in touch with us and she's asking, how does someone know when they're stressed?
So some of the ways that you, first you want to know your body, know your moods, right? That's going to be the first thing. Like, in order to know that you're stressed, you got to know where your baseline starts. But you can look for different signs like difficulty concentrating, or you're worrying more, or you're starting to feel anxious in spaces that you didn't feel anxious before, or you can't remember. Now, we all have walked into a room and got in there and couldn't figure out, like, why did I come in here? What was I doing? I came in here for, I'll make up little random songs sometimes, right? Going to the grocery store, I have a list and I'll make up a little song to remember the list. But we all have those moments, but are they starting to become more often where you are having trouble remembering? Are you becoming irritated and moody and frustrated constantly? Is your blood pressure going up? Are you starting to see changes in weight, whether it is one end of the spectrum or the other? Because some people gain weight because they're eating, or the stress hormone can cause you to gain weight, and some people lose weight. So are there changes in your weight? Are you constantly having colds or different types of infections? Changes in your sex drive, changes in your menstrual cycle if you're a woman. And so you look at those different types of things, but also, are you not taking care of yourself? Your hygiene can start to reflect when you're feeling some stresses, but poor self-care. So just not taking care of yourself in general, but starting to rely on drugs and alcohol to make yourself feel good, or to kind of level yourself out, or taking an extra dose of your medication to level yourself out. And, those types of things can be some indicators for you to know when you are stressed.
We heard from Carter, who says he can't turn his mind off at night. Do you have any suggestions for Carter?
So, racing thoughts, as we call it, or, just the constant feels like I just can't settle at night. Is pretty common. One of the things that I have found helpful, and, that I talk to clients about and just different people about in general, is writing things down. I heard someone say our brain was made to create ideas, not to hold them. And so even if it's an idea of a to-do item that I have to do tomorrow, write it down. So I keep notepads beside my bed. I have several. Now, the problem is I'm learning is, like, I have a lot of notepads with things written. So I'm trying to, like, compile all my notepads, but it gets it out of your head and onto paper. So keeping a journal by your bed to just jot some things down to kind of help get it out of your head. Mindless TV. Mindless TV for me became looking at, like, House Hunters or cooking shows, a different world, because I'd already seen, like, all of the seasons, all of the episodes. And so it was something that actually helped to calm me down in moments when I was feeling anxious, especially during COVID. But it was things I could fall asleep to as well. Essential oils. I am big on essential oils now. Lavender is really good for, like, sleeping. They also have, like, a lavender sleep spray you can put on your pillow that has, like, lavender and melatonin. Some people take melatonin. I'm not if I don't have to take anything, I don't want to take anything. So I'll spray my environment, but also look at your sleep environment. Are you sleeping on the couch? Are you going to bed? Is there light? Can you turn the lights off? But also, I listen to some meditation music at night, or the Abide app for me specifically, listening to different sounds and, different Bible stories. That's just kind of how I've learned how to kind of turn my mind off at night, or some of those ways. And also look at the temperature in your space and control as much of that as you can. Are you too hot or too cold? Because those types of things can impact your sleep and being able to kind of put your body in a restful state too, when it comes to even relaxing your mind in that space too.
Michelle wants to know about effective coping mechanisms or lifestyle modifications that she can use at home that can help her manage her stress and anxiety.
First and foremost, control what you can control. I use a 4 kind of block grid, and, like, these things are important. I can't control. Unimportant, I can control it. unimportant, I have no control, and important, I still have no control. And so learning those things that you can control also help us to manage our stress and anxiety. Because if you think, if you really look at the things that we stress about and that we're anxious about, a lot of those things are outside of our control. Someone else's health condition, we have no control over that. Someone else's situation in general, a lot of times we stress about other people. We have no control over those things. And so really looking at, can I or can't I control this? And so being able to identify that, identifying what stresses you. Is it your environment? Is it the pile of clothes on the floor? If it's the pile of clothes on the floor, can you fold 3 pieces at once? Can the other people in the house do their laundry themselves or fold their own clothes versus you having to take on all of the things? Create a list of items to do so that you can see what it looks like, but also mark it off when you do it. That little small victory feeds like that positive reinforcement for you as well. And so, you know, those are small things that you're able to do, but ask for help. I think that's the biggest thing is that, you know, we hear MS warrior, you're a warrior. Warriors have to fight, right? But the thing that we forget is warriors don't fight alone. There are often other warriors beside them or other people who are supporting, sending supplies. They're doing something in the background to help this warrior along the way. And so being able to simply ask for help if it's available. It could be, can you take out the trash? Can you do this for me? I just need someone to talk to. That's also asking for help. And so these are small things that you can do at home that will be able to impact, but also create some structure. Like have a day. I might load I have a timer cube that I use because I will ping pong from task to task in my house and I never get things done. So I flip my timer cube to 15 minutes and we're going to stay right here in this kitchen for 15 minutes just to finish cleaning the kitchen, to load the dishwasher, to do those things. And if my 15 runs out, I can flip it for another 15. But it has made me to focus in that one area. And then, but it helps me to create structure. And so you find these little small tricks that help you in your day-to-day at home life that turn into larger gains over time.
Chris is wondering how someone will know if they need to see a mental health professional for their.
She's loved, she might be dead. Love lingered last in line for brains.
To look at is how much is this impacting your day-to-day ability to function and your overall life, right? Are you able to complete tasks at work? Are you able to take care of yourself, your daily living? So showering, bathing. Sometimes when you're stressing and when you are anxious, it starts to impact your overall ability to just function in day-to-day life and take care of the bare basics. And so that's one of the things and one of the ways. But if you start, of course, feeling some things physically, or multiple people are telling you there's a shift in your mood and you're a lot more snippy, then it's probably time to get some help. So the way that a professional can actually help is, number one, they're objective. So they have no, I don't want to say they have no skin in the game, but they are there to provide for you a safe space and to be completely objective, but to also help you find those solutions where you're able to help manage and help to create a better life and a better environment for yourself. But they have different tools and different skill sets to help you engage and to, again, provide that kind of just clear-headed perspective that helps you to gain more perspective. So what we find in the therapy space is that our clients already have solutions. It's just there's so much noise around them that it's hard to kind of dig through. And so we help you to find the solutions that work for you. We don't necessarily give advice. If your therapist is always telling you exactly what to do, you want to get another therapist. Because our goal is to help you to self-manage. We want you to gain the tools, go out, try life, and if you need me, come back. But our goal is to help you to be able to do these things on your own and to be able to function. And so that's some of the things that we can actually provide in that space, is to help empower you to get to the spaces that you're wanting to be.
Stress and anxiety are emotional responses that are part, of someone's overall mental health. And we recognize that mental health is a major component of wellness. So, what are some potential long term consequences of ignoring mental health concerns?
So the same as the same way physical health, if you ignore something physically, it gets worse over time. And so early detection and early intervention is extremely helpful. The same thing goes for your mental health, right? And so being able, the earlier you can get help also helps for you to have, first off, better outcomes. The longer you wait, the more it can impact your relationships with family and friends and significant others, because communication can start to become an issue. It can start to impact your work by ignoring it, because now you're not able to focus on tasks. Performance management may start to come into play, or depending on the type of mental health concerns that you're dealing with or symptoms that you're dealing with, not showing up to work. It can lead to termination, but it can also lead to financial difficulties, which again cause more stress. So as we're ignoring those things and not paying attention to it, it can exacerbate or make things worse in other areas of our life. But it can also lead to, again, substance abuse, because you're trying to find a way to make yourself feel better, and unintentionally end up with a substance misuse disorder. But it also impacts your physical health. So again, staying in that fight or flight mode, staying in those areas where the stress hormones are kind of on 10 always, can start to cause fatigue, insomnia, and again, put you at higher risk for some of those things that we kind of talked about earlier, dealing with like heart disease and blood pressure.
Roxanne is a care partner for her husband, George, and she tells us that she thinks George is depressed, which is not uncommon for people who are living with MS. And Roxanne is wondering, how can she encourage George to talk more freely about his feelings and perhaps get help from a therapist?
Sometimes it is that space and feeling like it's okay to not be okay. And so it could be, honestly, sometimes just asking, like, how are you doing? Like, for real talk, no sugarcoating. I know you're going to say okay, but it seems like something's different. Are you really okay? And letting them know that it's okay to, even as your husband, to have a weak moment, even as somebody who's seen as so strong, because we're told you got to be strong all the time, right? So even being able to just have that safe space, you're sharing a little bit about your concern about him, and that you've noticed some changes, and giving concrete examples, not things have changed, but in what way. So it could be as simple as, we were watching your favorite episode of Big Bang Theory, and normally you are laughing in tears and you barely cracked a smile, or you are normally smiling or whatever, humming when you're eating your chocolate ice cream, and I noticed that it barely brought you any joy, or you barely touched it. Those are concrete examples of the changes, so that they can understand what it is that you're seeing. And then also suggesting that you talk to someone together, and you can make it about you. I want to make sure that I'm doing the best that I can to support you, and that I'm showing up for you in the ways that you need. And so I would like for us to talk to someone together. And then that can be a way to encourage him, but to also getting help from a therapist, but where you're going together. So there is that support if he is resistant to going on his own.
Well, you shared some great information today, Dr. Wanamaker. What would you say are the top 3 takeaways that you'd like our viewers to remember?
I think the top 3 takeaways is know your body. Know your body, know who you are, know your moods, that kind of thing. Know your MS symptoms, so that you can realize when something is shifting and changing within yourself. Get a self-care plan together. A lot of times we wait to do self-care when we feel like we are at our wits' end and there's nothing else we can do. That's actually respite. That's not self-care. That's recovery, right? And so getting a self-care plan in place and implementing regularly. It could be as simple as, again, watching mindless TV, eating your favorite snack, not indulging too much, but and find at least 2 people that can be those safe spaces for you to really talk about how you feel, but that are also willing to talk to you about the changes that they may have seen, because we know that MS can affect our mood and our cognitive ability. And so how does our mind tell our mind that our mind is wrong, right? And so having those outside people that are able to say, I've seen those changes in you. And so having those support people and really doing that. And so identifying at least 2 if you can.
Well, I want to thank everyone who submitted some excellent questions, and thank you, Dr. Wanamaker, for being with us today.
Thank you so much for having me. I really enjoyed it today.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll hear about ways to get involved, and you'll learn about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Twitter, Instagram, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Wanamaker for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Bree Wanamaker and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect, and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, connecting you to resources and answering those questions. Vitamin D is often referred to as the sunshine vitamin. And for years, scientists have worked to understand the link between MS and vitamin D and what that might mean for people living with MS. Dr. Ellen Mowry is joining us today to discuss the important role that sunlight and vitamin D may play in MS. Dr. Mowry is a professor of neurology and epidemiology, and she's the co-director of the Multiple Sclerosis Precision Medicine Center of Excellence at Johns Hopkins University. Dr. Mowry holds relationships with commercial interests with Biogen, Genentech, and B CareLink LLC, and she receives royalty for editorial duties with UpToDate. I'll add that Dr. Mowry has conducted extensive research in better understanding the role of vitamin D in MS. Welcome, Dr. Mowry, and thanks for being with us today.
Thank you so much for having me, John.
Well, let's start with the basics. What is vitamin D, and what is its role in the body?
Yeah, that's a great question. Vitamin D is actually a hormone. It's actually in the steroid family of hormones, and it has a wide variety of roles. It's most commonly known for its importance in maintaining calcium levels in the body, and therefore for its importance in bone health, both in the development of our bones as we're growing up, as well as maintaining the health of the bones once we've reached adulthood. But over the years, it's been recognized as having importance for innumerable factors in the body, and perhaps as it's most related potentially to MS is that vitamin D levels seem to impact the immune system and its functioning as well.
Heard from Terrence, who told us he'd like to learn about vitamin D from sun exposure rather than dietary vitamin D. What's the difference there? What can you tell us about that?
Yeah, that's a super great question. A lot of people wonder what foods they can eat to get their vitamin D levels up. And the truth is that most foods don't have very much vitamin D in them naturally. So foods that have natural sources of vitamin D of any significance are things like cod liver oil and some fatty fishes. There are some mushrooms that contain vitamin D naturally, but from there, the levels in other types of foods drop off rather dramatically unless they're fortified. Certain foods definitely are fortified within the United States, most notably milk products, but even the amount that is provided per cup of milk is relatively low, recommended to the recommended daily allowance of vitamin D. And so that does have people looking towards, either sun exposure or to vitamin D supplements to achieve vitamin D sufficiency, meaning a level that's high enough to, in this case, keep your bones healthy.
Well, I have a two-part question for you. First, can a person get enough vitamin D just from being out in the sunlight? And might other factors like a person's skin tone or their sunscreen use impact their ability to increase their vitamin D level from sun exposure?
Very complicated question. Yes, you theoretically can get enough vitamin D from the sun depending on where you live. And so, for example, in places that are farther from the equator, during winter months, you might not actually be able to get enough sun exposure to keep your vitamin D levels up, whereas in the summertime, that's not the case. And, the other thing to keep in mind is, there are other factors that can play a role beyond season and location. So studies have been mixed in terms of the impact of sunscreen. What I would say is, from my take on the literature, is that sunscreen, when applied correctly, and to the entire body, will definitely reduce your, vitamin D levels. However, most people don't actually put on enough or put it on their whole body or reapply. And so oftentimes, people are getting sun exposure even with sunscreen on, are still absorbing some ultraviolet B. That's the kind of UV light that helps produce vitamin D light and can get some vitamin D production in the skin, which is how sun happens to impact and increase vitamin D levels. We do know that pigmentation helps to protect the skin against UV damage, and therefore, for given the same amount of sun exposure, people with more pigment may end up making less vitamin D from the sun. And of course, the controversy is, should we be jumping out into the sun to get our vitamin D or not? And as we know, not adequately putting sunscreen on to protect our skin can increase the risk of skin cancers. And so if you talk to dermatologists, they'll say, get your vitamin D through supplements rather than by going out into the sun.
Well, speaking of those supplements, Dana tells us that she has a family history of MS, so she's taking a vitamin D supplement hoping that it will help prevent MS. Is there a connection between vitamin D and a person's risk of developing multiple sclerosis?
Yeah, the literature has been updated in the past several years to provide a little bit more context about the role of vitamin D as a risk factor for MS. So the interest in studying vitamin D as an MS risk factor came about by what we call ecological studies, which is sort of looking at very high level trends. And these high level trends noticed that people who lived farther from the equator were more likely to develop MS or to have MS. And so the hypothesis was that something related to living far from the equator must be playing a role. And because of the known lower sunlight exposure to people living in those environments, could it be that something related to low sunlight, such as vitamin D, is an MS risk factor? And so the best, early studies that looked at these data looked at vitamin D levels in people before they developed MS and compared them to vitamin D levels in people who never developed MS, who were age matched. And they actually did this first with a military cohort, and they showed that, lower vitamin D levels were associated with higher subsequent risk of having MS. And so that was, one of the strongest proofs that was used to move forward. And that study, which was done by Alberto Esquerio's group, was confirmed subsequently in a different country. And so that looked pretty promising. There are a couple holes, though, that developed in the study and in this data analysis. One came out of the Kaiser cohort when Dr. Annetta Langer-Gould looked at vitamin D levels in relation to MS risk as well. And she actually had a more representative cohort of people where there were individuals who identified as white, Black, or African American, as well as Hispanic or Latinx. And in that study, lower vitamin D levels did seem to be linked with MS risk in people identified as white, but not in the other groups, whereas sun exposure was differentially related to MS risk. So it starts to make you wonder, is it, is in that construct, is it vitamin D? Or is it something else about sun exposure, where we know UV light does have other, properties that influence the immune system? I think that's something interesting. The other thing that I think that comes out in that context is the increasing information about what's called the MS prodrome. So the MS prodrome is this idea that people with MS, long before they have, say, their first attack of multiple sclerosis, start to feel unwell. And studies in countries like Canada, where they can document healthcare utilization, demonstrate that for several years prior to having, say, an optic neuritis attack or an attack in the spinal cord where people are numb or weak in a limb or several limbs, they start to have an uptick in their use of healthcare resources for symptoms we would consider not specific for MS, maybe some depression or other types of things, but nonetheless, relative to their peers, have increased. So if we think about that MS prodrome, and we know as neurologists that many people at the time they have their first attack have, several other MS spots in their brain and spinal cord, indicative of something that's been going on for a while. Might it be that the MS has been going on for a while? The prodrome is just, symptoms that are not specific enough to rise to that level. Okay, so if you buy that, then also we have this notion that a lot of people with MS don't feel super well when they're in the sun. They get overheated and they feel worse. They just feel drained, they have more fatigue, and so they start avoiding the sun. And so might some of the conflicting results in the relationship of vitamin D levels with MS risk be related somehow to this prodrome? Maybe the people with MS who are especially affected already and they don't even know it, already begin their sun lowering exposure. Their levels appear low. They haven't had their first attack of MS, so that period is still in the prodrome. It looks like low levels in that prodrome are linked with increased MS risk, but perhaps it's their MS that's causing them to avoid sun and have lower levels. I think the jury is still out. Those data haven't been rerun in that way, but I do wonder, considering some of the conflicting results that come out, if that's not the case. If we're not just measuring MS that's begun rather than vitamin D as a risk factor. Arguing against that are genetic studies looking at genetically predicted levels of vitamin D and showing that in that context, low vitamin D holds up as an MS risk factor.
Well, we heard from Gabriella, who is curious about how vitamin D might impact someone who's already been diagnosed with MS. She's wondering whether there's a relationship between vitamin D and MS relapse rate or disease progression, disease course.
Yeah, Gabriella, that was a question of ours as well, and it informed a lot of the early work we did. We were interested, of course, in how vitamin D related to MS risk, but as a neurologist working with people who are already diagnosed with MS, I wanted to know, did it still matter? And so we did a study several years ago looking at vitamin D levels in children with MS. And we measured those levels when they first came to the pediatric MS clinic and asked the question as to whether those low levels were linked to an increased risk of MS relapse in the follow-up period. And yes, the people who had lower levels of vitamin D were at increased risk of developing MS relapse. Data that were recapitulated in adult studies after that. And then we actually did a follow-on study looking at, in an adult cohort that was fairly large, at low vitamin D levels and or vitamin D levels in general, to see did that relate also to the risk of new MS spots or lesions developing on brain MRI. And yes, that also appeared to be a significant association over time. What we did not see was that vitamin D levels linked to degeneration of the brain or shrinkage of the brain or death of brain cells on MRI scan, which we know is linked with long-term MS-related disability. So naturally, the next thing we did was to say, okay, well, this is an association study, meaning you're linking one variable to another in a data set, but that's not a causation study. And so to seek the best clarification about whether changing the vitamin D level of people makes a difference in terms of those same outcomes, right? We did a clinical trial. So this was sponsored by the National Multiple Sclerosis Study. We took 172 people with multiple sclerosis, relapsing MS, and we randomized by a flip of a coin to receive a vitamin D supplement at the level of 5,000 international units a day versus the recommended daily allowance of vitamin D, and then evaluated over the course of a couple of years of follow-up, did the vitamin D make a difference? And the surprising answer is it did not. It did not make a difference. It did not appear to influence relapse rate or the development of new lesions or any of the other metrics that we measured. And there were a couple of studies in Europe that did a similar study, different doses and different background MS medications than we used, but also didn't see an influence, a meaningful influence of vitamin D on the MS disease course. So to me, the best evidence, the best kind of evidence we can generate, we really aren't seeing that the vitamin D supplements are making a huge impact on the outcomes that we know to study in folks with MS.
Well, Nate has a question, and I think I heard you already start to answer it, actually. Nate's wondering about that recommended level of vitamin D. He's wondering whether there's a difference between the level of vitamin D recommended for someone living with MS or at risk of developing MS compared to the general population.
Yeah, so I think before we had these randomized clinical trial data, we would say yes, based on the observational data that we knew about. We often would target having people have their vitamin D levels above the sort of, the cutoff for insufficiency. So if we think of cutoffs for insufficiency or deficiency, where insufficiency is less than 30 nanograms per ml or milliliter, we were aiming for levels of 40 and above. And so that was based on the observational data, the linkage data we had from looking at the studies correlating levels with relapses in people with MS or levels with risk of MS. I have to say now that these data are out, I'm not so sure that vitamin D supplementation is unique to people with MS. What I would say is that for folks with MS who are having challenges with their mobility, where their bone health may be at increased risk by not being mobile they may still have, different targets or may need to be monitored differently than folks who are having fewer mobility challenges. But I don't talk to people anymore about, maybe this vitamin D will increase reduce your risk of relapse or new lesions, because I don't think the data in a very high quality design of study really suggests that that's the case. And, people say, well, you must be so disappointed. Of course, you always want your, the things you're trying to work, but actually we really want to get to the ground truth in the end. Because if it's not helpful, we shouldn't be doing that or focusing our energies on that. We should be moving on to studying, okay, well, what's next? What else? And so I think that's good science.
Well, we heard from Luke, who said he doesn't go outdoors much because, as you pointed out a moment ago, he's one of those people whose symptoms can feel worse when he's in the heat, so he avoids the sun as much as possible. And Luke has a couple of questions. He wants to know, what are some signs that someone may be experiencing low levels of vitamin D, and who should be getting their vitamin D levels checked, and how often should those levels be checked?
Great question. Yeah, again, we do see a lot of folks with MS don't love being in the sun because it makes them feel pretty unwell. And so that's often a concern that people have. The symptoms of low vitamin D, I think in general, are pretty vague and not specific, and overlap to some extent with symptoms of MS, like muscle weakness or, tingling, pins and needles in the extremities. Sometimes people develop pain. So it can be really tricky to pin specific symptoms on vitamin D insufficiency or deficiency for sure. And so I think that's important to keep in mind. And, vitamin D levels don't change super rapidly. So if you had vitamin D levels checked, in the last several months of time and you haven't had major changes in your lifestyle behavior or your sun exposure or your vitamin D supplementation or your weight, it's kind of unlikely that it would be markedly different than it was the last time you had it checked. And so I think the frequency of getting your vitamin D level checked really depends on a lot of those factors. So if you had pretty sufficient vitamin D before and you were taking a small supplement and you wanted to maintain, you and your doctor decided that was a good level to maintain, and you're still taking it and your weight is relatively stable, probably not a huge utility to rechecking it very often. On the other hand, if any of those factors had changed, may be important. I definitely recommend to people beyond thinking about their MS, again, nodding back to this bone health and other things, to talk with their primary care doctors as well about vitamin D testing and how often that should occur.
As a clinician scientist, you're involved in both research and clinical practice. So I'm curious, how does what you're learning through your vitamin D research carry through to your patient care?
Great question. The best and most wonderful thing about working with people with MS is that I think a lot of the research questions we have as clinician researchers are developed through working with the individuals affected by MS and hearing what their concerns are and thinking about the unknowns and where the decisions we're trying to make have enough information to guide those decisions, and where actually there aren't enough data available to make an informed decision. And so a lot of the research questions we develop, start in the clinic with the person with MS or several people with MS. They formulate and percolate into a research question in a study. We conduct a study, and then we say, okay, well, how would we do that? So for the vitamin D story, people used to ask me, do I have to supplement with vitamin D and how much and things like that? And I'd say, we don't really know right now. These are the studies we have. The levels seem to correlate with MS severity, but we're waiting on the results of the trial to tell us if supplementation itself actually makes a difference. Now, having completed the vitamin D trial, I say our study does not demonstrate that vitamin D supplementation makes a huge difference. So if I'm going to spend time talking about things that we could do, I might spend a little less time on vitamin D and a little bit more time on something else that might seem promising, like getting enough exercise or sleep or nutrition. And so, yeah, that circle of, talking with people and hearing what's going on, doing the research, and then returning the results and actually moving on from those results to think about the next question is pretty fun and a pretty lucky and privileged place to exist.
We heard from Matteo, who says that he's heard about water-soluble vitamins, fat-soluble vitamins, and toxicity concerns. He feels kind of confused about some of the things he's been reading. Can you help resolve some of Matteo's confusion? And I hope you'll explain the signs of that vitamin D toxicity that he mentions.
Yeah, it's a great question. I think that the internet is full of advice for all of us, right? About what supplements and vitamins we should be taking and how much. And it can be super confusing to work our way through all of that noise. So fat-soluble vitamins are vitamins that when you ingest them, they get taken up and stored in your fat for a while. And water-soluble vitamins tend to kind of pass through, above the levels at which they're needed. So a lot of people with MS in my clinic anyways take B12, vitamin B12, and that's a water-soluble vitamin. And their levels, if you measure them, are super high, but they don't get vitamin B12 toxicity. Most of it just gets urinated out, right? It's not that it's not doing too much, but it's also not harmful. When vitamins that are fat soluble build up, those levels can actually build up to more toxic concentrations. The concerns about vitamin D toxicity, which I actually haven't seen, luckily, because I think we've been good stewards of not recommending in very, very high doses of vitamin D, really relate to concerns of the vitamin D increasing our body calcium too much. And that can cause a number of symptoms. Bone and abdominal pain, can feel very thirsty or dehydrated, appetite can be affected, people can feel weak, and confusion can also occur. And so all of those things are something to play with or to think about. I think in people taking relatively modest doses of vitamin D that we didn't see, for example, in people taking the 5,000 international units a day, any major concerns for any toxicity related issues. I know there have been some protocols, out on the internet giving very high doses of vitamin D for people with MS, and I would have concerns about those levels being too high. So I think, especially if you're taking very high doses of vitamin D, you probably do want to follow up on those levels more frequently.
We see so many vitamin D supplements on store shelves. There's vitamin D2 and vitamin D3, and these are available from so many different brands. How can someone know which supplement to choose?
Yeah, it's very hard actually, because vitamins and supplements aren't regulated as strictly as prescription medications. So I think it's very difficult. And your doctors also don't really know like which company is, are making more legitimate products than others. So I think it's challenging. D2 is the form of the vitamin that is, in some foods like mushrooms and things like that. D3 is a little bit more closely, I guess, aligned with the way that our skin, starts to process sunlight and convert it into vitamin D. When we prescribe vitamin D, by prescription, some people get a weekly pill, and that's typically D2 at a higher dose. And then over the counter, there can be varied types of vitamin D. I usually recommend people, if they're going to take vitamin D and we think that's a good idea for them, we do vitamin D3. We kind of, work together to figure out what our goal doses are based on where they start and, what their risk factors may be. And then, we can try to do things like look on labels for good manufacturing practices and things like that. But I think it's very challenging because, those are very unregulated, and that problem extends beyond vitamin D to, other vitamins and supplements, like I said, where you don't really know all the things that are in it. So I often, I'm more conservative in recommending supplements and vitamins and try to think carefully about whether taking in those types of things from a pill versus, healthy nutrition, well-rounded diet might be more useful.
So while we're talking, I'm wondering, can you give us a quick preview of what you're currently working on?
Yeah, that'd be great. We have a number of studies that are ongoing. We're really interested in understanding how to optimize treatment strategies for people with newly diagnosed MS. Now that we have more than 20 MS medications approved to reduce relapses and the development of new lesions in the brain, it can be really difficult when people who are newly diagnosed wonder what's the right medication for me. And in the past, before there were so many medications available, we would start with modest efficacy medicines, and if they worked, great, and if they didn't, we'd switch to another one or maybe try a stronger medication. It's been a major trend for people to start using stronger medications in everyone, where we know that those on average may reduce the risk of relapses or new spots more, but there are many people who don't need that strong of a medication to reduce relapses and spots, and of course the stronger medicines may carry increased risk. So we're still in the middle of our Treat MS trial, which is essentially by flip of a coin assigning people to start the stronger medications out of the gate versus starting the more moderate efficacy medicines and very carefully monitoring and switching if they're not doing super well in terms of they having a relapse or a new spot. Those results should read out in late 2026, so we're very excited about that. We're also trying to work really hard and thinking about how do we slow down degeneration of the brain and nervous system. We know that even in people who aren't having new spots and relapses, some people have accelerated degeneration of the brain cells and the nervous system, as well as those in the spinal cord. And it's that accelerated degeneration of neurons in the brain and spinal cord that seems to underlie progressive MS, where instead of having relapses, people are getting slowly worse. And the treatments really don't work super well for people with progressive MS who aren't having ongoing relapses. And so how do we help people with that? We have a new trial we're trying to get started to try some new medications for that. I have a study also where we're trying to better track people's worsening over time, because a major limitation for conducting trials testing new medicines is that we're not measuring worsening clinically very well. And so we have a study using wrist-worn activity monitors that we think will do a better job of tracking people's patterns over time.
Well, I think that the things you're already working on and trying to get started working on are the very things that people in the MS community are anxious to hear more about. So we appreciate those efforts. You've shared some great information about sunlight and vitamin D and MS. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Yeah. So I think there are a lot of existing data about vitamin D and correlating vitamin D levels with poor health outcomes, including an MS risk as well as MS outcomes. Actually, the clinical trials, though, which is sort of the gold standard for testing whether an intervention has an impact, at least to date, across the vitamin D interventional trials, have not shown a massive benefit for people with MS with respect to relapses, new spots, or degeneration on MRI scan. So I think that moving forward, we need to make sure we're doing these kinds of studies to make sure that we take the evidence all the way to that gold standard. And you can still speak with your neurologist or your primary care doctor about vitamin D supplementation, but let's focus also on other lifestyle modifications that might be useful to help ameliorate the symptoms of MS and prevent progression of the disease.
Well, I want to thank everyone who submitted some great questions, and thank you, Dr. Mowry, for being with us today.
Thanks for having me. I really appreciate it, John.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways to get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversations that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Mowry for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us to continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Ellen Mowry and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. MS affects 3 times as many women as men, often affecting women during their childbearing age. And women's MS symptoms may worsen during menstruation, pregnancy, and menopause. Dr. Anna Shah joins us today to discuss how these phases of life may impact women's MS symptoms and how to best manage these changes. Dr. Shah is an assistant professor of neurology and associate clinic director of outpatient neurology at the University of Colorado School of Medicine. Welcome, Dr. Shah. Thanks for being with us today.
Thanks for having me.
So, good place to start. How is MS different in women than it is in men?
That is an excellent question, John, and I will preface it by saying MS, of course, is different from person to person, so I will speak in rather broad generalizations. We know that the ratio, as you pointed out, affects women differently than men in terms of how often they get diagnosed with MS. One of the things that's really interesting is we see this 1-to-1 ratio in terms of diagnoses incidence in men and women before puberty and after menopause. But in that period of time in between when puberty starts through menopause, women get affected at 3 times higher rates. Now, we do see some differences, again, generally, between men and women when we think about how their MS may affect them. We see kind of equal rates of men and women being affected in primary progressive MS. And in general, with males with MS, we tend to see greater disability accumulation, more likely progression into secondary progressive MS after a course of relapsing remitting MS. And then we also tend to see poor recovery from relapses. Now, again, all of this is a broad generalization. The other thing that we see is we know comorbidities such as high blood pressure, diabetes, high cholesterol tend to affect men more often than women with MS. And we know that has a role to play in progression. So that's also another thing that we should keep in mind as we address kind of gender differences between these two groups.
We heard from Jill, who said her MS symptoms temporarily worsen around the time of her menstrual cycle. She's wondering why this happens and if there's anything she can do about it.
Hi, Lump. I
What
don't know
would
if
say
you're
to
even
Jill
still
is
here.
this is
That phone
actually
call
a really
was
common
dumb
phenomena that
because
we see not
people are dumb.
only in MS, but in a
Hi, anybody
variety
who's
of
still
neurologic
hanging out and
conditions. For example, some types of epilepsy or seizure disorders and migraine disorders actually have worsening in those symptoms also around the time of menstruation. And there's some hypotheses out there. So when we think about how menstruation works, there's the menstrual period,
Ooh, I came back to
follicular
the
phase, and
videos
then
at a
the
good
luteal
time.
phase. And there's some thought that some of those hormonal changes could be contributing to worsening of MS symptoms during menstrual cycles. But the other thing too is that we know that during that luteal phase, there also tends to be an increase in body temperature. And we know that with increased body temperature in MS, sometimes it can cause this recrudescence or pseudo flare of MS symptoms where old MS symptoms come back or feel worse. There have been some hypothesized treatments for this. There was a very small trial done years ago looking at the use of aspirin, so something that helps reduce temperature. Could the use of aspirin during this period help reduce those symptoms? And they found, again, in a very small cohort that it did. So that is one possible treatment option. The other option too is to say, could we utilize hormonal therapies like oral contraceptives or things like that to help regulate some of these estrogen and progesterone changes that happen with these different phases of menstruation? And could that help with reduce the frequency of these pseudo flares or recrudescent symptoms?
That's a
One
beautiful
thing to point
rose.
out is that there has not
Hold
been
on,
an
let me see.
associated
I'm gonna show the
worsening
people.
of relapses associated with different menstrual cycles.
I'm gonna show the people a
So
beautiful
that is
rose.
one thing that hopefully is a little bit reassuring.
Some of the most common questions from
I
women
know,
living
that's
with
beautiful.
MS are around
Good job.
family
High five.
planning and pregnancy.
Where's your class?
We heard from Crystal, who's wondering whether MS could
Why
affect
aren't you
her
wearing your
ability to get
Going
pregnant.
slow and steady and
Great
making
question,
meals.
Crystal.
That's a
I
choice.
think there has been
It's
some
sometimes at the
conflicting
time
data in our
trying this.
That's
literature
okay.
about what does fertility look like in multiple sclerosis. There are certain
At the
sources that say there's no impact of MS on fertility, and then others that say there is some
It's like
impact on
it's stepping
fertility.
out.
There was a really nice study published
gonna
just a
make
few
it
years
you
ago
hot
that
by
showed
the
that there
oven.
were higher percentages of infertility diagnosed in
Well, that's
women
okay.
with
Technically, you
MS
can just draw
compared
your
to their
pot, like, right
peers
here.
without MS. And
Because it's gonna be
interestingly,
inside
though,
the
this
pot
was
anyway, right?
stratified by age. This was seen most
So
commonly
you could
in
just draw
those
the pot over
ages
the bottom
between
part of the
18 to
stem.
34 and then 42 years and older. One of the things that is also interesting about some of these studies that we've seen
Well, then don't put a pot
is
on
although
it.
we see higher rates of infertility diagnosed in our patient population, we don't necessarily see higher rates of fertility treatments being used.
Okay.
One of the things that is important to think about, especially when you're trying to conceive,
Okay.
is we often define infertility in the medical field as those that are younger than 35 that have been trying for over 12
Oh,
months,
okay.
and those that are older than 35 as trying for more than 6 months. But in MS, we think about those numbers being a little bit shorter, really to minimize time off treatment and to help patients kind of achieve their family planning goals as best as they can. So really thinking about this time period of trying for about 6 months, maybe 3 months, depending on the age, and then considering talking to your primary neurologist about a referral to a fertility expert.
I heard you mention time off treatment. Many women wonder about the safety of being on a
Did you
disease-modifying
say
therapy
treatment?
during pregnancy.
Time off treatment.
Are any of the MS medications safe to take
I'm gonna use the
while
bathroom real
trying
quick.
to
I'll be right back.
conceive and during pregnancy?
Great question, John. And this, I think, is one of those times where we think about the art of medicine coming into play rather than perhaps stringently sticking to what it might say on some drug information brochures. So the most important thing I will say that is important to take away from this whole talk is making sure you're seeing a neurologist that is familiar and comfortable with family planning in MS and with the use of DMTs and disease-modifying therapies with conception or pregnancy. Now, that being said, there have been a lot of what we know about safety of these medications during conception efforts and during pregnancy tends to be retrospective, which means this person accidentally got pregnant or this person accidentally conceived while on this treatment, and here is the outcome that has come forth. It, of course, would not be ethical to say we've got people that are pregnant, let's give them these medicines and see what happens. So with that being said, one of the best information sources is each drug company is required to sponsor pregnancy registries, and those are accessible to everyone. So those are a really good source of information in addition to your physician. Medications that have been shown to have safety through conception includes our interferons, as well as Copaxone or glutathione acetate. There is new evolving data about the safety of some of these other medications during conception efforts, including CD20 therapies. The most important thing to kind of keep in mind is that most oral medications, just because of how small they are and how quickly they can kind of transfer to a developing fetus, are probably not ones that you want to be on during pregnancy because they can get to the infant.
I think I heard you start to answer this question a couple of moments ago. I wanted to circle back to it. Some women may need fertility treatments to get pregnant. What do we know about the safety and impact of fertility treatments among women with MS?
We know more and more every year, which is great. I think this is really a blossoming field of interest for most neurologists and, of course, most patients with MS. We're starting to see more and more women with MS have children or get pregnant. And this is actually a really stark contrast to the general population where we see pregnancy rates declining. And with that coming alongside and knowing that sometimes our patients have children or get pregnant after their diagnosis. In fact, about 1/3 of all pregnancies in MS are after diagnoses. We know that fertility treatments may be needed. One of the most important things that comes out of fertility treatments is remembering minimizing time off DMT and really assessing when is the right time to undergo the fertility treatments. For most of our patients, and in several recent studies, there has really been an associated benefit of staying on their disease-modifying therapies as long as they're safe and the fertility specialist is okay with it, and really staying on these treatments while you're undergoing fertility treatments. Now, if you do undergo something like in vitro fertilization and there's embryo transfer, you really want to make sure you're talking to both your neurologist and your OB/GYN about when the safe time in relation to medications is to transfer that embryo. But in general, I think there's a way for us to manage both fertility treatments and MS safety together concurrently.
We heard from Lexi, who worries that getting pregnant will make her MS worse and she may become disabled. She's read that women tend to have fewer relapses during pregnancy, but often have a relapse after giving birth. What can you tell us about MS relapses both during and after pregnancy?
Most of the information we have learned about MS during pregnancy and the postpartum period really originated from a trial called the PRIMS trial, or Pregnancy in MS trial. Now, one of the things that's notable with this trial is that it was during a time where most participants that were looking at pregnancies were not on treatment, or they were on what we would consider our platform therapies like beta-seron or Copaxone, so not really in the same era as highly effective immunotherapy. One of the really cool things with pregnancy, and you can excuse the nerdiness there, but one of the cool things with pregnancy is our body goes through a whole bunch of changes in which we call immunotolerance. And from a evolutionary standpoint, it makes sense that mom's immune system becomes less active during pregnancy, so it doesn't affect a developing fetus. And in cases where we think about the immune system being our primary source of trouble, like MS, that is actually a really good thing. So a lot of the B cells become less active. We have less inflammatory T cells. And all of this helps make pregnancy just a more calm period for MS. Now, in contrast, we see most of those immune system changes reverse after delivery. Now, it is hard to say if some of those changes or those increase in relapse rates are quite as dramatic as what we've seen in some of these earlier studies. One, because now we have individuals on highly effective immunotherapy, but also two, because a really small percentage of patients were driving those high numbers of postpartum relapses. All of that being said, I think there is a very good way, again, pairing with your neurologist, a really good way to say, can we help women navigate that pregnancy and postpartum period while incurring minimal disability?
Nicole tells us that she and her wife want to start a family, but they feel overwhelmed by all the decisions to make around the timing of BMTs, fertility treatments, and pregnancy itself. She's wondering where to start and who to talk to first, her neurologist or her OBGYN.
That is a great question. And I think it is incredibly overwhelming, especially because sometimes what we do in clinical practice is a little bit different, again, than maybe drug prescribing information may suggest. I think a really good place to start is certainly with your neurologist and making sure you're with, again, a neurologist, particularly an MS specialist who is very comfortable with family planning, pregnancy, the postpartum period, is an excellent place to start. Often those neurologists can help guide you towards OB-GYNs that may be good resources as well. And kind of thinking about how does my team, my OB team and my neurology team really work together to create an ideal care model for me.
Nicole also wants to know if there's a higher risk for complications during pregnancy or complications for the baby after birth if the mother's living with MS.
Great question. I think that is probably one of the most common questions I get asked. And really, in most of our studies that we've seen, looking at infants born to moms with MS, the biggest difference we see is often those infants are smaller in terms of birth weight. Now, things to point out is that doesn't mean that lower birth weight translates into neonatal ICU stays or anything like that. They're just a little bit smaller, and I think that's okay. In terms of complications during pregnancy, this is one of those time periods where we say what disease-modifying therapy you are on makes a difference. So there are certainly ones that have this risk of rebound disease activity if suddenly stopped. And kind of that quiescence I talked about in terms of relapses during pregnancy is not protective against rebound disease. So in those patients that are on S1P medications like sphingosine 1 phosphate receptor modulators, or on folks that are on natalizumab, we do see higher rates of rebound disease associated with those two classes. So really saying being on something like that and abruptly stopping with a positive pregnancy test could certainly increase risk of complications during pregnancy. Other things that are important to always keep in mind is making sure that we're really addressing comorbidities. You heard me mention that briefly at the beginning. But things like if we're prone to higher sugars, thinking about gestational diabetes or gestational hypertension, those are things that we want to make sure we're managing as well.
There have been studies that suggest that breastfeeding protects against MS relapses after having a baby. Is it safe to breastfeed, and could breastfeeding even be beneficial for women living with MS?
That's a great question. I think there's been multiple studies demonstrating, and this is not just in women with MS, the benefits for both mother and baby of breastfeeding. And I think that MS is no exception to that. In fact, with MS, we have found that women that are breastfeeding tend to have lower rates of postpartum relapses compared to their peers that are not breastfeeding. And we just tend to see a bigger benefit with those that are exclusively breastfeeding as opposed to those that are intermittently breastfeeding. Now, all of that being said, I think the other thing that's important to emphasize is that some women can't breastfeed. Sometimes it just doesn't work, and that is okay. As long as your baby is fed, it's great to breastfeed if you can and want to, but if you can't, I think there's other risk mitigation strategies in terms of thinking about reducing relapses postpartum.
That's beautiful.
Maya tells us that she was told to restart her
Yeah,
disease-modifying therapy as soon after delivery as possible.
Can I show the people?
But she's concerned about the medication getting into her breast milk. Is being on a DMT safe during breastfeeding?
Beautiful.
I think it depends on the DMT, which is obviously a very long discussion.
You're gonna make a different
but
one?
generally, when we think about how breastfeeding works and how milk production works, most often
stole my
after
cracker.
delivery, when most women start
stole one
lactating,
of my
they
crackers.
first start off with a type of breast milk called colostrum.
Bad as
It
a
then
mother.
transitions into transitional breast milk and then finally becomes mature breast milk. Now, mature breast milk really takes about 10 to 14 days postpartum to get to that point. And the reason this becomes important is because most of what we know about how medications, including disease-modifying therapies, get into breast milk is really in the sense of mature breast milk. So all of that being said, I'll talk about this as if we're only talking about mature breast milk going forward. When we think about medications, the smaller a medication, the easier it is for it to pass into breast milk. So thinking about our oral medications, those are ones that I would not want my patients breastfeeding on because there is easy passage of those medications into breast milk. Some of the larger medications, so thinking about the injections or the infusions, those have a trickier time getting into breast milk. So those are ones where we look at what we call relative infant dose, which is how much of this drug is seen in breast milk relative to how much is seen in mom's bloodstream. Now, there's different recommendations depending on which type of medication. So I think there are some that are safe for breastfeeding. The really neat thing is there's ongoing trials. For example, there's a big one looking at Ocrevus with breastfeeding right now that just wrapped up, and we should have the results of that hopefully in the next year or so. But I think there's ongoing studies and more data to come.
While the cause of MS is unknown, we know that there's a genetic component to the disease. Brandy told us that she's not sure she wants to take a chance of passing MS onto her child. So, given Brandy's concern, what's the risk of a child developing MS if they have a parent who's living with MS or if there's a history of MS in the family?
That is a great question, Brandy. I would say one thing that is really important to note is that MS is not entirely genetic. So I will take a quick little segue where if we think about identical twin studies where they looked at one individual that had MS, the other twin only had a 25 to 30% risk of having MS as well, which we would think about if something was truly genetic or could be passed on in identical twins. If one twin had it, we would expect it to be much higher. Now, we know there's a lot of really neat studies looking at what is the rate of MS in first-degree relatives if their parent has MS. And what we can really say is that rate is a little bit higher than the general population, but it's definitely not high enough where you say my child is definitely going to have MS. So for male infants or males of women or men with MS, that rate is somewhere between 1 to 3%. And for females of parents with MS, that rate is somewhere between 4 to 6%. So a little bit higher than our average person in the population, but it's not a guaranteed at all.
Menopause is another phase in a woman's life when hormones fluctuate. The effects of menopause can feel like some MS symptoms, and hot flashes and difficulty sleeping could make actual MS symptoms feel worse. How can the effects of menopause be best managed to minimize their impact on a woman's MS?
There are a few different ways that I think we could think about what can we do in terms of risk mitigation to minimize the effects of menopause. One option is to discuss with probably your gynecologist or primary care doctor the utilization of hormone replacement therapies to help minimize some of those symptoms during menopause. As of spring of last year, there was also a new medication that was approved on the market for symptoms like hot flashes in MS. And so that isn't, or symptoms of hot flashes in menopause, my apologies. And so that is also another consideration to think about. As always, when we think about ways to minimize feeling warm or hot, and whether that's hot tubs, showers, heat, thinking about some of those strategies like cooling towels, drinking cold water, fans, misting to increase kind of body surface area, where you're having evaporation, all of those are good strategies to think about using during menopause as well.
We heard from Jackie, and she's wondering whether menopause can affect MS relapses or disease progression.
That is a great question, Jackie, and I think this is an area where we're really blossoming in terms of research. One of the challenges with really truly assessing what's going on at this time is we get this overlap of MS and aging and menopause kind of all happening concurrently, and this often happens in the setting of other life changes as well. Often this is time when children go off to college or there's job changes. And so some of these can create compounding effects where it's really challenging to say how much of this is MS, how much of this is something else. We do not see higher rates of relapses from an MS standpoint during menopause, but there have been some older studies that said there may be a mild increase in disability. Now, the challenging part with this, again, is it's hard to separate out what might be these other compounding effects. So certainly something that we'll continue to keep studying. There's some ongoing studies looking at this. I think things that are going to be important at this period is really focusing in on the things that we know help us with wellness overall and wellness in MS, which is continuing to choose good foods to eat, continuing regular exercise, especially those things that are strength building, in terms of kind of building up and reducing risks of osteoporosis, and really kind of making sure that you're continuing to do cognitive engagement, whether that's cognitive exercises or working or other ways that you're engaging your brain.
During the postpartum phase and the menopausal transition, women may experience an increase in anxiety and depression. These symptoms are already more prevalent among people living with MS than they are in the general population. What types of support or resources are available to women during these phases of life?
I think one of the things for most individuals, not just including women, to realize, to your point exactly, John, is that we do see higher rates of anxiety and depression in patients with MS. And one of the things that I think is really important to keep in mind is taking away that stigma. And some of it, while we talk about all of this being in your head, I guess everything's in your head, including MS. And so really knowing that if that is something you're experiencing, it might be a symptom of the disease, it might be a symptom of some of these hormonal changes that happen during that postpartum period and with menopause. And so really not being afraid to seek out help. Things that can really be helpful is, one, the knowledge, which all of you are already doing by listening to this, that knowledge that could happen and paying attention to it. Really thinking about what are medication and non-medication ways to help with that, and some of those might be the non-medicine ways, which we know exercise helps with both. We know seeking out therapy resources or services can also be incredibly helpful, or support networks of other individuals with MS. And then, of course, thinking about some of these medications. One of the things that I always emphasize to my patients, especially if we're talking about one of these periods of postpartum or around that perimenopausal period, is just because we start a medication for this does not mean it's lifelong. It could be something we say we use for a finite period of time, and then we assess if we continue to need it. So really not being afraid to engage with some of that, I think, is important.
You've shared some great information and some important insights about women's health and MS. Let me ask you, what would you say is your top takeaway that you'd like our viewers to remember?
Well, gosh, that's a hard one because I could keep talking. But I would say the main thing to take away is, I think one of the coolest parts about how much we've accelerated as a field in terms of MS is I think there's a lot of ways for our patients to be able to accomplish the dreams they want, including family building, while minimizing risks to MS, and just making sure that you are developing a plan in concurrence with your neurologist that allows you to kind of fulfill what your goals are.
Well, I think we have time to answer one more question from our audience. So let me ask you, we heard from Patrick, who has MS, and Patrick's wondering if it's safe for him to be on an MS medication while
beautiful.
trying for a baby with his partner.
Great question.
And are these
So I would
curtains?
say to Patrick that we have limited information
Oh, cute.
about some of the disease-modifying
can you do me a favor? Can you bring
therapies
more
as it
crackers?
relates to males when
Yeah.
they're trying to
Please, thank
I'm
you.
gonna steal
conceive or
them.
trying for a
You're not gonna
baby with
steal
their
them.
partner.
Bring me some
Now,
more
the
crackers,
one
please.
exception to that is a medication called teriflunomide or Adagio. There has been evidence that this has been detected in sperm. So that would be a medication that I would feel a little bit weary about trying to conceive. Now, I think there's emerging data about
baby.
whether that actually has a clinical effect or not in terms of a developing fetus. But I
Oh,
think
yeah, I'll show it to the people.
until that data is clear, I think it's better to avoid
Okay, there.
being on a medication like teriflunomide
My
if
daughter's
you're
next
trying
drawing.
to conceive.
No flower.
Well, I want to thank everyone who
And
submitted
flower.
some great questions,
Curtains, even
and
got the
thank
little
you,
knots on
Dr.
it,
Shah,
little-
for being
little
with us
braids to
today.
hold the curtains in.
Absolutely. Thank you for having me and talking about this.
Before we
Boost,
close,
ladies
I
and
want to
gentlemen.
remind you that the National MS Society and the MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS.
Oh, is it?
You
Thank
can
you.
reach an MS Navigator by phone, email, or through the Society's website by chat. And for information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news,
Okay, go potty. Your crackers will be
information
right here
on
with the
connection
drawing.
programs like self-help groups and MS Friends. You'll hear about ways
Okay.
that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Shah for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website.
They don't
And
have
now
the new
I
one
have
on
a
there
favor
yet.
to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Anna Shah and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.
Welcome to this week's edition of Ask an MS Expert. I'm John Strum and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife Jean lived with progressive MS for 23 years. So I've had a front row seat experiencing all the ways that MS
the
can
fuck?
impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district.
Yo. Hold on.
Welcome to this week's edition of Ask an MS Expert.
Oh god.
I'm John Strum and I'm the host of the Real Talk MS podcast.
Oh god, why?
Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that
You know
people
what? We're gonna let it
affected by
run.
MS
I
need
don't
to
know. I don't know what happened
My
to
wife Jean lived with progressive MS for 23 years. So I've had a front row seat
All I know is this
experiencing
AI
all the
voice
ways
is
that
gonna drive me
MS can
nuts.
impact a family.
But we're gonna let it run.
I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. I'd like to acknowledge and thank today's contributing national sponsor EMD Serrano. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date and support through programs like Ask an MS Expert. Thanks to newer medications and treatment, people with MS are living longer than ever before. Longevity comes, aging, and for many people, the question of what to expect is growing older. Today we're talking with Dr. John Corboy about how to manage MS and related changes. Dr. Corboy is a professor of neurology at the University of Colorado School of Medicine and director of the Rocky Mountain Multiple Sclerosis Center at the University of Colorado. Welcome, Dr. Corboy. Thanks for joining us today. Thanks very much for having me, John. I'm happy and pleased to be here.
Okay, I can't do it.
appreciate it.
That was so bad.
Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch.
How you doing, sexy?
MS Navigators are online throughout today's program, answering those questions and connecting you to resources. Vision problems are very often the very first sign of MS. Fortunately, the prognosis for MS-related vision issues is often positive. Joining me to share strategies for navigating MS-related vision issues and provide guidance for managing and optimizing your vision is Dr. Shiv Saida. Dr. Saida is a professor of neurology in the Division of Neuroimmunology and Neurological Infections at Johns Hopkins Hospital. Dr. Saida maintains a commercial relationship with Genentech, Biogen, Novartis, Lapix Therapeutics, June Brain, Celgene, PG Therapeutics, Rewind Therapeutics, Kinixa Therapeutics, and InnoCare Pharma. Welcome, Dr. Saida, and thanks for being with us today.
Boy, he has a lot of
I hope you'll get
relationships.
us started by explaining some of the most common
How you
vision
doing, Nino?
issues that
What you up to,
individuals
bro?
with MS might face.
Yeah, certainly. So, I mean, I think as you've pointed out, visual problems are a common initial manifestation of MS. So, very commonly, inflammation of the optic nerve, which we refer to as optic neuritis, and that's the nerve that basically carries signals from the eye through the brain, but all the way through various pathways to the back of the brain where the visual centers sit. That can become inflamed as part of the MS disease process. And so optic neuritis is the initial manifestation of MS in about 25% of people, and it occurs in up to 50% of people at some point at various different points during the disease course. And so the symptoms of optic neuritis are often visual blurring or impairment in an eye. There's frequently associated pain with eye movements. And then very frequently there's a kind of a breakdown in color vision, differentiating kind of like bright and darker colors from one another. And like you pointed out, although it can be very scary and the visual impairment can be very marked at the beginning, frequently the visual recovery is actually very, very good. Now, the caveat to that statement is that the visual recovery is typically very good at what we call regular or high contrast vision. So at low contrast vision, which kind of refers to our ability to see things when the background illumination is not so good. So like, for example, in the evening time or at nighttime, or basically when the background is darker, the visual recovery is not always as excellent. And so the kind of degree of involvement of the optic nerve and the degree to which recovery occurs varies, although generally the prognosis is actually quite good. I think probably one of the most important things is to consider when somebody presents for the very first time with what we deem to be symptoms consistent with an optic neuritis event, that a condition like MS, as part of which it's frequently observed, stirs very frequently the clinical syndrome. Involvement of the optic nerve itself, which I'm going to refer to as optic neuropathy, is virtually ubiquitous as part of the MS disease process. So you say, well, what does virtually ubiquitous mean? Well, there have been post-mortem studies done that show that at time of death, regardless of whether somebody ever had an optic neuritis event, that up to 99% of people with MS actually have got
I needed to take a picture of my
plaques
ID
within their
but my wife still has
optic
it.
nerve. And obviously plaques are those areas of scar tissue where the immune system has been attacking that myelin or insulation
driving
sheet
around with
around
it.
the wires or cables that nerve cells use to kind of communicate and speak with one another. And that can manifest itself in a much more insidious way. So rather than producing this kind of like quick
never mind. I was
onset
trying
of
to set
visual
the freaking
impairment, there
TikTok
can
shop.
be like some
But okay.
gradual or mild affliction of the visual
Never mind.
system. Apart from difficulty with vision itself, I think another common way that MS can affect vision is through the nerves that actually innervate the muscles that control eye movements. And so sometimes people with MS will have difficulty with specific eye movements, and rather than having visual blurring, will often have double vision as the kind of clinical manifestation of that.
Why is early detection important in addressing vision problems and preserving visual function for people living with MS?
Yeah, I mean, I think that we could almost take the word vision out of that statement and apply it to anything, right? I mean, we could apply it to sensory function, motor function, bowel and bladder function. I think the one of the things that we're very aware of, and obviously there's a very strong kind of scientific literature to support this, is that earlier diagnosis of MS and the earlier institution of appropriate treatment for a particular person with MS imparts the best kind of possible outcome in terms of reducing the likelihood of disability accumulation over time. So I think really a lot of this has got to do with kind of trying to optimize the way that we just manage MS in general, which currently, although we're good, we've gotten better and we're good, we're still not fully there, right? I mean, currently one of our key goals in the clinic space is to try to reduce new kind of inflammatory activity, basically focal inflammatory activity, by either modulating or suppressing the immune system with our various different treatments that we have available, in an effort to try to keep people the way that they are, or try to maximize their current state of health. Of course, being very forward facing, it would be nice to have therapeutic options that are also aimed at, for example, improvement, right? And that are not just immune based. And hopefully, I think that is something that we can look forward to in the future.
I think you're right. Which brings me to my next question. We've heard from Sandra, who tells us she's been experiencing difficulties with her vision because of her MS. And she wants to know if her risk of experiencing more vision problems or losing her vision altogether is high, and whether there's anything she can do to make those outcomes less likely.
Yeah. So I think there's a few kind of things that I would point out. If the visual and obviously I said this at the beginning, that the visual kind of recovery tends to be pretty good from an optic neuritis event among people with MS. Now, it can result in severe visual impairment and poor recovery, but I would say that in somebody who has an optic neuritis event and the recovery is very poor, it's also very important on the clinical side to consider that we've actually gotten the diagnosis correct, because there are a number of other conditions that are related to MS, but they're not MS. And so one condition, for example, is called neuromyelitis optica or NMO spectrum disorder. Another one is called MOG-associated disease. MOG stands for myelin oligodendrocyte glycoprotein. I think really what I'm trying to point out here is, hey, you know what? Although there's this kind of like association between optic neuritis and MS, MS is not the only cause of optic neuritis. And if it's a very severe case of optic neuritis with very poor visual function and recovery, it's also very important to consider other diagnoses. Just in terms of, and this is something that I talk to patients who see me in clinic about, apart from the kind of therapeutic treatments that we have available, which are primarily aimed at, like I said, modulating or suppressing the immune system, it would be great to have neuroprotective and kind of reparative approaches. And while we may not have therapies, I do think that there are lifestyle factors that are extremely important. And I think this, again, can be applied beyond the visual system. And so I really spend a lot of time talking about the role and benefit of diet and exercise. I mean, when we look at the data for example, a Mediterranean style diet, it's been shown that people who follow a Mediterranean style diet who don't have MS have got higher brain volumes, higher cognitive function, higher energy levels, better mood. And then when it's looked at in an MS, it seems to be associated with improved outcomes as well. Similarly, exercise is probably within our wheelhouse, our current kind of most potent neuroprotective and reparative approach that is available. It's kind of fascinating because we were kind of taught when you're medical students. Unfortunately, I haven't been a medical student for quite some time. But what we were taught is that there's very little kind of regenerative capacity within the central nervous system, and by that I'm referring to kind of brain and spinal cord. But when you actually look at and you can radio label nerve cells in mice, and when you make them run on a rotowheel, in a dose response to the amount of running that they do, you actually see a greater amount of new nerve cell development, particularly within the kind of hippocampal regions of their brains. And then there's been some spinal fluid biomarkers that have actually been shown to be associated with an increase, again, in a dose response to exercise. And I just want to borrow some literature that's not from MS. When you actually look at data for the role of exercise in dementia, which is a truly neurodegenerative disorder, and of course there's a number of different types of dementia.
So dumb. Okay.
There was a wonderful study done in France where they showed that people who had mild cognitive impairment, which is a pre-Alzheimer's disease or pre-dementia disease state, that the individuals who received the highest dose of combined aerobic and anaerobic exercise actually had a reduction in conversion from this mild cognitive impairment to clinically definite dementia by about 40%. So whenever we talk about preservation of neurological function and status, I think it's very important to say that we've got two different things. We have drugs and we have therapies that we use, but you just can't get away from the importance of the lifestyle factors. Of course, the other side of it is that and we're moving towards this, right? We're kind of interested in precision care. And so we have kind of treatments that are kind of generally, you could bucket them as being kind of low, intermediate, or high potency, and then you can kind of tie that with risk. And you could kind of say that risk associated with those treatments can either be low, medium, or high, and it's often tied to the degree of potency of the treatment. But it is also about trying to take an individual person and assess what the state of their MS actually is. Now, of course, we're often doing this kind of like at cross-sectional time points, but then over time, we're also getting a flavor for how things are changing over time, or hopefully not changing. And I'm trying to give somebody the best appropriate treatment, right? In an effort to try to reduce the risk of having further inflammatory events. So I think there's two things. If you've had an event within the visual system, let's say an optic neuritis, of course you want to be on the best treatment for you based off of a number of different parameters. We can certainly explore that if we want to try to arrive at what's the best treatment you should be on. But on top of that, there should also be kind of these lifestyle efforts to promote protection and potentially repair, which are fundamentally grounded principally in diet and exercise. And then there's a number of other things. John, it's been very, very clearly shown that people with MS who have poorly controlled blood pressure, diabetes, dyslipidemia, that their outcomes are worse over time. And it kind of makes sense, right? These are vascular risk factors, and vascular disease occurs in the brain just as much as it occurs in other parts of the body, like in the heart, for example. And so vascular disease occurring in the brain of somebody with MS is kind of like throwing oil in on top of a fire, so to speak. And so it's really important to try to control those vascular comorbidities as much as possible. Weight is an important thing, and we know, for example, and I've actually done some studies looking at this, that even if you're on higher potency treatments, the effectiveness of those treatments is not quite as good in the setting of a higher BMI. And I think one other thing that we know from the vascular realm is that MS patients, for example, who smoke have a 2 to 3 times higher relapse rate than MS patients that do not smoke. And so I think, it's not just about a drug, it's kind of like a holistic approach to this disease to try to really kind of tackle it from as many different angles as possible.
Francesca tells us that she thinks her vision issues are related to her MS, and she's wondering whether she still has to see an eye doctor, even though she's already seeing a neurologist to manage her MS.
Yeah, good question. I mean, obviously, we shouldn't assume that what happens to somebody with MS is always related to their MS, right? This is the caveat that we come across, and this is how general medical things often get missed. And unfortunately, as we get older, we're all more prone to getting additional things, and that unfortunately also applies to people with MS too. And so as we age, we're at greater risk of cataracts, glaucoma, age-related macular degeneration, and I generally advise people with MS to have an annual healthy eye screen exam with an eye doctor at least once a year. I think that's following some of the other basic principles of, hey, you should see your PCP once a year, because again, you're meant to stay on top of your general health and make sure you're getting your cancer screening done when you're meant to be. And again, within the context of some of the treatments, I think also seeing a dermatologist, for example, once a year may be important too.
William tells us he's wondering about what he can do to reduce his discomfort and prevent further damage to his vision while he waits for his doctor's appointment.
Okay. Wow. I mean, I think so. I'm going to have to bring this back to some basic medical principles. But we covered actually a lot of the answer to that question, just in terms of what are the strategies you can do for preserving, not just vision, but nervous system integrity through diet and exercise. I will say, if somebody who has MS or is suspected to have MS is in a state of limbo, meaning that they're hanging out waiting for a doctor's appointment, If something happens and they're really concerned, then I think it's really important to seek appropriate, like urgent medical care. So if something is changing or something is occurring, I think that it's really important to actually try to like push to be either seen sooner, but also not to take chances or risks, and to appropriately seek urgent or emergent medical care when it's necessary.
Are there medications or therapies that minimize optic nerve damage in individuals with MS? And if there are, how effective are these interventions?
Yeah. I mean, I think that this is again something a little bit similar to what I kind of discussed. I don't know that any of this is specific, particularly for the visual system and optic nerve affliction per se in people with MS. I think that we have treatments available that some of which are excellent at reducing the risk of further new focal inflammatory activity. So, for example, optic neuritis, as well as subclinical, inflammatory events, right? Because not everything is associated with symptoms. I think that a lot of and this is like kind of very similar to like if there's like, let's just say somebody has an episode of inflammation in their spinal cord as well, right? And they have difficulty walking afterwards. We really, 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 really want strategies for neuroprotection and repair. And of course, we don't have any treatments, but we do have lifestyle strategies. And I'm just going to be like a broken down record about this, because I'm going to give an example of how important this lifestyle stuff is in my view, and it's difficult to study, by the way, but I don't think that any treatment that a person with MS is on is actually being given its best opportunity to be optimized and work at its kind of like best level in the absence of kind of like general healthcare, meaning like these general kind of lifestyle factors. And my analogy is, if somebody is the same as, if somebody has lung cancer and they're getting chemotherapy, but they're continuing to smoke, it's counterproductive. I feel like people with MS who are on excellent treatments, if they're not managing their general health, I think it really does interfere with outcomes.
Are there emerging treatments that might hold promise for improving visual outcomes for people living with MS?
So I think that there are emerging treatments that may improve outcomes, not just for visual issues, but all issues, hopefully, with people with MS, right? And again, I kind of just want to maybe broadly explain this, right? We've got one approach right now, right, that we employ. We either modulate or suppress the immune system. That's the way that we kind of like try to modify the disease process. Of course, we have symptomatic treatments that we use to try and improve symptoms, but they're not modulating the disease process itself. The other two buckets, and I've said this, that we really kind of want to be able to target are we want to be able to target neurodegeneration, so that requires neuroprotective therapies. And we want to be able to target the demyelination that's present, right? So the insufficient amounts of myelin, or sometimes no myelin, that this insulation that's wrapped around the wires or cables that nerve cells are using to communicate. And so we want remyelinating therapies, right? Therapies to promote that. And the good news is that for both neuroprotective, in other words, trying to keep things the way they are, and remyelinating, in other words, trying to make things better, there is a whole slew of treatments that have been developed and that are either going into or have already started to go into clinical trials. And so I'm really, really optimistic about the future of treatment, not just kind of targeting these immune mechanisms.
I know you recently co-authored research on socioeconomic disparity and its association with faster retinal neurodegeneration in MS. What did you learn in conducting your research?
Yeah, I mean, I think this is actually very much probably aligned with several of the statements and comments that I've been making up until now. The association between worse outcomes, and basically we were not really looking so much at visual function, but we were looking at something called OCT, or optical coherence tomography, which is a kind of non-invasive imaging technique that allows us to measure nerves in the back of the eye. This was a study that was led by Kate Fitzgerald at our institute. The basic kind of, in a nutshell, people who are unfortunately more disadvantaged from a socioeconomic status tend to have worse outcomes. And actually, we also found, for example, that people who were more disadvantaged socioeconomically, they were actually more likely to be escalated or moved to more potent disease-modifying treatments as well. And to me, this is a very kind of, it's almost like a non-specific thing. It's kind of like the BMI data, right? The body mass index data. People of higher BMI with MS tend to have faster rates of brain and retinal tissue loss over time who have MS. And I think it all comes back, I suspect, kind of general healthcare factors. Diet, exercise, control of comorbidities, blood pressure, cholesterol.
It took up the whole
blood
page.
sugars and diabetes, smoking status. And there's data
Yep, let me see.
in other countries, for example, as well, that
That's
show
adorable.
that this is relevant. Separate to that, and I think there can be
So
sometimes a
this
little
is
bit
water.
of
Is this
confusion
just an
about this.
empty space in the cup?
Separate to the
Okay.
socioeconomic status, race is obviously very important as well, right? I mean,
Okay,
we've
show off your artwork, you can take
previously,
it with you.
I've actually previously published a paper looking at,
Artwork.
we had about 115
From the
white
baby books.
Americans and
Thank you.
115 black Americans who we were tracking, again, with OCT at our center with this imaging technique. And what we found was that rates of retinal tissue loss as well as brain tissue loss over time was faster among our black patients, and it was it was kind of regardless
Was it because there's only 4 of us in the house?
of the potency of treatments that they were on. So it's not all.
Okay.
And actually, there's some expansion studies that have been done that actually show that it's not always an access thing.
Okay, Lydia, probably
that
not.
even when people have similar access to the health system, that race is important, sex is important, because men
okay.
tend to do worse with MS than women, but then also socioeconomic status is important as well. So there's a number of different factors that feed into outcomes.
Well, you've shared some important information about how to best manage vision problems in MS today. Let me ask you, what would you say is your top takeaway that you'd like our viewers to remember?
Yeah. I think you probably can already predict what my top takeaway is.
I think so.
Because I'm pretty consistent about this. I think that it's important, obviously, to try to get on the best treatment that makes sense from a risk-benefit point of view to maximize the ability to prevent further inflammatory events and tissue damage from occurring. But that in itself doesn't necessarily change what's already happened. And often when you get to that point, or when a person gets to that point, and they have any disability, they're
just wanna make sure the
obviously
color
very
on this text
keen
is
to try
white.
to
It's so hard.
improve upon what's already there.
I guess it really wouldn't matter,
And I
'cause it
think
depends on
that's
the color
where
of
lifestyle
paper.
comes in. Diet, exercise, and looking after one's general kind of like health overall.
I think that's such a great takeaway, because these are things people can do for themselves today. Doesn't require a prescription, doesn't require a pill, injection, or infusion. And as you've said, there's so much evidence that indicates it makes things better.
Yeah, no, absolutely. I will say, and I'm sure you're very aware of this, but if you just move out, I know, of course, this is an MS, focused talk, but if we just park up MS for 1 minute and we just say, let's just look at disease in general in the developed world, right? So Western countries. Sadly, John, 75% of chronic conditions can probably be alleviated through lifestyle alone, but they represent the largest bucket of healthcare utilization in Western Europe and in the USA.
Well, I want to thank you for sharing your expertise with us, Dr. Saida. I think we have time to answer one more question from our audience, and it's from Margarita, who recently heard about Uthoff's phenomenon and would like to know more about it. So maybe you can explain what Uthoff's phenomenon is and how it relates to vision problems in MS.
Oh, I love that question. Okay, so you know what? It's actually kind of interesting. Uthoff's essentially, the way that we interpret it now is different to the way that it was originally interpreted, right? So I'll give you our current day interpretation of it. Our current day interpretation of it is that it's heat-related increases in MS symptoms, right? So what's the mechanism of it? We know, for example, that in MS, right, because of the attacks that have occurred, and hopefully there's no more attacks occurring because we have somebody on a good treatment and they're looking after themselves, there is either no or insufficient amounts of myelin, right, around the nerve fibers or the nerve cables. And myelin as an insulation sheet it's one of its functions, apart from subserving protection, is to promote very smooth conduction or movement of electrical signals or impulses, because that's how nerve cells basically work, right? And so when there isn't enough myelin there, or there's no myelin, the type of conduction or the way that the signals move, they change. The technical term is they actually move from what's called saltatory, so a jumping type of thing, to like membrane conduction. But the net effect is that everything slows down. So the speed of movement of signals slows down. If you take a normal nerve and you heat it up in the lab, the speed at which the signals move down that nerve slow down. So if things are already moving a little bit slowly and you heat up the nervous system, things will move even more slowly. And so what that does is that it allows symptoms to either come back, right, so recrudesce, or existing symptoms to get worse. And the way that we can heat up the nervous system is one of two ways. You can either be out in the heat, which is actually not as effective at doing this as the other way, which is actually physical activity, right? Because when you exercise or you undergo physical activity, it increases core body temperature.
Okay, I love you.
And so the symptoms such as let's just take the optic nerve as an example. Sometimes people will have will either have a return or an increase in visual blurring related to the heat. But then once they cool back down again, the speed at which the signals move through the nerves picks back up and the symptoms go back down. The original description was by a German neurologist. His name was Uthoff, and it was actually in young women. This was the original description around the time of menstruation, and that around the time of menstruation that some of these younger patients with MS would have an increase in the experience of their MS symptoms, and possibly it's related to hormonal changes at the time of menstruation, which increases core body temperature. So obviously our current day description of it and utilization of it is a little bit different to the way that it was originally described by this German neurologist.
Well, I want to thank everyone who submitted some great questions today, and thank you, Dr. Saida, for being with us.
Well, thank you so much for having me, and thank you all for the great questions. It's been a real pleasure.
Another one that they duplicated.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways to get involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Saida for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Shiv Saida and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife Jean lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions, connecting you to resources. Progressive MS can have a significant impact on so many aspects of daily life, including mobility, driving, personal care, cognitive skills, and even mood. Rehabilitation is an important part of treating MS, and there are tools that can help enhance mobility while promoting safety and independence for people living with progressive MS. Doctors Deborah Backus and Brad Willingham are joining me today to talk about the tools and technology that are being used today in rehabilitation. Deborah Backus is the Vice President of Research and Innovation at the Shepherd Center in Atlanta, Georgia. Dr. Backus is a researcher, physical therapist, and educator with more than 30 years of experience in the neurorehabilitation field. Brad Willingham is the Director of MS Research at the Shepherd Center. His work focuses on the development of innovative technologies and strategies to advance neurorehabilitation. Dr. Backus, Dr. Willingham, welcome. Thanks for being with us today.
Thank you for having us.
Yes, thank you.
Well, let's start with some basics. Dr. Backus, what is rehabilitation, and why is it important to start a rehabilitation program soon after getting diagnosed with MS?
Well, actually, John, you just beautifully defined rehabilitation. It is a set of strategies that help people return to function, and that could be mobility or arm and hand use, bowel and bladder, sexual function, helping people to return to function, to return to their health, and to live the fullest life possible. And it's a tool that we need, because while there have been so many advances in disease-modifying therapies, drugs that help people with managing the progression of MS, and there have been advancements in symptom management, oftentimes symptoms remain. Progression sometimes still occurs, and there are things that rehabilitation can offer. So getting evaluated early after diagnosis and whenever things change with MS is really critical, so that we can determine, do they need physical therapy, occupational therapy, speech therapy, or other tools or interventions to help them get back to function, stay as functional and as healthy as possible.
Dr. Backus, I think you just started to answer my very next question.
Oh.
I think that when people think about rehabilitation, physical therapy, and exercise, maybe the first things that come to mind, but the list really doesn't stop there. What other rehab therapies exist for people with progressive MS?
Oh, exactly. And you're right. I did start to answer those. So it is really critical that people consider where their problems lie. But for instance, if somebody has problems with their hands, they've lost dexterity, or they've lost function and ability to lift their arms or to control their arms in space, it may make it hard to go, they might be able to walk across the room, but they can't open the refrigerator to grab themselves a Coke or a soda or something. So occupational therapy can help them restore the function in their arms and hands, maintain that function. Speech and language pathology can help not only with, sometimes there are speech problems with actually forming the words and clearly speaking. So that's obvious, a speech therapist could help with that. But speech therapists can also help with some of the cognitive deficits that occur, such as slowness in processing, being able to get through those thoughts at the pace that people would like, memory, strategies for visual spatial processing, all of that. Speech language pathologists can also help with that. And then there are services around, people don't often think about this. Physical therapy isn't just about walking. Physical therapy is about being able to move around in bed, being able to get safely from a scooter or to another surface, or a wheelchair to another surface. But it also includes things related to bowel and bladder function, how to be able to, function for elimination and control the bladder. There are tools that people can use for those too. So, the symptoms of MS are so heterogeneous and variable, but there are therapies that can address a lot of them.
Dr. Willingham, we heard from Catherine, who lives with progressive MS and uses a wheelchair for mobility. And Catherine wants to know how she can independently exercise while in her chair, and she's wondering whether there are any tools available that might help her.
Yes, Catherine, this is a great question because it highlights that exercise can be safe and effective for folks with a wide range of ability levels. And there are many ways you can engage in health promoting activities while remaining in a wheelchair. So in terms of resistance exercises, those exercises that improve muscle size and muscle strength, can use free weights or tools such as resistance bands to get some resistance to your muscles. You can even use some soup cans or water bottles laying around the house to curl those weights up or press them overhead. Overhead may be a little more challenging. In core stability, you may need a chest strap or a fitness partner to help stabilize. But there are great exercises that scientific research has shown can result in improvements in strength and range of motion. With aerobic activities, so those exercises that get your heart rate up, get your breathing rate up, they can improve your heart health and your lung health and metabolic health. There's exercises you can do while remaining seated in a wheelchair as well. So using tools such as a arm cycle. So this is a cycle that you use your arms to pedal. You can apply resistance, get your heart rate up, breathing rate up, and also just do some spinning of the arms, shadow boxing. There's actually some scientific research showing that seated dance can have a profound impact on physical and mental health. So it's all about finding the exercises that are safe but also enjoyable for you. And if the things I mentioned maybe a little bit too much too soon, start with some posture exercises. And so bringing the shoulder blades back, engaging the core, sitting up straight, holding that 30, 60 seconds at a time. Incorporate some controlled breathing, slow, deep breaths, engaging those core muscles. So there's many ways we can adapt exercise that all have benefits for physical and mental health.
I wonder, could I add something, John?
Of
Because all
course.
those are awesome, fabulous. And I would love to share, some of our work in functional electrical stim interventions, showing that people can cycle with electrical stimulation on their legs, which is also been shown to be beneficial not only for people with relapsing remitting MS, but also progressive MS to reduce their symptoms. So we've done a lot of work in that area, and we've been really pleased with the outcomes.
This is a perfect segue into the next topic I'd like to get into. You know, like so many areas of our lives, advancements in technology are expanding the rehabilitation landscape. Adaptive devices like voice-activated home systems and even robotic arms can help people with progressive MS attain better health and wellness while maintaining their independence. So let's talk about some of the tools that are available today. Dr. Backus, I want to circle back to FES in just a moment. First, we have a question from Charlie, who says he experiences foot drop, which causes him to often trip and sometimes fall. Charlie's physical therapist recommended using a brace called an ankle foot orthosis, also known as an AFO. Can you tell us about AFOs and explain their benefits?
Yes, absolutely. So as you said, they are braces. They usually go around the foot and fit into a shoe. And then you can come up the calf, and they help, based on how they're set up, control the knee and the ankle. So they can be very rigid and hard to help prevent the foot from moving at all so it doesn't drop down. The dropping down causes people to trip. So this prevents it from doing that. But there can also be some flexibility depending on how strong somebody is. And if they have a weak knee, it can help control the buckling of the knee or what's called hyperextension, where the knee snaps back. So it can be a very useful tool for some people.
Well, Dr. Backus, we just heard from Samantha, who also experiences foot drop and weakness in her thighs. And she said an AFO device didn't work for her. So instead, she's trying something you mentioned a moment ago, functional electrical stimulation, or FES. Can you explain a bit more about how FES works and how it can help people with mobility challenges?
Absolutely. So functional electrical stim is providing stimulation to activate the muscles or make the muscles contract. And notably, most of the
People on
interventions
these
that we
photos,
use,
these models,
and especially for
so
foot
happy to
drop,
be
are
here.
surface electrodes. So they're little pads that go over the muscles. They can go over the muscles in the lower leg, or they can go on the thigh muscles, and actually even on muscles in their buttocks or their trunk, depending on the intervention. But for something to replace an AFO, when people have foot drop or they have weak knees, they can get stimulation devices, and there are a couple of companies that make them, that provide stimulation to the thigh muscles or the calf muscles while somebody is walking, and they are set up so that they're timed to the right phase of walking, so that when you need to put weight on your leg to come over your leg, it stimulates the thigh muscles so that the knee doesn't give out. And as you go to lift up your foot, it can stimulate the foot muscles so that you can lift up your foot safely. So oftentimes that's a very useful tool, and it can be used in two ways. One, it can be used like the brace. Like if somebody is very, very, very weak and they're not improving in strength, they can continue to use this device just like they would a brace. But it's also been shown in some people that that when they have used it for a while, their muscles do start to get stronger, and so they might be able to stop using that device. So FES can be used to replace muscle function, or it can also be used to help strengthen muscle function. So we use it in both ways.
Dr. Willingham, Judy tells us that she's lived with primary progressive MS for 10 years. She gets fatigued easily when lifting weights. So now Judy does low load resistance training with blood flow restriction, or BFR. What is blood flow restriction training, and what are the benefits and risks associated with BFR for people with MS?
Yes, blood flow restriction training, that's a very interesting topic. So blood flow restriction training has actually been something that folks have been looking into for quite some time, about 50 years, starting in Tokyo, I believe. And initially it was explored as, okay, can blood flow restriction enhance the benefits of exercise, right? So in general, when we exercise, we're creating a signal to our body, and that signal is what results in all the wonderful adaptations: increase in muscle strength, increase in metabolic health, cardiovascular health. And so the idea with blood flow restriction is, by restricting blood flow to the muscles during exercise, can we enhance that signal, and therefore can we enhance the benefits? And so this may be very interesting to explore in folks who experience muscle weakness
Oh,
or
okay.
fatigue, who may not be able to exercise at very high intensities or for prolonged periods of time. So the question becomes, okay, so if we use blood flow restriction, can we enhance the benefits or the signal that comes from lower intensity exercises or shorter duration exercises? And there's definitely been some research exploring the benefits of blood flow restriction exercise in folks living with neurologic conditions. And specifically in the past half decade, there's been some work at the United States and Italy exploring the benefits of blood flow restriction exercise in folks living with MS. And so overall, the evidence suggests that blood flow restriction exercise is safe and well tolerated in folks living with MS. So when you are restricting the blood flow, you do cause a little bit more robust of a signal. So that may come with a little bit more sensitivity to those exercises. However, by and large, it seems to be well tolerated and safe. In terms of its effectiveness, there still needs to be a little bit more work done to determine whether blood flow restriction exercises is in fact more beneficial than conventional exercise or exercise without restricting blood flow. So a little bit more work is needed to determine its effectiveness. However, I'm excited to see where this field of research goes, because anytime a treatment can be, done independently with low risk, non-invasive, it has a lot of promise to provide an accessible and affordable solution. So looking forward to see where this goes.
Dr. Backus.
Yes.
Complex rehabilitation technology is a category of specialized equipment that's medically necessary and individually configured. This includes power wheelchairs and adaptive seating systems. What other types of equipment fall into this category? And maybe you can talk about why these kinds of devices are so important.
Well, if we stick with the mobility devices, there's also scooters, which are very useful for people that have the kind of symptoms and mobility challenges that people with MS have. There are assistive devices besides the AFOs, canes and walkers and such that can be useful. Walkers that actually have seats in them, so that if somebody gets fatigued, they can turn around and sit down in their walker, and then they can continue to walk. There are standing devices, standing wheelchair devices, and standing frames that are less commonly used, but can be used for people that have extreme paralysis. And there is an increasing research around and prescription of robotic devices for ambulation, for walking, that could be useful as well. In order to get those devices, somebody needs to be carefully evaluated. So depending on what they're looking for, I would recommend an assessment by a specialist physical or occupational therapist who knows about mobility devices. We here at Shepherd, we have a seating clinic where they get comprehensively evaluated to see if a new tool would be appropriate for them. That gives them a full assessment of what their abilities are and where their limitations are and what would be best. Should they go from a manual chair to a power chair? For some people, the power chair just allows them to do so much more in their daily life, so they're not quite so tired. But other people prefer to stay in a manual wheelchair because it's lightweight and easier to move around. But the specialist can help with that.
Dr. Backus, we heard from Angel, who says that he's having trouble transferring in and out of his manual wheelchair. And Angel's thinking about getting a power wheelchair and specialized seating, and he wants to know what's involved in upgrading from a manual chair to complex rehab technology, and which specialists should be involved in that process.
Yeah, so mentioned a little bit about that. In order to get upgraded or changed, a prescription is necessary. For insurance to cover a new wheelchair, a prescription is necessary, and a physical or occupational therapist with seating experience, what's called seating experience, who knows the different wheelchairs and knows how to do the assessment would be best. But it doesn't necessarily have to be a seating clinic like we have, but somebody who can look at the abilities look at where they need help, look at the size, look at the environment they're going to be in, and the activities that they're going to want to do would be very helpful. And sometimes it's a challenge if somebody needs to change their wheelchair very soon after they got one. That can be a challenge with insurance. So involving the physician in that discussion for the prescription is very meaningful, so that they can help support the medical necessity or the necessity for a device like that.
Dr. Backus, for people with progressive MS who have lost the use of their arms or hands, a robotic arm can be life-changing. Can you tell us a little bit about what a robotic arm can do?
So robotic arms can most effectively help with control at the elbow and the wrist and hand. So they can help with hand opening and hand closing. There's upper extremity arm and hand use in people with MS is one of the least studied areas. So we can draw on literature from people with similar types of impairments. So weakness, spasticity, loss of dexterity and sensation, like spinal cord injury. And what, like you said, if they can learn to use these tools, oftentimes it can make the difference in how, whether or not they can feed themselves, dress themselves, manage things in their everyday environment. So it can be a very useful tool.
Dr. Backus, Kyle tells us that he knows a robotic arm is very expensive, and some of the other tools we've discussed are quite costly. He wants to know whether insurance covers these devices or are financial assistance programs available?
Yes, so it's very difficult to get these devices covered by insurance. And so there are oftentimes state programs. The National MS Society has some financial programs for tools. There is limited literature and limited research. So because that evidence base is not that strong yet, it's still a challenge.
You know, when you think about progressive MS, people often think of mobility, but it can also make it difficult to move around or manipulate small tech devices that require fine motor control, like a smartphone, for instance. Now, the good news is that voice-activated systems can make those sorts of things more accessible for individuals who face these challenges. Dr. Willingham, what are some common voice-activated systems people can use? And I'm hoping you can share some examples of how this technology can help someone who's living with MS.
Absolutely. Voice-activated systems can be very helpful in promoting accessibility. As you just referenced, most of today's mobile phones, devices, tablets, even desktop computers, out of the box, they come with voice-activated systems. And so these voice-activated systems can be very helpful with a wide range of tasks for your digital devices, such as setting reminders, or asking questions about the weather, or simple questions for the internet.
Holy fuck, is this wrong?
Text messages, emails, make phone calls, and with desktop computers, many of the voice-activated systems can allow you to actually operate the computer, open up specific programs, even compose a document with voice dictation. So many ways these systems can help you in the digital domain. What's really interesting is what we've seen more recently is the transition to voice-activated systems into the physical domain. So we now have systems like Amazon Echo or Google Home or Apple HomePod, and these systems now bring voice activation to some of the hardware and appliances throughout your home. So through these systems, we can now have voice activation of a light, for a light switch, or a thermostat, or a door lock. So you can see how if you can manipulate lights, locks, and thermostats by voice activation, this may overcome barriers associated with small buttons, switches, or even areas of your own home that may not be too accessible. So in many ways across both the digital and the physical environments that these voice activation systems can improve accessibility.
So if someone is interested in setting up a voice-activated system in their home, where do they start?
I mean, I would suggest is starting with the need, thinking through, where are your barriers, right? Where are your trouble points? Is it, setting reminders? Is it writing text messages? Or is it more physical tasks such as light switch tasks? And once you identify those problem spots, then work backwards and find a solution from there. What is the technology that could potentially help? And so once you identify some technologies that may help overcome those barriers, start low, go slow. Same with exercise. Maybe test out some of these applications on your smartphone or your personal tablet, then maybe go to a smart speaker in your home, get used to the voice commands, the type of voice commands the system needs, whether you like it, make sure it's compatible with your other devices, and then slowly start adding things. Add some smart lights, add some smart locks. Then over time, you'll become more comfortable and you'll be able to even schedule things with the voice activation. Turn on my lights at this time, turn on my thermostat at this time. And so the accessibility will just grow from there.
Dr. Willingham, we heard from Cheryl, who says she keeps hearing all about AI and how it's changing our world. She wants to know whether AI is being used in rehab tools, and if it is, how can this technology help her and others who are living with MS?
Yes, great. Another great question. All the buzz around AI, and growing up not in data science, I always thought AI would come to us in the form of robots that look like us and talk like us, and that very well may be, but it's important to know that AI is actually being used right now to advance rehabilitative care and primary care as well. So one of the things AI does best is its ability to ingest large amounts of information and extract meaning and identify patterns in that information. And so why is this important for today's healthcare is we now have all of these different technologies, rehabilitation technologies, some we talked about today, and various medical devices. So you have your wearable sensors, your telehealth platforms, your electronic medical records. We have all these wonderful technologies that allow us to understand the needs and progress of patients in ways never thought possible. However, it's a little bit of a challenge on the other side is dealing with all of this data and making sense of all this data. And so something our work here at Shepherd and others are working on is, can we use AI to ingest large amounts of varying types of health information and make sense of it and identify patterns in there? And what we're seeing is that indeed it can, and AI is helping us to use health information to determine which treatments may be best for which folks. How may we best use our time, get the most out of our time in terms of rehabilitation, but also early detection. So detect issues early on before they escalate to more severe problems and take early action. And so these are some of the ways AI is being used right now and making a difference in today's care.
Dr. Willingham, Serena contacted us with two questions. She said, we haven't touched much on apps yet. She's wondering if there are any mindfulness or meditation apps that can help manage stress, anxiety, or other mental health aspects that are related to MS. And Serena also wants to know how digital health apps can complement her overall rehabilitation plan.
Yeah, absolutely. So, there are several mindfulness and meditation apps on the market, and some of the most popular, I think, are Headspace and Calm. And these apps and others, they provide extensive libraries of different guided, unguided meditation content, stress management tools, and as well as just some educational resources about self-management and mental health. And so these apps are great because they package all of this content into a very user-friendly app that fits on your smartphone in your pocket. You can carry around, and you can integrate these practices into your day-to-day life simply by just taking a moment, opening the app, and practicing some meditation or mindfulness. And in terms of integrating with your standard rehabilitation practice, they actually create a little bit of synergy with your rehabilitation practice, because based on the scientific research, practicing mindfulness and meditation may improve sleep, it may improve cognitive function, it may facilitate with pain management. And so you can imagine if you're getting better sleep or you're managing your pain, this may also allow you to engage at a deeper level in other aspects of your rehabilitative care, such as physical therapy or occupational therapy.
Dr. Willingham, we've talked about a lot of different tools today. With so many gadgets and apps available, how does someone know what tools are right for them?
Yes, and this partially gets me to one of the overarching messages for today is start with the need. So go through your day today, go through your specific exercise program, identify what are those barriers, what are those points of inaccessibility, and then work backwards from there to find a technology solution that works for you. There's a lot out there, as you mentioned, so it's easy to get caught up in what is the latest and greatest, or what is the most sophisticated or high tech. And sometimes you may not even need something that high tech or that sophisticated to overcome a barrier. So starting with the need, identifying potential solutions, and then thinking about what works with the technology you're already using. Compatibility is certainly an issue. And then also asking folks. A lot of times we are focused on outcomes, clinical outcomes, and there may be something that your provider or someone with a shared lived experience is using. And you know how it is with technology. You start using something, next thing you know, it's second nature. You don't even realize you're using it. And so asking folks with shared experiences or expertise, are there technology solutions for this or for this? It may, bring that to the front of their mind, and they may be able to, oh yeah, I use this all the time. It's great. So yeah, just using that crowdsourcing approach as well.
Well, I have a question for both of you, or I should say each of you. Innovation is at the core of what you both do every day. Can you tell us what you're currently working on, and maybe give us a preview of anything that we might see soon that people with MS should be looking forward to?
You want me to go first, or you go first?
It's up to you.
Well, I'll just give so one of the things that we started early on is to really focus on the people with MS who are underserved, and that includes people with progressive MS. So we have a heavy focus on finding and developing approaches to help people with progressive MS get back to function and to stay healthy. So we do a lot of work in functional electrical STEM. So with bikes, as we talked about, but also other ways of using functional electrical STEM combined with robotics and different ways of using the tools to help people with their everyday function. So that's a big focus, one of our big areas of focus. And the other is developing tools that will reach more people. So Shepherd Center, we are a center of excellence for MS care. And there are a few across the country, but they don't reach all of the people. So we focus on finding ways, tools that we can help develop, and then we can evaluate the effectiveness, but that we can push out and make available to more people around the world. And so we're working with a platform that provides some of the things we talked about today: exercise interventions, deliberately developed, specifically developed for people with MS, whether it's in the chair or standing, mindfulness approaches, meditation, cognitive training exercises, and we're evaluating the uptake of those tools and the barriers to those tools for people not only here at Shepherd, but in very rural communities, in other states and other countries, so that we can hopefully help more people. And then Brad's got a whole slew of things.
A lot of which are related. And so I guess we could just highlight some of the active projects right now. And so one of the key problems we've been working on is that the advancement for care for people living with MS, particularly progressive MS, is limited by the lack of tools that allow us to measure changes in physical function and health over time in the real world with high acuities. So we have many great tools that we can use currently in the clinic, to measure clinical disability, function, health, mental health. But most of these can only be used, on site in the clinic under supervision. And so we're limited in our ability to capture important changes that may occur between visits, and it could take several months to detect changes in a disease course or progression of disability. So this, slows down, early intervention. It slows down our ability to respond, but it also slows down the progress of clinical research. And the length of time it takes to explore new treatment strategies. And so as a solution, we're working with many great industry partners to develop and test some novel digital health solutions that are allowing us to expand clinical evaluation into the home, into the community, and drive scientific discovery as well. And so particularly we're working with some novel wearable sensors and some new intelligent data systems we're developing. And so using these new wearable sensors, we can create systems that can continuously evaluate a patient's needs, abilities, their progress in real time on a day-to-day basis, with the ultimate goal of allowing us to detect changes in physical function and health, in real time, immediately. This will allow us to identify, when a symptom begins to worsen, allows us to take action earlier, and treat these symptoms before they cause more severe problems. So all this hopefully also allow us to speed up research studies, allow research studies to be performed quicker in smaller groups of people, which may ultimately allow us to test new treatments faster, and so accelerate scientific discovery in that way.
Well, I think you both have opened a lot of eyes today about the possibilities that exist thanks to some of the latest rehabilitation tools that are available for people who are living with progressive MS. What would you each say is the single top takeaway that you'd like our viewers to remember? And Dr. Willingham, why don't we start with you?
Yeah, whether it's exercise, rehabilitation, or technology, something I always like to share with is start low, go slow, and something is better than nothing. And so there's a lot there. So when you look at the scientific research about exercise and rehab, or if you're looking at all of today's latest and greatest technologies, it's easy to get overwhelmed. We have access to so much information today. It's a little overwhelming. And so start with a specific need, a specific barrier that has an immediate impact on your life. And again, work backwards from there. Find a solution, start low, with exercise, find something you enjoy that you feel comfortable with, start at a cadence that's okay for you, right? You can break these exercise bouts up over time. You don't want to go all in too much too quick. And the same thing with technology. Piece these solutions together piece by piece. Start using voice activation on your home, work up to, where you're scheduling voice activated smart home systems. And so that's essentially my take home for all of this. And yeah, thank you again for having us. It's been a pleasure.
Dr. Backus, how about you? Your single top takeaway.
So my single top takeaway is seek rehab early, and don't be afraid to ask your neurologist to refer you to rehabilitation professionals. All of the strategies that Brad suggested are so critical and great, but still at times it can be very overwhelming. So there are specialists, there are physical therapists, occupational therapists, speech therapists who can help you. And neurologists, of course, they provide the best medical care, but they shouldn't wait until somebody falls to refer them to rehab. You need to get them evaluated, find out what the tools are used. Somebody who's an exerciser shouldn't have to stop exercising. They just need to find out how. So my takeaway is seek out that advice from the professionals when you have those questions. Don't wait, don't be afraid. Start early and do it often. Take care of yourself. So also thank you for having
I want to thank everyone who submitted some great questions today. And I want to thank Doctors Backus and Willingham for being with us. Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Drs. Backus and Willingham for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's program is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description, and on Twitch, find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Deborah Backus and Dr. Brad Willingham and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices. Welcome to this week's edition of Ask an MS Expert. I'm John.
All right, we're gonna end it here. I need a nap for one, and two, my brain is fried from trying to get merch going. Designing a fourth wall site. Got my first shirt up. Just waiting for, I got some samples on order now. But yeah, we won't talk more tomorrow. Tomorrow I'll be at work. But, yeah, maybe next Monday. We have an appointment on Monday in the afternoon, though. It's been real. Thank you for those that hung out and lurked. I appreciate it. It's been fantastic. Do we know anybody that's on right now? I guess the better question is, do I really want to bother trying to raid out somebody right now? Ain't none of you here. Is there anybody I know that's just chatting? There is. Now the question is, do I bombard somebody with 1,000 viewers with my one viewer? What is she doing? You know what? We will. We're gonna go raid Pizza Princess G. Does that sound weird? That does sound weird. The lady I stumbled across from a Twitch stream, or I say stumbled across. I was in a Twitch stream when they were there. But she's a nice lady. She works at her family's pizzeria somewhere on the East Coast. So we are gonna go stop and say hello. So feel free to copy paste our message in the chat. Otherwise, I will see you guys in the next one. Love all of you.